Day, December 7th meeting. And we're going to be meeting all day. It looks like we have a lot to work on, which is really good. But the first thing I'll do before I call us to order is just check in with our supervisors and have them say hello. So I'll go to District 1 to Patrice Horstman.
Yes, hello and good morning, everybody, and for the staff and my colleagues and for anybody in the public who might be on. I'm hoping we're going to get some snow today. So good to be with you today.
All right. I have a dirt pile I have to move. I want to wait until that's moved. All right, District 2, Geronimo Vasquez. Geronimo.
Good morning, everyone. Look forward to seeing everybody and having a very productive meeting. And it's interesting weather we're having, and it looks like we might get some white stuff. That's pretty cool, but excited to get some good work done today. And thank you, everyone, for being here and everybody who's watching and participating with us. You know, it's a team effort. So good job, everyone.
All right. And then District 4, Judy McKay, Supervisor.
Hey, everyone. Thank you for being on our meeting for today. And I want to say hello to all the staff, colleagues, and also the community, the public that are tuned into our meeting today. And I'm not really for snow, but I guess it's okay. But I'm always a cold person, so I just want to say thank you for being with us today.
All right. And then we have our Vice Chair, Lena Fell.
Thank you. And it is wonderful that we're talking about our weather and recognizing our Mother Earth, Father Sky, and just being blessed that we are here, and just a blessing that we all can convene and right now by virtual, but at least we're working to on behalf of our citizens and our residents, and just really moving forward, and really I'm happy with everything that is that the staff are doing on behalf of our community. So I'm just really excited about some of the work that is being done and being able to provide that information out to the public. I think that's very important, and thank you so much for joining us.
All right. So with that, we have a full board today, a lot to work through. First point of order is calling the meeting to order. And then if you could please rise and join me and face to the east if you don't have a flag, and we'll do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. And then the next item of business is the call to the public. And the call to the public is a courtesy that we offer so that anybody can bring an item to our attention. And we can't talk about it because it's not part of our agenda, but it allows the opportunity for items that are not on our agenda to be brought to our attention. And so our clerk of the board, Lindsay Daly, will explain how to use the public process if you wish to comment.
She may not have heard you, Mr. Chair.
She heard me, but her voice.
Oh,
yeah,
she okay.
We can't hear her.
So, Mr. Chair, members of the public can indicate online to raise their hand, and we will call on them as we see any hands raised on the attendee side. And then if you want to, I think it's *6 to unmute your phone. And so it will just keep an eye on the attendees and see if there's anybody in the attendee group that wishes to make a public comment at this time.
Okay, all right.
And I don't.
No, I don't either. I don't see anybody.
I see no hands raised on the attendee list, Mr. Chair, so I believe we're good on that end.
And Lindsay, can you come up visually just so I can see, and you can say, shake your head yes or no. Do you have any emails out there, Lindsay? Nope. There we go. All right. Yes.
That's tag teaming. You know, that's like,
Aren't we Zoomers, huh?
Yep.
All right. So next item of business is our consent agenda. And these are items 1 through 15. And these are items that normally are routine in nature. We've seen them in work sessions, the renewals of contracts and business that we can actually do in a single motion rather than working through each item through 15 items. However, we do pause to see if board members want to remove an item, but I've been asked by county manager to remove item 12. We can bring that one back next week. And so turning to our board, is there any item anybody would wish to separate? Oh my gosh, no, not today.
I only wanted to separate 12, but that's good. That's been removed.
yeah, and very quickly, Mr. Chair, if I could just quick comment on item 12. So these are the appointments for the Workforce Development Board. Those in addition to, well, there's several qualifiers to be on the board. It's private business rep, geographic, and then also some other considerations that I want to talk to. I do have a call into Billy Francis. I could not reach him before the meeting, but I did let him know that I just want to talk to him about the reappointments and then how we would be looking at representation that covers a number of different areas as well. So again, the individuals that are on there now, currently are very good contributing members. And so we just want to make sure that there are some other opportunities that we may be overlooking at this point in time. So I'll get with him, talk about how that selection process takes place. And then what the recruitment process is to look at membership and then bring that back to you perhaps as early as next week, but it may not be until the first of the year. So depending on what their reappointment timeframe is, if they're already at the end of their reappointment term, we might have to do a couple things. But again, I'll get more information and come back to the board on that. Okay.
And for the sake of the board, it provides a further opportunity for the board to give input on recommendations of members with that. So we're not, that item's, we're not going to move on that. We'll remove it, have it next board or one of the next board sessions when staff is ready to move it forward. So with that, not seeing anybody wishing to remove an item other than item 12, I'd consider a motion for approval of the consent agenda. Anybody care to have a motion by Supervisor Horstman? I need a second. I have a second by Vice Chair Fowler. Any comments? No comments. I'll call for the question. Or you have a comment, Supervisor Fowler?
No.
No. I'll call for the question. All in favor of the motion, vote aye. Aye. All right. And motion carries. Any opposed? None opposed. Motion carries unanimously. There we go. Sorry about that. I'm thinking ahead and trying to move this also. So the next item is that we need to resolve is the jail district board of directors for that consent agenda. Anybody care to make that motion?
So moved.
Motion by Supervisor Horstman. Need a second?
I'll second.
Okay, second by Vice Chair Fowler. Supervisor Vasquez, we need you to come off mute so we can hear your motions there.
Sorry.
That's all right. I've seen you wave a
My
couple
hand,
times.
but that wasn't enough, I guess.
Yeah,
So
yeah, and for the sake of the clerk, it helps her for the record on that as well. So fantastic. So I have a motion and a second. All in favor of the motion, vote aye.
Aye.
We're now acting in the capacity of the jail district board of directors unless a board member wants to separate. Anybody care to separate? Not seeing that, then I'd consider a motion for approval.
So moved.
Motion by Supervisor Horstman.
Second.
Second by Vice Chair or by Supervisor Begay. All in favor of the motion, vote aye.
Aye.
Aye. And that's the approval of the jail district consent agenda. That motion is approved unanimously. Next item, or next we need to resolve is the Board of Supervisors. Need a motion to do so.
a
So
motion
moved.
that we dissolve
Second.
supervisors.
All right, I have a motion by Supervisor Vasquez, a second by Vice Chair Fowler. All in favor of the motion, vote aye.
Aye.
We're now acting in the capacity of the Board of Supervisors again, and we are now moving into discussion and possible action items. The first item that we have after the consent agenda is item 17. It's a presentation, discussion, and update and possible action regarding the Coconino County response to COVID-19 pandemic. And I think I'm turning to County Manager Steve Peru before we get Kim Musselman up here.
Yeah, in fact, yeah, if we can transport Kim over to the attendee side or the panelist side. I'm going to be following my comments with regard to incentive program after Kim's presentation of the current COVID report. So let me see if I can, I don't see her. Let me just check out real quick. She might still be on the attendee side.
She's in the panels.
Oh, she here? Okay.
Yeah.
And good morning, everyone. Also, Erica Shaw needs to be promoted as well, please, so she can share the slides. I know Lindsay's having some technical difficulties, so if we could promote Erica as well, please.
And let's see, we'll help Lindsay and see if Erica's up.
Perfect. Looks like she's there, so.
Okay, there she is. Okay. You good, Kim?
I am.
All right. Fantastic.
Good morning, Chair Ryan, supervisors. Happy to be here this morning and have a COVID update to provide to you. I know it's been a couple of weeks and lots of developing information, so I'm happy to be here to share that with you this morning. So we'll go ahead and get started. Giving a overview here with respect to our data and our vaccination update. We continue to be in the high transmission and percent positivity and incident rate here in Coconino County. You'll see by the graph with the week ending November 27th that we actually had a decrease in cases, which was a good thing. However, when you'll see the next slide in just a moment, that appears to be correlated directly with the fact that there were lots of folks who were not being tested and otherwise were out doing Thanksgiving and traveling and being with family members. So unfortunately, as we go into this coming Friday's report for our week ending just this past Saturday, you'll see that those numbers have gone back up, and we've been at a pretty sustained and high transmission rate for the past several weeks. Our vaccination rates do continue to go up, and I'll get into a little more detail about that in just a moment, but certainly, still needing to make additional progress in that regard. As of the December 3rd posting for Arizona Department of Health Services, showing Arizona at about a 66.7% and Coconino at about 66.2%. We, of course, in our weekly reports reflect our vaccination rate, and we are specifically doing it by fully vaccinated. So our rate is slightly lower showing on our weekly report, but for the sake of consistency, continue to show you the data that's being provided by ADHS. So on the next slide is our epi curve, which I know you are all used to seeing. Just wanted to point out what I was mentioning just a few moments ago. You can see that as of last night, they pull these numbers twice a week. We were already at 519 cases for our week ending December 4th. It's likely that with the data lag and as we finish to put that data together, that number will potentially increase a bit as well. On the next slide is our testing, and you can see that even since the beginning of November, our numbers of folks being tested have decreased, from the week of November 6th to the week of November 27th, almost 50% decrease in numbers, total numbers of tests being conducted. Certainly last week, we anticipated that being significantly lower given the Thanksgiving holiday. But with that, you can see that we have our percent positivity still well over 10% as well. One of the things I'd just like to comment on with respect to testing is we continue to have a really significant availability with respect to testing. Of course, continuing to have the ASU NAU partnership with the saliva-based testing, as well as Embry Health and numerous other locations of pharmacies across the county, Canyonlands, up in Page, and others who are providing COVID testing. We also have the availability for folks to buy over-the-counter rapid tests. And so one of the things I just want to point out to all of you is that if someone does a rapid home self-test kit and they don't follow a positive result, let's say with a PCR, going and getting a PCR test, then there are potentially cases out there that are not even captured in terms of positives. The good news is people are using those take-home tests and are, if they are testing positive, hopefully they are doing the things that they need to, which is isolating and staying away from others until their symptoms have subsided and they have met that 10 days of isolation. But many people, as I'd indicated before, tend to also go get a follow-up or confirmation PCR. So we're still getting those numbers coming in. Next.
Kim?
Oh,
Kim, I have a question.
yes, ma'am.
We've been hearing on the news quite a bit about the home testing, and I'm wondering, are we providing those, or do they purchase those at the pharmacy, or where are people getting those tests?
Yeah, thank you, Vice Chair. Chair Ryan, supervisors. We are providing some of those test kits to our schools and our medical providers so that they can provide them and utilize them when patients are coming in, and then schools can utilize them. We are providing those to many of our private nonprofit entities, shelter entities, and others through a program that we are getting tests through ADHS. We are not able, at this time, we're not able to be just distributing them generally to the public. So many people are either getting them through the schools, other medical providers, and other participating partners, or yes, Vice Chair, purchasing them over the counter at many of the pharmacies carry them, as well as you can order them online as well. So folks are getting access to those in a multitude of ways.
And Mr. Chair, if I can, just a follow-up question on home testing as well. Kim, if you do test positive and you don't go in to get a follow-up test through Embry Health or NAU, should people be reporting their positive test result? And if so, where?
Yeah, we have not been specifically asking people to report the test to us. Any folks are absolutely welcome to contact us here at HHS to report a test if they so choose. Oftentimes what we are recommending when they call us as well is to go get a confirmation PCR test when they do call us, so that then that information does get uploaded into the ADHS system, and then that also then triggers all of the surveillance investigations and monitoring components of that process. But yes, we still continue to have our call center line open, and our investigations team and others continue to take calls from the public should they be calling in to report a positive test. We're not requiring it, but we definitely have folks who are calling in to report that information.
A follow-up on that?
Yeah, go ahead, Lena. Yeah.
Patrice, are you done? Okay, so if people are not reporting that they're positive, are we still doing the contact tracing?
Yes, Vice Chair, we're still doing lots of contact tracing because as you had seen just with the numbers that we are getting reports on, we still have, coming in this past week, well over 500 positive cases. So all of those cases are either being contact tracing, our investigations and our monitoring is continuing to be conducted both out of Health and Human Services here at Coconino County, as well as cases that we are sending and and sending down to Arizona Department of Health Services to conduct those investigations and monitoring on as well. So yes, lots of cases. All of those cases that are being reported are getting investigations and monitoring with them. Okay, unless there's any other follow-up questions about that, I'll go to the next slide. I just want to point out here the variants being monitored and the variants of concern by month. And I'm going to get a little bit more into Omicron here in just a moment. As we all know, that is the new variant that we're seeing a lot of in the media, and CDC has put out some additional information. But I wanted to point out, as you see by the color code here, that red is the Delta variant. I want to be very clear that the Delta variant is still the primary, and in fact, 100% of our sequenced cases for the month of November were the Delta variant. It is still very much the variant that is being passed around with anyone testing positive here in Coconino County. So just want to make that point that it's, while we have information about another variant right now, no cases have been confirmed for the Omicron variant here in Coconino County as I stand here right now. It doesn't mean that they're not being confirmed as well, but I did want to point that out. And again, just urge the continued diligence of our community and all of those, because Delta is still very much alive and well and is being transmitted among our community. Next slide, please. So a little more about Omicron. As you have all been hearing, just in a little less than 2 weeks of us hearing about the new variant, there have been several cases of COVID-19 caused by Omicron and that have been identified here in the US. As I said before, although I have not looked online just prior to getting on this meeting, we don't have any confirmed cases to my knowledge in the state of Arizona yet, but it is inevitable as community spread of the virus continues to be inevitable as well. What I want to point out in terms of the Omicron variant, as we continue to wait to see information, you're seeing a lot in the media, questions about, is it, does it have increased transmission? Are there different symptoms? All of those kinds of things. We're waiting for more information. There's a lot of speculation. There's a lot of hypothesis around that, but we are going to wait until we have some verification of that information. But in the meantime, what is important is, again, highlighting the importance of all of our precautions, specifically being that people need to get vaccinated. You need to get your booster if you haven't already. If you are eligible, everyone now 18 and older is eligible for a booster dose if they are post 6 months of receiving their 2-dose mRNA vaccine or 2 months following the Johnson & Johnson vaccine. So really want to encourage everyone who is post 6 months or post 2 months for Johnson & Johnson to get that booster if you haven't already. And again, continuing to follow those steps that are proven to reduce the spread, which includes our mask wearing in indoor public spaces, in our workspaces, and in our workplaces, and as we're out in public and in crowded venues as we continue to remain in the high transmission rate. Next slide, please. This just a little bit more again, as I was talking about the boosters for everyone 18 and older. As you may note, the CDC came out just last week with a stronger position. Initially, boosters were permissive, if you will, for those who were 18 to 45, and then older was the should, but now recommended that all of those eligible 18 and older should receive their booster dose. Just want to be clear that those under the age of 18 are not yet eligible to receive a booster dose. However, booster authorization for 16 and 17-year-olds has been submitted to the FDA for review and approval. So as soon as that information comes out for final approval, we will be sharing that. And again, just that reminder that CDC guidance does allow for individuals to choose which type of vaccine booster they receive, allowing for mixing and matching of the vaccines. And of course, we are providing that mix and match option at our county locations, and many of our partner locations are doing so, but not all of them. So I would ask folks to please make sure you call ahead if you have any questions about what type of booster doses are being offered. Next slide, please. So just a quick rundown. We've got a lot going on. The HHS team has been doing a phenomenal job continuing to administer vaccines and working with our partner entities. We've got some amazing partners out there who are providing all sorts of assistance in getting our community vaccinated and coordinating things with us. And we certainly could not be doing it without them. So just wanted to make a quick note here with respect to our Flagstaff Mall location. We saw a pretty significant uptick in participation last week after the Thanksgiving holiday, which was great. We did go back to offering both adult and child vaccines at our location. We do still have them separated in timeframes so that we can allow for some transition and also ensure safety with respect to all of the different types of vaccine and doses that are being administered. And so this week, because the mall has also extended their hours and open a little earlier, we are going to be opening at 10 a.m. and from 10 to 1 providing adult doses, and then being able to wrap up those and provide for a lunch break for our staff, and then resuming child vaccines from 2 to 5 p.m. For the next several Wednesdays and Fridays going into December, of course, excluding the 2 holidays, Christmas Eve and New Year's Eve in December. And we are waiting for information to determine if we're going to be able to continue at this location into the month of January. So more to come on that when we have some confirmation from our partners about that. A few other events I just want to highlight. If we can go to the next slide, please. We have on Thursday is an event up in Village at the IMAX Theater there, open to the public from 1:30 to 3, 12 and older, specifically for that event. And then on Saturday, the 18th, the team will be back up in Page and working with our partner Canyonlands, providing all ages and all vaccine types. We're still formulating the final location and times with our partners. So we'll be putting out that information to all of you and of course to the public. We've also been holding numerous events at nursing homes, doing some events with the shelters, and of course doing some additional planning for homebound individuals. So we're just working with our available resources as well as our other partners to see how we can best meet those needs of our community around the county. Next slide, please. Again, with all of our partner entities, continue to have PMG as a fantastic partner providing vaccines on Fridays in the mornings at the Elks Lodge for adults and children. And then also Friday, Saturday, and Sundays continuing at the Field House. Again, also providing vaccines for all ages and for adults and all children 5 to 17 years of age. There have also been several events that you may have been seeing and hearing about with our partners and in conjunction with the schools. And those are continuing, both with PMG doing some. And then of course, if we go to the next slide, we also have North Country Healthcare has been holding a couple of events as well with the schools. And then with Flagstaff Shelter Services providing clinics specifically for the shelter population. In addition to that, we continue to have, with our partners, also a location at Mountain View Pediatrics on Saturday and Sunday mornings, where vaccines are provided specifically to children 5 to 17 years old. So all of this information is, again, on the county's website. We continue to have lots of social media and other things, which I'm going to talk about here in just a minute. Our communications team has been doing a phenomenal job getting out information on social media. Appreciate all of you continuing to share that and push it out as well. Want to go to the next slide here and just talk briefly again about flu season being here. To date, we've had about 37 influenza cases identified in Coconino County. This is in line with our current average. So the flu is alive and well this year. It's not super high numbers, but it is again in line with our average. If you have not received your flu shot, we absolutely encourage our community to do so. They are available at multiple pharmacies across the county, at Vera Clinic, doctor's offices, and then of course here at HHS by appointment at our clinic. And children younger than 6 months are definitely at a higher risk of serious illness related to flu. And they are too young to be vaccinated. So we really want the people who care for those children and infants to make sure that they are vaccinated to protect their young children and grandchildren. Next slide, please. So just want to give a quick little overview here. I was speaking about all the communications that we've been putting out around COVID specifically, boosters, vaccination events, reminders, locations. Again, a huge shout out to our communications team and the work that they've been doing and getting a lot of visuals and things that are going out to the county. Also excited and to do a little plug too, for those of you who have not seen recently on our Health and Human Services side, and then of course on the county side also being shared, also really putting emphasis on advertising the other services that are available through HHS and with our partners around the county for things such as dental services, teen clinic and other things. So I think we're doing a good job getting a lot of traction out of those things and wanting to make sure that we are providing those services to address those health disparities around our county. So with that, the last slide I have before going to other questions is, again, that reminder to everyone, to our community, that we must do our part in stopping the spread of COVID and all upper respiratory illnesses. And in order to do that, we absolutely, first and foremost, have got to stay home when we are sick and have symptoms. Do not come to work. Do not go out into public. Do not attend family events, parties, other kinds of things. If you have symptoms of any kind, please, please, please stay home and keep all of us well. Continue to wear masks when you are out in public and in indoor settings. Of course, washing your hands with soap and water and maintaining that distance and being in well-ventilated spaces. So with that, that's my overview and update, and I'm happy to take any questions of the board.
All right. Do we have questions out there from board members? We already started into some. I'm not seeing everybody in there.
I didn't have a question. I just had a statement. I just wanted to thank you for that report and for staying diligent. And, right now, as a community, as a people, we're kind of going through COVID fatigue, and it's been hard, but, keep plugging and that's how we're going to get through this. And, we just need to keep talking about it and keep sharing, stories of how this is affecting people personally. One of my relatives lost his father-in-law just a couple weeks ago to COVID. He'd been in a coma for like a month and had to get the plug pulled or whatever. And that's just so heartbreaking, because for people, this is real. And for those folks, if it's not affecting your life, then it's easy to think that, well, maybe it's not as bad as it is, but people are getting hurt from this. People are suffering from this. And the only way we get through this is we follow these protocols, safety protocols, and take care of each other, and not do it for our individual self, but do it for everybody else who may be at risk, who couldn't get vaccinated for whatever reason, or are elderly, or are health immune compromised, or whatnot. So that's where we really need to get that message out to our community to continue, because we've been flatlined at vaccines around at vaccination rates at little over 60 for a minute. And part of that is that fatigue. And I'm glad that we have a new bucket of our area that we can vaccinate with the younger kids. That's really important. But until we really take this on as a community, 100% rather than 65% or 66% vaccination rate, we're going to continue to go through these kind of waves, and they're going to be harder and rather than easier. And we can lighten the load if we can stick to these protocols you're recommending. So thank you, Kim, for your work and your staff's work. You know, keep driving, because we really need to do this together. And it's not about ourselves, it's about how to protect everybody else around us. Thank you.
Thank you, Supervisor.
Yeah, well said, Supervisor Vasquez. Actually, that was taped. Kim, you could use that for one of your public service announcements. Actually, I think, you know, and I'm quite serious. You know, it's well said. We definitely need people to get vaccinated. And just as noted, if it's not touching people, they seem to drop their guard. But when it touches you and or you see family members, you lose family members. It's happening out there, and it's unfortunate. So we need to protect those that are vulnerable. Get vaccinated. Supervisor or Vice Chair Valerie, you were going to comment?
I have a comment.
Go ahead, Judy.
Thank you. Unfortunately, you know, a lot of people still don't want to get shots or, booster shots, or even the 2 shots prior to that. And we can do so much, and, you know, we just have to keep plucking at it, you know, and then a lot of education. I know that I've been hearing that the booster shot got them really sick, and they're telling people out there now, you know, people are beginning to hesitate. And, you know, so I'm just kind of thinking, you know, we do have Claire that's going out for the redistricting, and I think that we have flyers or whatever, maybe I believe for Tuba City Flea Market is scheduled for Friday the 10th. So if there's anything that you want to share with Claire to take for you to the flea market in Tuba City, that would be greatly appreciated. And I know that Cheryl will also be there too. So again, you know, it's not just as one person or a few handful of people's responsibility. You know, it's everybody's responsibility to ensure that, you know, we do the protocols and washing our hands and wearing our masks and stuff like that. So we have to all work together on this, and it's sad to see, you know, that the percentage is slowly going up. But, you know, like I said, you know, we just have to keep trying, and we can do so much, and, you know, inform the people. And I think education is a big part of it. So that's all I have to say. And then thank you, Kim. Thank you for all you do for the county regarding your presentations are, you know, something I always look forward to doing our board meetings. Thank you.
Thank you, Supervisor.
All right. And then if you're with the, can you pull that program down, Kim, just so I can see the panel?
Yeah, we'll have, I'll have Erica pull it down, and then she can put it back up, because Steve's portion is also on the same presentation. Yeah,
no, I just can't see everybody, so that helps out. Fantastic. Hey, one thing I did have a question on, Kim, and I'm not sure, I may have missed it. I was trying to look another item up while you were talking. In terms of hospitals capacity, I understand Light Medical is pretty close to being at capacity. Could you give us a little bit more background on what's going on that?
Yeah, thank you, Chair Ryan. And I didn't have a specific slide about this, but I will share in the meetings that I've been on, you know, certainly across the entire state of Arizona, our hospitalization rates. In fact, driving in this morning, I just heard the latest that we are at our highest hospitalization rates across the state over the past 10 months. And so that is very concerning, and all the more reason why we have to continue to be diligent about the vaccination. Again, even in Coconino County, our numbers, almost 80% of people who are hospitalized are unvaccinated. So there is a much higher risk for hospitalization. We know that vaccines work to minimize the symptoms and illness and to prevent hospitalization and death. And so we have got to stay vigilant with that. I don't have in front of me right now, Chair Ryan, FMC's numbers, and I hesitate to give them because one, they are not ours to give, they are theirs, and they do change. They have their dashboard. They do change hourly, quite frankly, with respect to hospitalizations as beds are clear, but I do know that they are very have some of their highest numbers as well. And in our weekly report, we do reflect the hospitalization numbers. Those have continued to be high and remain high in Coconino County and at FMC in particular, but at our hospitals across the county and across the state. So it is certainly a concern and a warning to all of our public. Emergency room waits are very long. We need to make sure that people can get the medical care they need, not only for COVID, but if we can decrease that number needing it for COVID, then we still have motor vehicle accidents happening. We have heart attacks. We have other health conditions and things that need emergency care, and we need to have capacity to treat our communities. So we've got to do what we can to keep COVID out of hospitals so that we can make room for those other emergency medical situations. So thank you for that question.
Lena, I need to hop off for a minute. Can you take the meeting, please?
George? Horseman?
Doing pretty good.
Yeah, you're still on. Oh, there he goes. Okay. We didn't want to hear his phone call. Yes, thanks, Vice Chair. And I was going to talk about hospitalization as well. I understand the hospitalization rate is extremely high. I've heard unfortunate stories of people who've needed intensive care being sent outside, not only of Flagstaff, but quite frankly, outside the state of Arizona because of intensive care beds being filled. So obviously we don't know Omicron. We aren't going to know what its real effect is, its infection rate, and the the efficacy of the current vaccine and boosters. I guess you'll be back with us in a couple of weeks to give us the update on that. But certainly what that means is we all need to continue to get the message out, which was very passionately stated by Supervisor Vasquez, and I agree with 100%. I also, for whatever it's worth, and maybe you're going to hate me for this, Kim, but I have encouraged people to call to report positive results because I think it is important that you do tracing. And unfortunately, if you do a home test and you do not go and get a commercial test, I'm going to call it, you aren't in the system and you aren't being traced. And I think that's really important, especially with Omicron. If it is as infectious as it appears like it might be, it's really going to be important for the protection of our community that we report any positive results. In the meantime, we all just continue to, wear our masks, wash our hands, keep the social distancing, get our vaccine, and get our boosters when we're eligible, and do what we can as we move forward with this pandemic. And I'm still calling it a pandemic. Sorry. So anyway, I also wanted to report some sad news. Also, Shoni Bria, who was the superintendent of Grand Canyon Unified School District, passed away the end of November from COVID. It is still out there. It's still going strong, still making a lot of people sick, and it's still killing a lot of people. So once again, thank you and your staff for being on the front line and helping our community through this. So thanks.
Thank you, Supervisor.
Thank you. Supervisor Horseman, anyone else like to make a comment? Not, I'll do mine. Kim, I think it'd be very good, as everyone else has said, to do a video recording of Supervisor Vasquez, what he had just made a statement on. And also, I think we should consider doing a town hall again, and just to put the awareness out there. Once again, just to be able to, get our message out once again, and a personal appeal from our county supervisor and then the county town hall. I think that I would recommend that.
Thank you, Vice Chair. And just So all of you are aware, and I'll absolutely go back and we'll talk with our communications team and as well as working with Trey out of the county manager's office to discuss some of those options. I did want to make a note for those of you that saw it. I know I did a PSA on Friday. There's a Q&A video that the team is recording with Matt Maurer. They either recorded it yesterday or they're recording it this week. So that's going to be in additional information in the Connect. And again, just really appreciate all of you continuing to share our pages, our information. And yes, looking at other opportunities, I agree completely, Vice Chair, and we'll be getting with Supervisor Vasquez to do just that and working with the team to, continue to get that information and those messages out there in as many places as Supervisor Begay also mentioned, in as many places as we possibly can. Thank you.
And by the way, it was an excellent video that you did, Kim. And I certainly shared it on my social media pages, and I would encourage other board members and quite frankly, staff members to share as well. It was excellent. So thank you for doing that.
Thank you.
I see Trey's hands. Trey?
Thank you, Madam Vice Chair. I just wanted to provide additional information from the public affairs contacts per what Kim said. Claire from my staff is reaching out to the communications team at HHS to work on a communications plan, if you will, and outreach to our employees to reiterate these important points that have been discussed today. And then additionally, we also shared Kim's video in the Coconino Connect for employees. And so one of the things I'll do today as well is touch base with Claire to also explore our external messaging and how we continue to support the HHS comms staff with their output and with the information that they provide. We have the information, we have the content. It's really about spreading the reach in the community and awareness. And so my team is committed to helping HHS with that. So I just wanted to provide that update.
Thank you.
That's very good. Thank you. I just often wondered if all of the communication staff should be all in one department with the public affairs rather than having every department have their own. That'd be just my comment. I see our board chair, Matt Ryan, back on, so you hand it back over.
Great. Go ahead, Judy, please.
Yeah, I think it's very important that we're doing, there's a communication plan for the redistricting, and there should also be a communication plan for what's going on, the variances and COVID and stuff like that. So I'm thinking that we should be able to do, I think with the redistricting plan we said we're going to do some radio spots, we're going to do certain things, I think for COVID, I'm kind of curious that what areas is the low rate of testing or shots that were given throughout that Coconino County. Maybe that area could be targeted, and that if it's on the Navajo side of it, what are we going to do with that to increase? Because I know Kim has gone over and beyond here in various areas, but is it off on the reservation? Where is it? Is it the Hopi Nation? Is it the Paiute? Or what areas is the lowest, so that we can go ahead and target that? And I think a communication plan would be very good for those areas. Even it has to be going from door to door, because I think at this point in time there's probably going to be more variances that are going to be coming up, and we need to be up there, as a front runner, to ensure that, we're trying to at least prevent, some of these things, and making sure that, people are vaccinated. And a lot of them, they're willing to go, but, they're at home. We have elderlies that want to go. They're not getting shots because they don't want to go to the hospital. They're afraid to go to the hospital. And so public health nurses, I always talk about the public health nurses, how we could be using them. And I know for a fact that there's a grandma that public health nurses came down and gave her a shot in home and, took care of that. So that would be interesting to find out what areas, but I'm not sure. I think all the statistics are being pulled together that where, we might not even know. So But anyway, that's just a comment I would like to make. Thank you.
And Mr. Chair, if I could comment on everyone's comment. So yeah, we'll certainly take the questions that you've asked and incorporate those into the follow-up presentation. HHS and the COVID team does have a communications plan. They have an outreach plan. We've worked with a number of stakeholders in the communities where we have a presence, and even coordinating, but also coordinating with other organizations as well to make sure that we are comprehensive in being able to access those that have vulnerable populations that may have access issues to healthcare. And so definitely want to look at that as complementing the work that HHS and other partners have been doing together. And Kim, do you want to provide other comments?
Yeah, Steve, if I could just add as a follow-up, we also have our public health emergency preparedness team, Blake Scott and the other folks in that small but mighty team. They are actually working on a vaccination and a testing desert map, if you will. So once we have that finalized, we will be publishing that as well. So there are lots of things going on, and I appreciate the comments and questions. And certainly we are still, and to Vice Chair Fowler's point, just want to be clear that while we are still an active emergency operation, we are still operating with a joint information communication center with the entire county, with Trey and Claire and our communications here with HHS. So I just want to point out that we absolutely are a unified unit with respect to the pandemic, and will continue to be so as we continue through the pandemic. And then, of course, in general, have a really good plan and working communications internally to make sure that we are all pushing out information across our multiple platforms, and we'll continue to strive to do that even better across all of our departments. And as Steve mentioned, with our community partners, we've got some great relationships with them as well. NAU, North Country, the schools district. I mean, we really have some great partners pushing our information, sharing it, and us doing the same for theirs. So thank you.
I have a question. Sure.
Go ahead, please.
Thank you, Kim, for the continued work. I remember several months ago, and this question came as a result of Judy's comments. So thank you, Judy, for your comments, because I remember several months ago that Flagstaff was the county hotspot for COVID, and in particular 86004 and 86001. And so now, is that still the same trend, or has that changed?
For the most part, we still have Flagstaff having a very high transmission. It has over the weeks, and I don't have our weekly reports right in front of me right now, but it has over the weeks fluctuated. We've had some other hotspots, certainly in Williams. We've had Page with some outbreaks. We continue to have outbreaks in various locations across the county, including in some of both our big and our small tribal nations across the county, and in various different pockets, if you will, that we continue to manage out of HHS. But I apologize, Supervisor Vasquez, but with respect to our weekly report, I'm pretty certain that it still is our highest number of positive cases are here in Flagstaff. However, we definitely have seen fluctuations throughout the county and in different pockets of the county.
No, great. Thank you. I appreciate that. And no worries about the numbers. I know I threw you a curveball, but it just kind of occurred to me, and I started thinking about some of the presentations you've done over the summer and whatnot. And so I just wanted to see if that had changed overall. So thank you. I appreciate that.
Thank you.
Yeah, it'd be interesting to see the maps that you're suggesting, the maps of the deserts, meaning, here's the area where the outbreaks are, and here are the areas that we're not seeing it. So that'll be really informative. And for the communication team, it's a good reminder about the JIC that we have rolling along. We're still in a state of emergency associated with this, but the communication, from what I've been hearing on the discussion, is just an update to the board on the communication component, just a reminder, here's what we're doing, how we're coordinating. It helps us know how to use it when we're out in our communities, and or if there's an opportunity that you can put some of the board members out there as spokespeople to help you out. I think everybody's willing there, Kim, but really appreciate what the team's doing on that. Now, I know we still have, oh, go ahead, Judy. Go ahead.
Mr. Chair.
Oh, that's Lena. Okay, sorry. Go ahead, Lena.
Yes, thank you. We have to remember Navajo Nation and other tribes, they have their own vaccine clinics, they have their own system that they have. So if we're talking about creating a map, we need to reach out to the those sources that are medical teams that are doing all of the work on tribal lands. So they have their own counts. I know that I am seen at the Tuba City Hospital. I'm not seeing, like that's where the numbers are, or else I can go over to Inscription House. Those two are near me. So I don't know if those numbers, I don't think they're reported to the county. Early on, there was a huge confusion, and Kim and I and others had to figure out, okay, where then Tuba, they didn't even know where they're supposed to report to. And I mean, that time there was just total confusion. But now we know that all those numbers are reported directly to the Navajo Nation rather than out to the county, and then from there it goes to the state. So we have to remember these jurisdictional boundaries and how the health care systems are set up and the reporting systems are set up. But I know Kim and team really know how those work now. I think you've all figured that one out by now. So when we're talking about creating a map, you'll have to reach out to out there and who the teams are on that end. So thank you.
I have a comment to make on that.
Okay, go ahead, Judy.
I think, we really need to think as a county. It seems like, we at certain times we're saying the Navajo Nation has their own thing, the Hopi, the Paiutes and all this. And we're kind of just focusing on certain areas within the county. Talk about the rural communities, the Native people, reservation out there. And all this time, my hope, and I guess, for me, I don't want to be very direct and say, you should work with so-and-so. There should have already been communication going on between all people within the county, getting their numbers together, having a close relationship, having, and so that way, everybody knows. With the Navajo Nation, the Hopi Nation, the Yavapai Nation, or the Supai, and all these others, our numbers might be way at 80%, and we're still looking at just a certain part of the county. So I think we really need to start looking in terms of the overall county, not just, certain parts of it, so that we get a true picture of it. And that, yeah, the Navajo Nation does do the weekly and they their weekly reports on that. So I just want to make that comment because I think, we have to think as a county as a whole. And in anything that we do, whether it's funding, whether it's anything that comes up, it's got to be a county effort. And so that way, that's a true picture of our whole county. And we may be misrepresenting our numbers if, we're only looking at a certain aspect of it. But I do agree with Lena that, we should, look at everybody. Maybe the Hopis have their own numbers too that they're reporting, and who are we working with, or who are we to work with now, to get that going, because they're still part of the county. So that's the only comment I would like to make. Thank you. All
right. And then, with the reports, it's an opportunity just to get the information back to the board. Sometimes, just because of HIPAA, et cetera, and I know a lot of you know this, these guys will have challenges. They can't get all the numbers together, but as best as possible, if we can unify and speak, what we can cover, what we can't cover. So we still have additional reporting on COVID.
Yeah, Mr. Chair, we can go back to the slides, but very quickly, just to reassure the board, we have, I think, excellent relationships with Navajo, Hopi, Kaibab, Havasupai, and so all of the numbers we would be rolling up would be including theirs, but we would definitely want to make sure that when we are reporting on numbers or data that's collected by other sources, we would attribute that in any kind of a roll up of numbers or maps. And so just want to make sure that that's definitely something we would be doing. Okay.
Yeah, the numbers are on their websites and changing every hour like everybody else.
Yeah, every number is a snapshot. It's what happens at that particular moment in time when that data was taken. And we know that data changes. And probably that's kind of a good segue into a couple slides that I want to provide to you today. If you can.
And Steve, as Erica's pulling that up, I just want to mention our weekly report, and for all of the boards and the public's sake, all of our numbers and information are a county-wide look of that information. It is broken out and from the data that we are compiling. So we do take a county-wide look and posting of those numbers as we're putting out those weekly reports. So thank you. Thank you all.
So, Mr. Chairman, members of the board, the slide here, join Sheriff Driscoll, could be join Steve Prue, join Matt Ryan, join Patrice Horseman, join Judy Begay, join Geronimo Vasquez, join Lena Fowler. It can go on and on and on, and we want that. We want to be able to say that, I want to be in that slide to say, join me in getting our vaccine. Just a couple of comments in just kind of setting the stage. We've been at it for a long time, since probably March, if not January, when we started hearing of something that was occurring that was on its way. I happened to be with the community college at that time, and so going through the process of how to anticipate and what to do was top of mind. And of course, the county being the public health agency, similar, if not even more, of the highlight there. And so throughout the, unfortunately to say that, throughout the years, because we're into multiple years of our journey with COVID, the county's done a number of things. During CARES, setting up hotels for those afflicted, providing supports to the nonprofit community, providing some supports to businesses, and providing supports to the community. At the same time, as an organization, we are a service provider. We have team members here at the county, 1,100 plus team members, and we've all done what we can be doing in response to COVID. Those options and those things that we've taken and things that we've done, include, of course, masking and social distancing and limiting ourselves. And our world last year was very different. A lot of individuals spent the holidays in small groups, and so it goes on and on and on. And today, I want to introduce another dimension of engagement. It's a volunteer engagement program, and it's the incentive program. And what I want to walk through today is introducing an incentive program for county employees. And you can see here at the slide here, all employees who are fully vaccinated prior to, and we need to fill in the dates, because when we look at the dates, there are certain dates that we want to make sure that we don't compress it. But again, the incentive payment for the vaccination itself, we're suggesting to be $200. And of course, all of the things that we do relative to employee pay is subject to taxation, local and federal. So the next slide, please. So again, the vaccine incentive program, vaccination, the incentive is a voluntary, and I want to stress voluntary program to encourage employees to be fully vaccinated. And to contrast voluntary to mandate. So a few weeks ago, we were notified by basically information that we came to the county and all employers that the Occupational Safety and Health Administration, the federal OSHA, was proceeding with requiring a mandate for all employers of 1,000 or more employees that it would be a mandated program. Vaccinations would begin, or the option for weekly testing. At that time, we worked with HR, our legal, civil legal, to put together draft policies in order for us to abide by the mandate as it was being presented at the federal level. A couple of days later, it was stayed, and to this date, it is still stayed in circuit court, the mandate portion. And then at the same time, OSHA did reconsider the implementation of the mandate. And so a couple of things happened at different levels that has basically put the pause on the mandate portion. I'm suggesting, and I'm presenting to you today, a program for us to proceed with a voluntary incentive program. The voluntary incentive program, as you see here, is to encourage employees to be vaccinated. We have a vaccination mandate that applies. If we do end up having a vaccination mandate program, well, the incentive program will probably be terminated or stalled or modified. And so that will happen if we do in fact get the mandate that comes down. Eligible employees can receive, we're suggesting 2 incentive payments, one for full vaccination and then a second incentive payment for the booster. Now, what we've heard nationally is that the numbers for boosters are on the slow side. And so we want to encourage our employees, and of course, number one, to be fully vaccinated if they so choose to. Now, I want to emphasize it is a choice. It's voluntary, but also we want to also add another incentive payment of $100 for those to get boosters. So employees would if they go through the process of becoming vaccinated and then also doing their booster, the total incentive payment would be $300. They're also, I always go off script, which is always kind of freaks the staff out because they say, oh God, Steve's off script now. Where's he going to go with this? I think there are many of us employees that are going to say, I want to participate in the incentive program, but it's not the monetary. I just want to participate. I'm not doing it for reasons other than I choose to do it. And I'm not saying that whether you participate for monetary reasons or not, that's entirely up to you. But I think that employees may want to participate just because I just want to participate. And so that may be a dimension of the incentive program, which would just basically incentivize participation with the exception of the monetary portion of that. So again, employees can, and I just walk through the bullets on this slide. The next slide, please. Eligibility, regular employee or temporary employee on county payroll, including paid intern, temporary on-call employees would be eligible. Again, we're going to be working on the date so that we can reasonably space that out because, of course, the vaccine takes place in the 2 shots, and there's some spacing in between, and then the booster from there, the same thing. And so we'll be plugging in the dates to make sure we work with the reality of the process and the timelines. The documentation, our IT department has created a secure portal by which employees can upload documentation, and then for reasons of security and HIPAA information that would be loaded would be destroyed. We would have certificates or certification of that destruction of data so that we're not maintaining information that might, that additional information we may not need to. Again, depending on what our reporting requirements are, the other part of this would be that the source of the funding, and as we're having all the discussions on the American Rescue Plan, we would be funding this program from the American Rescue Plan. And so, if we're looking at the total estimated cost, depending on the numbers of participants, because it's voluntary, it could be in the area of $200,000 to $300,000, depending on the numbers of individuals that participate, because again, it is voluntary. So again, here's the data, the bullets on how we would be rolling this out, and again, we would be plugging in the dates based on the time frame for all those things to take place. Next slide, please. And I just walked you through that. We would be meeting the employees that meet the criteria would receive the $200 for the vaccine, and then an additional $100 for the booster. Again, if they so choose to enact the monetary incentive. But again, I want to stress that I think employees may want to just say, I just want to participate. And then I guess a couple other slides. Next slide, please. Okay, what is vaccinated? Walking through, just making sure that we have the guidelines. So vaccines, employees who are considered vaccinated upon receiving the second dose in a 2-dose series, or after receiving the single shot vaccine, depending on the type of vaccine that's used. Employees are not required to get recommended booster shots at this time to be fully vaccinated. Again, the boosters are a different category, but yet they're still part of the protection regime. Employees must show proof of vaccination. When we talked about uploading that to a secure portal. Vaccination records will be stored electronically with employees, along with other benefit and confidential medical information. So, we would be storing that for those purposes. Employees who do not provide proof will not be eligible for the incentive, regardless of the reason. So again, this just clarifies the participation process here. Next page. We just went over that. Unpaid interns and volunteers would not be eligible. Temporary employees working through a temp agency would not be eligible. And then following board approval of the authorization of the funds, the incentive would be announced to staff with clarification of the dates and times. And then we would be providing an FAQ for employees. And then next slide. So before I turn it back to chair and board, again, we've all had different experiences. This past weekend, I attended a funeral of an individual who passed from COVID. We've lost members of our team to COVID. We've lost Supervisor Horseman reported community members to COVID. We're also an organization that is a healthcare provider. We're also an organization that is in the business of health promotion. We're also in an employer that we're a service provider of healthcare, public health, social services. We provide the social safety net along with a lot of great nonprofit partners. We don't do it all, but we are a provider of services. But we're also an employer. We're an employer that we feel deeply for our employees, all 1,100. And I always use the analogy of the family. It's a big family. I love the big family. I love 1,100 members of our family. But at the same time, in the family, we all have different thoughts. And for those who would choose not to participate, I honor that. I don't do anything other than say, thank you very much. Thanks for considering it. When we talk about what we can be doing as an employer to help in our workplace spaces, we're saying mask up. That's a requirement of our policy as an employer-employee relationship. The public, that we ask them, they're not required, and other laws have created that limitation. We ask our employees to be safe. Don't come to work if you're sick. For those of us, and I'm included, I had COVID. I was so lucky, though, I did not have the symptoms, the severe symptoms that many are suffering through, and unfortunately some who've lost their lives too. I'm a lucky one. And so for these reasons and all of the other things that we talked about, we feel now is the time to introduce this additional dimension of our strategy in navigating, and we are navigating COVID. We thought going into this a few months ago, things were looking good. We were saying we're almost there, and we are almost there. I'm convinced that we're almost there. A lot of, and on the part of everyone here, all 1,100 people who've done everything, they've been on the front lines when everyone, a lot of our folks were remote. We had folks on the front line who were doing their duty every day. And so we're almost there. I ask for everyone's participation and patience and trust that as an employer that we call Coconino County, an enterprise with 1,100 employees and 30 or 40 different departments that do great things, that we're almost there. And participating in another way is something I ask each of us to consider. But again, it's choice, it's personal decision, and I respect that from the standpoint of a voluntary program. So, Mr. Chair, I turn it back to you to ask board members to pose questions to us as staff. Thank you.
Well, and before I hop there, just a point of note is we did have a federal mandate. It's been held up at this point, but that could easily come back. And if that comes back, that will be a federal mandate that we would have to comply with, and or if we get it from the state level on that. So we are functioning within the law as we evaluate how do we proceed. So let's turn to board members and comments. Supervisor Horstman.
Yes, thank you. And Steve, thank you for this. As you know, we've been talking about the possibility of the county getting an incentive together here for a while, and I think it's important. I think it's an important for the Board of Supervisors to be heard from. I think it's important for us to take a stand on. We basically are the role models. We started early on this summer with trying to get businesses on board with Be a Big Shot to try to give incentives for people to get the vaccine and then come in and shop and get something off. It was semi-successful. And at that time, we talked about the county also needs to be a role model in this whole program. So I really appreciate you bringing this to us. I think it's important for us to be heard as a county and as members of the Board of Supervisors for this. I think it's also very important in terms of the date. Those that were early to get the shot, those people cannot be penalized. They were, in fact, the role models during the rollout. And so I know that's important. It is something Maricopa County has done, Pima County has done, Paradise Valley has done, Phoenix has done. Some, in addition to a financial incentive, have also provided additional leave. I know that's sometimes more difficult because you may not have enough people working for you, and sometimes that's hard. So I'm very glad to see that there is going to be a financial incentive. We will see, as Chair Ryan has indicated, what the courts come down in terms of mandates. Certainly there is precedent in America's past for such health and safety mandates, so we will see what the courts say on this. But in the meantime, I think having a voluntary incentive program is important for our community. It's important for Coconino County, and it's important for us to be the role models. And I hope others take note, other businesses take note, and I'm very glad to see this going forward. I would highly encourage this get done and get rolled out very, very quickly. So thank you, Steve, and thanks for your leadership on this.
All right. Why don't we just roll through, because Steve's going to need guidance on this as well. So we'll go to District 2, Geronimo.
Yes, thank you. Thank you, Steve. I really appreciate this proposal. And I really appreciate the fact that this proposal rewards those that have already participated, who've already done the work, and rewards those that are willing to step up and now do it now that the incentive program's out there, but also respects those that still choose not to, then that's okay. And so I really appreciate the way that this was presented. My one question is just like me thinking as an employee, when I get a bonus for something, the tax always sucks. What is the tax on $200? Like, how much is that going to add? And the reason I ask is this is my mindset or my thought. Like, how much more do we have to pay so that the take home for the staff after tax is $200? Because to me, as an individual, as a worker, that's more appealing than $200, knowing I'm going to lose $15 or something out of it, So that was just kind of my thought, but I do support this program even the way it is right now. But in my mind, I think you should go a little bit higher so that the take home after tax is 200 and 100. So thank you.
We'll look at that.
Sue, were you going to comment on something? You bubbled up here.
No, I'm fine, Mr. Chairman. Thank you.
Okay. Let's see. Supervisor Begay, Judy.
Okay. 200. Okay.
Yeah, thank you for giving me the opportunity to speak on this issue here. I totally support what was brought to us. And I'm just sitting here thinking what others might be thinking in our communities out there when we have so many things to address, and that we say we don't have enough funding for this and that. And so, and those are thrown at us, when we're out in the communities. So I'm thinking about the staff here. I'm thinking about the people out there, the communities that really need all sorts of services, from roads to whatever it may be. We hear that each and every day. So I just want to bring that to your attention, because I like to think, about the pros and the cons all together, about how, the community is even going to perceive us, but I think this is a good cause. And, I think, we really need to think about our staff. And yes, we are a forerunner, and I really thank Kim for all her efforts in being the forerunner in this whole endeavor that we're dealing with the COVID. So I support the initiative that was brought forth, and I just want to say thank you, Steve and your assistant county managers, for thinking about the staff, and then also my colleagues. We like to make sure that a lot of things are happening. We lost a lot of staff. We went and some of them got sick on us. Some of them, they left us, and they're no longer here. And so you think about all of that, from the presentation of anything that comes up, we start thinking about those things. So just to get that off on my chest, I just wanted to bring that up, and making sure that that we're taking care of our staff, and then our communities out there. So thank you very much.
All right. Vice Chair Fowler.
Thank you, Mr. Chair. Steve, we have 1,100 employees. How many of them have received their shots, and how many have not received their shots?
We've not done a survey of those. We did a voluntary survey a few months ago, and of those that responded, we had about 80% of those that responded indicated that they had vaccinated. They'd been back, but this was 3 or 4 months ago.
So those 80% then would receive automatically the $200 check.
They would be included in the
And then what we're trying to do is incentivize, I guess, the rest of the staff to also get shots. Is this really necessary? What is it that is there, people are already gotten their shots, 80%. So we did another survey and it was 95%. Would we still be proposing this? how do we know that this is necessary? You know, we do want to, you know, really help our employees.
Okay.
We want to be the example of for our community, but voluntary shots and showing that the county employees have gotten on their own already gotten their shots. I think that is a great message out there. We are a healthcare provider, so and we are the ones that are providing the community services. So therefore, to protect ourselves, our co-workers and our you know, the people that we're working with, are we then to you know, that alone would incentivize us to be able to, you know, provide that message that we are safe to work with. Have you explored any other way than to provide outright dollars for the employees?
Sure.
Other ways of incentivizing them to be able to get shots?
Well, and as I indicated,
This is an easy program, and there's $200,000 or $300,000 one time that is going out.
well, again, that is why I'm bringing it to you all as the board. It is a board consideration. I did indicate.
But have you explored other options with the health department or your leadership team, and this was the only alternative? As how else, you know, we're trying to get the communities to get their shots.
Okay.
And we just had that discussion. Now we're saying that for our employees, we're just going to give them $200 so that they can get their shots.
Well,
is that really necessary to do
as
that?
I said, as I indicated, Chair, Vice Chair, that participating on the monetary side is also voluntary. Employees may participate just to say, I want to join in on the participation and not have the monetary. We can look at other options for incentive as well. Again, having the discussion here today provide your direction to me is what I will execute on.
So
that, but I'm just wondering if there's other options or other programs or anything else that the staff have considered, and everything filtered out. This was the result.
Well, I will look at other options and bring them to you as you direct.
And we need to test that with the board. We have a recommendation here also on it. And I see your hand up, Patrice. I saw Lucinda had her hand up.
Well, I want to do board first, and then we'll talk to.
Yeah. No, I got it, Steve. Hang on a second, though. You know, I haven't put my 2 cents in on this one. You know, as a recommendation. Now, we didn't see other ones, so you know, fair question associated with it. By the same token, you know, do I still support the incentive program? I do, and my rationale is associated with human behavior. Try as we may, you know, people just aren't going to do it unless you nudge them off, you know, the high dive or whatever it is, so to speak. When there's a monetary opportunity, it does help incentivize and get us to better numbers with it. I would say as a health organization, yeah, we should be at 100% now. Unfortunately, we haven't had that behavior yet. You know, some people might have real specific medical reasons or whatever for what they, you know, why they may not have to, may not do it. And you know, there is that opportunity, you know, to exclude folks in that way. You know, my education's biology. I worked in a biotech firm. we have a long history in our country associated with vaccinations. We've had the eradication of smallpox. I grew up with kids that had polio. People, once they saw what happened, vaccinations really are a good method. It is always a risk evaluation, but the data that's coming in is showing that there's much more of a benefit associated with the vaccination than not. So my position would be, I fully support people going and getting their vaccinations. If we have to mandate, we'll wait for the legal component associated with it. But for incentivizing, I'm there on behalf of that. Unfortunately, gosh, okay. Yeah, go ahead, Patrice.
Yes, thanks. And just, this is something that has been discussed and has been passed around within the county for a long, long time. And it's now coming forward, and I'm really glad that it is coming forward. It's important, as I said, that we are the role models for our community and for our county. A lot of other counties in the state of Arizona have already passed various incentive plans. Back in the summer, when we took a look at Be a Big Shot, and Kim Musselman and HHS and others were involved in trying to get this rolled out, we did a lot of research on what incentives work for people to get that vaccine. And there is a lot of data out there. I just pulled a whole bunch up just on iPad as we're sitting here. But back in the summer, we also took a look at it. The best incentive for vaccines right now is financial incentives. And so we were looking at that. I think the big concern a while ago was the ARPA funds, could that be used for an incentive program? I understand the ARPA funds, in fact, can be used for an incentive program. Why? Because they've been shown to work. We need as much of 100% vaccine rate for our county as we can get. It also, again, sends a message to our community. I am certainly hopeful that other businesses will follow suit and provide similar type of incentives for their employees. We have been encouraging that every time we've had a board meeting and we've talked about COVID. So I am very much in support of this. I liked Supervisor Vasquez's that I'd even go up a little on it. Obviously the percentage goes up, you pay more taxes on, and how much taxes you pay depends on what your tax rate is. But certainly $200 would be, in my opinion, or $300 with the booster, minimal to really have a true financial incentive for our employees. So I am a big supporter of this. I would really like action to be taken, either voted up or voted down, but I want this to go forward. I want there to be a vote on this because I really believe we need to get this program going. So thank you.
And so just to follow up, and I'm going to walk through each person on this one. Mm-hmm. So you're okay by going up on the tax component, and then another question is, do you want an evaluation of other options, or do you want to proceed?
No, I think that there are a number of evaluations that have been looked at across this country. I know Maricopa County looked at it, Pima County looked at it, Paradise Valley's looked at it. It's been looked at all across the country. Coconino County, we've been talking about this for months. It is time to make a decision and to act. The best incentive, and there's a lot of research out there, has been found to be a financial incentive. If we want a meaningful incentive program, we need to provide a financial incentive. The question is how much, and I'm going to tell you, I'm going to leave that up to our county manager, who I'm assuming has done the numbers and done what we can do and afford as a county. I did like Supervisor Vasquez's idea because I really want this to be effective. I want it to work, and I want Coconino County workers to get out and to get their vaccine. I want them to be safe. I want them to be healthy. I don't want any more funerals. And I don't want any more people being out of work because they are sick from COVID. So Let's get it done. The financial incentive has been shown all across the country to be the best incentive. I will leave it into the hands of our county manager to determine whether it's 200 or 225, but let's get this done.
I'd like to make a comment.
Let me go by numerical, Judy, so I'll come to you. And okay, Hieronymus.
Yeah, I just wanted to say that I really appreciate Supervisor Fowler bringing up alternative potential incentives. I agree with Supervisor Horstman that we need to have something passed action soon, very soon. But I also agree that we need to know what does our staff value. And I hope, Steve, that you already have that data to be able to make that assessment among the staff of what kind of incentive would make the most sense for our county staff. When I worked at Killip and we worked with facts, we had to do an assessment of what did our families value? What did they need support with for our 21st century program? And we went through a rare process where we did a rapid evaluation, did surveys, and I'm not saying we got to do this in this case, but I'm saying what emerged from that was that financial connection. And we ended up tying free facts programming for kids based on family participation in our family engagement programs. Anything they did at school, they got credit for it towards the program. And so I agree with Supervisor Fowler. Like, I'm comfortable with some kind of incentive program that has 300 to 350, 400 or whatnot value. It doesn't necessarily have to be cash. You know, I would suggest that if this isn't something that has to be like decided today because we don't have dates and we don't have a timeline yet, then maybe we take a week, maybe we take 2 weeks and do a blitz survey to the staff and say, if we did this, what, and you had these 3 options, which one do you value more? And then based on that one, vote on it next week. Like, I think like that, or, you know, so that way we're moving quick, but we're still taking that time to get the assessment from the staff of what they value and what's more important to them. And if they're not vaccinated, which incentive would get them to vaccinate? Is it $300 cash? Is it maybe some extra PTO? Is it some health related type connection? Like, what are those things that will get them to change their mind about vaccinations? Thank you.
Okay, so you support the concept of incentive, but a potential evaluation of options. Okay, now roll into District 4, Supervisor Begay.
I think, you know, we got to give credit to our manager and his staff working on this and bringing this forward to the table. I think that whatever recommendation that was made is something that we can work with right now, because like it's been ongoing. I think we need to take a step and not go back and try to do other things and put more work, you know. And if you have issues or if you have any things to discuss, I think as Board of Supervisors, we have a county manager that listens. And we need to go to him and talk to him about certain things and administratively, if we have to. This has been on the board packet since when we got our board packets. And even before, we've been discussing it. And now, you know, we're just tossing it back around again. And so I'm just thinking, you know, we should go ahead and move on this, get it all done and over with. Next time, you know, if we board members have things to discuss, we need to go forward to our county manager. And he's the one that will do the job for us. But if he doesn't know, then he won't know. So my comment is just, you know, we should just move forward with this and get it done, you know, and, you know, that's the recommendation by the county manager. I'm pretty sure he did, you know, all his paperwork and all his looking into things and doing calculations and things like this. And this is a one-time thing. And so, you know, of course, you know, there are people out there hiring, you know, giving money out, you know, saying incentive pays to get on the job. So with that, you know, I would like to make a motion that we approve this recommendation by the
let's hold off on the motion on it. Let's go through the board here, and here's the response to the county manager, and then we have the opportunity to consider a motion on that after that. Supervisor Fowler, you were suggesting the idea of exploring other options. That's where we are after listening to the rest of the board.
Yeah, well, this is, if this is what the employees want, then, I guess this is the way to get their shots. We're public servants. And as public servants, we have every duty to take care of ourselves. Not to be, I'm not going to do this because I have no incentive that's being provided me. I find that troubling. So, I'm just thinking of myself as a public servant. Yes, I know we have lost very, very close loved ones. We know that. I'm not immune from that.
No.
But we're public servants. As a county employee, as public officials, we know ourselves if we have received our shots and our boosters, and we know that we're trying to get the public to do this. But is this the best incentive for us as public servants? Are there other options other than this? Has the employees been surveyed to find out exactly what they want? Is this what they want? If it is, yeah, go ahead with it. But I'm still back to the idea that we're public servants. It is our responsibility to take care of ourselves, our coworkers, and our community. That means being responsible and making sure that you get your shots and that you are not going to be spreading this. And so with the new variances that are coming out, yeah, those are big fears. I have that. But I'm just asking the question, has there been other options looked at? Yes, it is across the nation, but we don't have to do what everybody else is doing. What is it that works for us here? Is this exactly what the county employees want? Then if it is, yeah, then, we still have time. We can wait until next week. We don't have to rush into this. Yes, we've had this discussion, not to the point where we're going to be making a decision. I want our employees to be safe. Yes, I want my family to be safe. I want my community to be safe. But in order to be safe, does that mean that we have to wave money to them and say, here's some money, go get a shot?
Okay. So, I'm listening to this and, where I'm going to go with my vote and all that kind of thing if we go to a vote. But, Steve, can you give an idea of how you evaluated this and what you did?
So, well, to Supervisor Vice Chairs, I did not survey the employees. And certainly that is something with your direction today, certainly, yeah, to have that information is full information. We can, there's not a challenge to doing so. And that, so again, I would not at the staff level be requesting a vote today. I think that your input today is what was what I sought. I brought a proposal to you and I received feedback from all of you, good feedback. And so with that feedback, we will do the additional staff work to address some of the questions that you raised today.
So, Mr. Chair.
Yes.
Steve, you clearly, you care about your employees. We know that. And that's really, I think it's just really great that you're watching out for them.
Yeah.
But I think we need to just do exactly what you said. So thank you. Thank you, Mr.
Right.
Chair.
Yeah, no, I'll note, I was ready either way on it. Steve, if that's your recommendation right now. I would go in that direction with your recommendation just to vet it a little bit more on that. As you said, you weren't anticipating it today with that. If the option becomes the financial one, though, I definitely support you moving in that direction. But evaluate, bring it back to us. Let's take a look at how we can get people. Let's get people to get vaccinated. The other thing I would suggest is if we do proceed with this, whatever the reward is, I'll say as a board member, a community leader, I've had my 3 vaccinations. I don't want financial incentive. But if we go in that direction to offer people and we get them, they need that, so be it. I welcome that direction too. All right, go ahead, Supervisor Horstman.
Yeah, thanks. First of all, it is scheduled as an action item, and I know we have been talking about this for a long time. I know what the studies and the reports show in terms of the incentives and the best way to do the incentives, and that they are in financial incentives. I also know that we are so understaffed and overworked right now. And I also know if you ask somebody, boy, if you get me a sports car, boy, I'll go in and I'll get every shot you could ever come out with. And so at some point, I'm not sure how effective that is. If the county manager is saying that he's not presenting this today, then I won't make a motion. Although I'm very disappointed because it was set as an action item. I thought this was going to be voted on today. I am ready to vote on it today. But if the county manager is telling me he's not recommending for it to be voted on today, I will not make that motion. But if he says that, then I am expecting it's going to be here next week. And I don't think we need to have, a roll call of the employees on this. I don't think we have the time, quite frankly, in the staffing to be able to do that. I think the studies on incentives and incentive programs speak for themselves. I think that's why we see so many of the counties across the country and across the state of Arizona that have done this. County manager, if you are not making that recommendation, I will not make the motion. If you are making that recommendation, I will make a motion for us to accept this incentive program as presented. So I'd like to hear whether he's making that recommendation or not today.
Yeah, we'll go to the county manager, then I have Geronimo, and then I have Judy. Go ahead, Steve.
No, I'm not making that recommendation today. I see, for me, one of the things that is real important to me is that decisions that are made do not, the unintended consequence of decisions. Well, leadership is important. Sometimes you just got to take the stand and go with it. There are opportunities for us to look at options, and if there's a financial option, if there's another option, whatever that feedback is, I think you all know me well enough to know that as all of us, not just me, asking our team members what's on your mind is not a bad thing to do. And it's not that we would not be doing that if we're taking the action today. I do agree. The data does show, the research does show, incentives do work. Now, what those incentives are, and that's why I said today, there are some folks that may not want to do the financial incentive. I just want to participate because I'm very happy to share that I did that. But we also have, like many things in our world today, there are a lot of divisive issues happening, and there are a lot of things that, for me, I just want to, we all want to keep the health and the well-being of our employees at the top of mind. How we get there and how employees choose to make those decisions related to those issues. I want to take that into consideration too, because it certainly is not any kind of shaming or blaming. It's where we find ourselves today. And how can we navigate? Going back to the word navigate, we're navigating a lot of different angles and icebergs and whatnot with COVID. And so we're almost there. I want to be very mindful and I'm not shirking my duties. I'll make a recommendation and say we should do it, and I think we should, but having the opportunity to take a pause, receive your input, have some discussions and some input from the organization is certainly fine with that too. I think it's important. Thanks, Mr. Chair.
All right, Geronimo.
Yeah, Steve, I really appreciate the work that you put into this and that you bringing this to us. And just so you know that if the financial incentive of doing the proposal that you set, like the one thing that's missing for me is there's no timeline on there and rollout. And I would like to have an idea of what that looks like so we know what it's going to be if we green light this and we move forward, that we know what that's going to look like. But other than that, if this proposal had that, I'd be willing to vote yes on your proposal as is today, right now. But since we don't have that and we're looking for, I think that the week is a good move because it allows some breathing room and some final tightening things up on the proposal. But I'm really excited and encouraged to know that we're going to make this happen, and we're going to make this happen before Christmas, at least the moving it forward. So, you know, that is important. And I just wanted to acknowledge and recognize that. You know, my questions are not trying to throw curveballs. My questions are really trying to make sure that we're addressing what our staff needs, like what the country needs. I agree, it's financial. I mean, I just shared a story from Killip about financial. I know that that's the big one, but let's do this last roll call out, find out for sure, and make our decision. So thank you.
Judy.
Since this is an action item, I think, I think we really need to take an action on it. Because I know that the Robert Rules of Order, you have to run your meetings according to that. Sometimes we don't go follow through, like with action items, we just kind of put it aside and we just move on. And we're in violation. We're in violation of that. And so with that, I think, for Steve, you really need to I guess what I'm gonna say is I really appreciate the work you put into this. And I'm thinking here, trying to put myself in your situation. I don't put myself in, I try to think about everybody here. Since Geronimo is still okay with just a timeline, a date, I think we should just approve this. I still want to make a motion. I talked about a motion from earlier. I want to make that motion and move forward with it.
Well,
with that, Mr. Chair,
because we're it's before us, and and like I said, who's going to take all the time in 1 week to get information from the staff? Some staff are home and stuff like that, and things like that.
Mr. Chair, I'll comment after you.
Yeah, the first piece is speaking to the Robert's Rules of Order. Rose, can you pop up for a second? We function on an open meeting process where we use an informal use of the parliamentary procedure and not dictated by the parliamentary procedure. Part of the reasoning why we've done that, function in that way is sometimes it's a process. You work your way through the process. It's not shying away from the vote so much as let's make sure we weigh it out. Did we have a chance to exchange ideas? Did we hear each other out associated with that? And it provides us with that opportunity. Push comes to shove, sure, we can push for a vote, but we find value in the conversation. The parliamentary procedure, we attempt to do it, but we have an informal use associated with that. But I asked Rose to come up to help explain that because there are jurisdictions that use, they get into parliamentary procedure. I won't give you my opinion on that so much as let's turn to Rose and speak to that. Rose.
Sure, Chair Ryan. And I may need you to clarify, what question you are asking and what you'd like me to explain. As Supervisor Horstman and others have brought up, certainly the agenda item does include possible actions. So certainly if the board chose to make a motion and consider a motion, that is within the agenda title and could be done. But certainly does not have to be done as well. If the other, possibility is that the item is, continued until next week's meeting, certainly that's an option as well. And we've certainly discussed before that, we don't strictly follow parliamentary procedure. And so, there does not have to be an action because it was noted. But that does provide the language currently provides the flexibility so that the board could make an action or, certainly could delay until next week or another time specified. But I understand that next week was specifically requested as when, this would be delayed to.
Go ahead, Patrice.
Could I make a motion at this time that we bring this item back next week for a formal action and vote of the full board after receiving a full recommendation from our county manager, which I thought we were receiving today. But since that is not the case, I make a motion that this be tabled and brought back to us with recommendation from the county manager at our next board meeting.
Second.
I have a motion and a second on that. So I'll call for the vote on this. All in favor of the motion, vote aye.
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 Aye. I see Geronimo waving, but you're on mute, Geronimo.
Sorry, didn't realize I was on mute. I said aye as well.
Aye.
And Judy's off mute. So everybody going along with that. All right, it's and we are posted for it. There's no question about that. It's how we work through these things. We're a piece of it. There's a virtue in what we just did, and it's a virtue of when we get together, and we'll talk about this more on it. We worked together for 4 years. How do we work through issues? And we definitely want to bring things to vote. We're going to have disagreements, and yet by the same token, there are opportunities to work our way through it. So we'll have plenty of time as we come back together as a board to talk about our procedures. Do we stick with current procedures? Do we modify them for what we have? But there has been a great opportunity of sometimes we have boards going in with full intent of I'm going to move in this direction, suddenly to find out, we need more work on this. We need to take a look at this in a different way. And that's where we go. That's a piece of where we have with the open meeting process as our dictate rather than the parliamentary procedure for it. So we're about at lunchtime, and I heard I was kind of thrown off the lifeboat last time on that. The last meeting went to schedule, but I'm off schedule here. So
I was actually going to point that out to you, Ryan. We had a very effective, efficient meeting last time. I don't know what the world happened, except the chair changed.
The chair set up last meeting's agenda.
I'm gonna abstain from all discussions from this point forward, sir.
Yeah. So Steve, we have the American Rescue Plan scheduled for 1:15. We have a lot of people, and so I'm thinking the other items that we have here we push to later on in the agenda. Is that what you're thinking also?
Yes, sir. Yes, if we could do the time certain start for ARPA at 1:15, and everything else can come to the tail end.
Okay. All right. So with that, it's 12 o'clock. We're scheduled to come back at 1:15. And thank you, everybody. We'll see everybody back at 1:15.
Thank you.
We'll take a break.
Yeah, everyone make sure your mics are off because you're hot until it's turned off, please. Thank you.
Testing, testing. Val, can you hear me?
I can hear you, Lindsay. This is Steve.
Thank you, Steve. It's working on my end now for microphone.
Good to hear you.
Yay.
Hey.
Thank you.
Yeah.
Everybody just be aware that the live streaming does continue through the lunch hour. So
Yeah,
make sure
just
to
make
be,
sure, make sure everyone's mics are off.
thank
Thank you
you.
for that reminder.
No, this is on. Test, test.
I can hear you, Lindsay.
Test, test. Hi, Steve.
Hi there, how are you?
Thank you.
Lindsay, if we could re-promote Erica Shaw, that would be great. Thank you.
Steve, this is Lindsay. I'm just waiting on Chair Ryan to join.
Here he is. Thank you.
Okay. I'm probably the late one here. Sorry about that. Let's see. I see Geronimo, the Trees, and let's see. I see Judy's piece out there. There you go. Now my headphones are working.
Ta-da. Now it'll work. All right. Patrice, Geronimo. Let's see. Judy, are you out there? I see your screenshot. There you are. Wonderful. And then Lena, are you out there? I see your hand. Oh, that's my thing. It's on there. Okay. There we go. There's Lena. Fantastic. So we're going to reconvene here, and we're in our work sessions post break. So we're starting with the presentation. This is item number 22, presentation, discussion, and update and possible action as it relates to the American Rescue Plan funding for fiscal year 22 budget. And so we're going to spend a couple hours doing this. We need to make sure that we take a break to give everybody an opportunity as we proceed through. But Steve, you put together a lot. You have a lot of staff lined up out there.
Yes.
You all ready? Okay. All right, let's turn it over to you, Steve.
Thank you, Mr. Chairman, members of the board. In addition to those, excuse me, that you see on the panelists, we also have a number of individuals on the attendee side that will be pulling over to respond to any questions that board members have. So, Mr. Chair, members of the board, our discussion today reflects the evolution of the behavioral health and mental health discussions that have been taking place within Coconino County for some time now, but during COVID rather, the issues and the impacts of COVID as it's impacted all of our lives, regardless of the age group, have become even that much more important to note. So again, the discussion today will be talking about the mental health, behavioral health component of the American Rescue Plan menu of investments that we have brought to you for several weeks now. In terms of progress, the creation of the County Mental Health, Behavioral Health Steering Committee was formed, and those representatives come from the Superior Court, Justice Court, the County Attorney's Office, Juvenile Court, Superintendent of Schools, Clerk of the Court, Health and Human Services, Public Defender, Legal Defender, Sheriff's Office, and of course the County Manager's Office and others. It's also important to note that the individual members of the steering committee constitute programs that are recommended for funding, as well as some that are not, and so that are not even on the radar. Again, so our attempt is to create a cross-organizational team to look at mental health, behavioral health across the entire enterprise, meaning the county. And so that's an important part of our conversation today. We also heard from the board that conversations and projects must be countywide, and countywide meaning countywide. We have a large county, and so when we talk about strategies and some of the programs, we have certainly taken into account the fact that we have the county as a whole to serve through some of the recommendations. And so the feedback and the direction from the board was heard loud and clear. It's also important to note that the framework that we're presenting to you today, we're looking at this from our American Rescue Plan as a source of funding, as one source of funding. Being able to provide a comprehensive framework that we're delivering to you today, we feel is also positions us, meaning the county, to seek additional funding, whether it be from foundations, grants, et cetera. And so again, creating a comprehensive approach helps us achieve that. It's also important to note that we feel, based on the presentation that we're going to be providing to you today, that we've captured the background and the framework for all the county proposals. And then the most important part of it is that there's an interconnectedness to us. And so when we look at the continuum, the spectrum, however you want to characterize it, we're looking at this as a system that we're presenting for consideration today. We know that mental health, behavioral health has long been an issue in our community, and in many cases, the resources are sometimes not there. And so being able to create opportunities for us to generate additional ways to approach some of the problems is really important. For purposes of today, Erica, if you can just show the agenda. Let's see, Erica's gonna, and then we'll just walk through the materials very quickly. Okay. So again, we'll start off with the mental health, behavioral health, health proposal introduction and progress updates. The resource packet presentation in it, and this is the materials that were delivered or provided last week to you for review in advance of the meeting. The sequential intercept model framework, the American Rescue Plan theory of change, and theory of change really looks at how does all of this connect with regard to some of the changes we want to see happen. Looking at existing programs and current needs. And then from there, mental and behavioral health proposal spectrum, perspective, and discussions. So the proposal spectrum, the program review, discussion and questions. And so we have put together materials that provide a macro view in terms of a broad context, but also provided information to you that go deeper into some of the program specifics that we're looking at suggest or recommending funding for. And so with that, I'm going to ask Erica Shaw to walk us through the materials. And again, as board members have questions, if there's a question related to a specific partner or stakeholder within the justice arena, we will call on that individual and ask Lindsay to promote that person to panelists so that they can address the questions or observations that you would have. And so with that, Mr. Chair, with your permission, I'll turn it over to Erica to begin presenting.
All right, please do.
Okay, Erica.
And thank you, Steve. Thank you, Chair Ryan, members of the board. And really, I'm grateful to be a part of this process and to be able to present to you today. So before I delve into the documents, I just wanted to reiterate some of what Steve was sharing around the framework behind and the intent behind what we created. My goal is to help walk through those resources with all of you. But at the outset, these were developed in response to staff hearing and understanding what the board questions and concerns were around all of these programs. And that led to us working collaboratively to address those questions and to answer them with our steering committee and with the creation of these documents, in recognizing that there is a mental and behavioral health crisis in our community. And that manifests itself across a multitude of different domains. And so there's a resultant complexity with that. And so how do we distill that information down to provide the framework behind the rationale around this subject and the decisions that were made and the proposals being presented, and then also the details at that program level. And so collaboratively, we developed these two primary map documents, if you will, to better understand and share the interventions that this steering committee developed to best address the mental and behavioral health crisis in the community. And so, again, the intent behind these documents was really to give an overview of the why and then the how for all of our ARPA mental and behavioral health programs. And so I'll share the documents on my screen. I will refer to them. I know there's a lot of pages in your documents, but I'll try to direct you to the appropriate page number and or refer to them as the numbered attachments that you received in your email. But if at any point you have a question about where the documents are, please feel free to stop me so I can make sure we're all on the same page there. So with that background, I will share my screen and we'll start with this overview of the sequential intercept model for the county. And so again, this is, I don't want staff to be lost in the details for this. We were trying to find a balance between the framework and the background and then move into those program overview. But the sequential intercept model is ultimately, it's an attempt to capture the complexity of the spectrum of different interventions and touch points in the criminal justice system where individuals engage with that system across many different domains. And so you'll see that here, it was a model that was developed back in 2000 as an attempt to help provide the foundation for criminal justice partners and mental and behavioral health partners to better understand how individuals move through the system, to help frame the discussion around the criminal justice system and the mental and behavioral health system as how individuals engage with both of those systems. And so this conceptual model is important to mention because it's a tool as part of all of the work that the steering committee has been doing that we use to inform those best practices and with the intent of redirecting individuals with mental and behavioral health needs away from the criminal justice system where it's appropriate to help get them additional support as it pertains to their mental and behavioral health needs. So this framework is, again, best practice and is something that is a tool that we use throughout all of those discussions with our partners. For example, we won't spend too much time on the sequential intercept model, but this framework, if you imagine an individual who has a mental illness that has been diagnosed and perhaps has a substance use disorder, you can follow that person if they are entering into crisis where the touch point would be with the criminal justice system, be it calling the Northern Arizona crisis line or law enforcement being called at Intercept 1 through the different potential outcomes through detention, through being engaged with specialty court, or perhaps entering into the jail system. And then also at the right end of that spectrum, re-entering back into society when they're being released from either prison or jail, or then engaging with probation or community corrections. And so that's the backdrop for this sequential intercept model. And also in your packet, we provided an overview document for the board members who may not be as familiar with this or who wanted additional information around that framework. But ultimately, this sequential intercept model is, it ties to the different intercepts where our programs that we proposed through the ARPA funding, where they fall in this spectrum. And so I want to pause there just to see if there are any questions from the board around the sequential intercept model. Just know that it's very important in terms of a framework for informing the discussions and a tool that we use in strengthening the best practices and understanding what the gaps, what the current needs are, and what the current programs are across Coconino County.
All right, pausing to see if the board members have questions at that point with the SMI or sequential intercept model. No, not seeing any. Okay, go ahead, Eric.
All right,
I do
fantastic.
have a question.
Let me see. Who was that I missed?
This is Lena.
Okay, go ahead, Lena. I'm scrolling up and down to see us. So
Okay.
okay.
All right.
Yeah.
So when we're talking about individuals moving through the system, how many on average are we talking about when we have going through this process? And at what point is it that the competency program, when they're sent out for competency recovery, or what's it called? Where does that fit in this model here? Since this is laying the foundation as to the proposals that are coming before us.
Thank you, Supervisor Fowlers. County Manager Peru, did you want to answer?
I was going to actually call from the courts to respond to in terms of the numbers, and then also the county attorney's office. So Lindsay, could we promote Bill Ring, also Judge Slayton, to respond to the entry point and the throughput of those in the justice system at this point in time?
And just for clarification, you were saying restoration to competency, right, Lena?
Yes, thank you.
Okay.
Yes.
So let's see, Mr. Ring is here. And let's see, do we have, and Judge Slayton are here. So County Attorney Ring and Judge Slayton, Madam Vice Chair, can you ask your question again so that we can have a response or some comments from both the County Attorney and Judge on this?
Yeah, thank you. And thanks so much for taking time to answer my question. So we're looking at a model here and to lay the framework as to the proposals that are before us. How many individuals are we talking about when that are going through the system, and at what point does the restoration of competency, where does that come in? Because that's also mentioned in our reports. And this looks like it's just is it the full judicial system, the justice courts, as well as the juvenile court, or is this just the superior court?
So this is, well, I'm gonna ask Judge and County Attorney Ring to begin the comments, and then we can go from there. If I could, Mr. Chair, Vice Chair.
Yes.
Judge Slayton, you want to provide some information on numbers, and then Mr. Ring, if you could also address some of the throughput that we're seeing in terms of the justice system.
That Judge Steinmeier would be on. I think she probably is in another hearing. Hopefully she'll join us soon. It's sort of a difficult number, first of all, because when we deal with the mentally ill in our court system, it differs in some respect to those that we set for restoration to competency proceedings. Those that we send for restoration to competency proceedings are a small group of those that present with mental illness problems. So the restoration to competency is a number that kind of fluctuates. The issue is that we have, as you have seen, Vice Chair, with the increase in the RTC costs, it is not necessarily the number that we have, but it is the amount of competency proceedings that are necessary to restore someone to competency. I think right now, and perhaps Mr. Ring can correct me, I think we have about 7 folks. It might be even more than that, because I'm only thinking about the Arizona State Hospital. But we also have a number that I'm not aware of that are actually still waiting in jail. That are on a waiting list to get into get into Yavapai. That's something we've been working with Mr. Ring's office and with the Pima County Attorney's office to get a contract together where we can start utilizing the Pima County Restoration to Competency Program as well.
Judge Slayton, could you do me a favor? Could your volume is coming across very loud.
I'm sorry.
And we're not able to distinguish all of your words. So if you could adjust your volume a little bit, that'd be good. And we can then.
I had the automatic adjustment on. Is this a little bit better?
Yeah, you're still coming across kind of muffled, but let me see. why don't we do this? If you can leave and come back, and then and I'm wondering, well, I don't want to miss the conversation, so
Okay,
let's
how
see.
about- Is this a little better?
A little higher though. We're
How about
almost
this?
there.
A little better?
Yes.
Yes, we're good. So
Okay. I feel like my ophthalmologist, number one or number two?
I know, sorry.
Better, best.
We can understand you now, sir.
Okay. So it's a little bit difficult to put an exact number on those in the RTC program because we do have some that are still waiting in jail, and I'm not certain about that number. Now, Judge Steinlage did indicate that she is on. I just didn't see her
Okay.
name, and I'd ask if we could promote her to a panelist as well.
Okay, we can do that.
And in terms of the mentally ill, the population is one that I think assumes, it depends on how you define it. If we're going to seriously mentally ill, which is a specific, almost access-like designation, or those that have a mental illness problem plus something along with it, such as some sort of polysubstance abuse. So you have a dual diagnosis. So that's the population that we're dealing with. Now, one time down in Justice Court, when we had when the mental health court was rolling at 100 miles an hour, I think, and Kim or Fanny, you can help me out, or Bill, I thought we had about 24 people involved in that mental health program at mental health court. So that's about the best that I can try and give an answer to. And I know it's probably not the best answer, so I'm going to turn it over to Mr. Ring or Judge Steinlage, who or Kim, that I think would be able to answer it better.
Okay, why don't let's see. Let's go to, if we could go to Judge Steinlage, and then we'll go to Bill Ring if you could. To add to Judge Slade's comments.
Thank you so much. I just want to say how much it's an honor to appear with the Board of Supervisors today, and the chairman and vice chairman, and the county manager. Okay, so I have pulled up the list that we just received at the end of last week about who's in competency court right now. And it looks like there are 18 individuals that are in competency court right now. In other words, there are 18 individuals for whom the court has entered orders that they participate in an evaluation to determine whether they're competent to stand trial. Some of those individuals are, as Judge Slayton indicated, are awaiting to go into a restoration program. Some are already in a restoration program, either through the Arizona State Hospital or through Yavapai Restoration of Competency. And some are awaiting further evaluation. So that's the status of that. In terms of the other question was how many, or where on the sequential intercept model the issue of competency and restoration comes up. It comes up, it can really come up at any time between the initial appearance or the arraignment and change of plea is where we would primarily see it most. It can also come up if somebody's already been placed on probation and is accused of having violated their probation. It can come up there because a defendant has to be competent to either have a hearing at which it's determined whether they violated probation, or to enter an admission that they violated probation. So those are the two main places where we would see it in the sequential intercept model. So just wanted to answer that question for Ms. Fowler as well. Thank you so much.
Thank you, Mr. Chairman. Madam Vice Chair, if I could ask County Attorney Bill Ring to offer comments on this topic.
Thank you. Thank you, Mr. Chair. Thank you for the question, Supervisor Fowler. The items that I would add to the explanations that you've received are these. First, with regard to the number, if it's 18, let's just say it's 20. These are individuals that could even be in that class of what we call super utilizers. Those are individuals that the criminal justice system sees time and again, sometimes monthly, sometimes weekly. I think in the list of super utilizers that the Flagstaff Police Department maintains, there are individuals who can be arrested 4, 5, or 6 times in a month. That's rather high, and it's not everyone on that list. But part of the problem is that the mental illness is animating a lot of criminal behavior, but the criminal behavior is really symptomatic of a mental disorder. And so the idea in this zero intercept, if you take a look at that diagram, it's a longitudinal diagram. It starts at the beginning of an incident and it ends at the end of the criminal justice process. There's really 2 points in there where the criminal justice system sees the mentally ill, and it's around that intercept 2, intercept 3, where an individual makes their first appearance in a court and is assigned an attorney, and professionals are able to observe the defendant's behavior to determine if their conduct is animated by a mental disorder. So it comes around 2 or 3 in that intercept. But the real opportunities in that diagram happen at the 0, where you're out in the field. And if you look at that diagram, you'll see that there's a 911 call and a response is made. And the gains to the criminal justice system are actually, if we can be at the front end of that diagram of events and be directing people at that point to mental and behavioral services so that they don't get down to intercept 2, intercept 3. And now suddenly they're wrapped around the axle of the criminal justice system, and we're spending time and resources and professional services in a prosecution context or in a criminal justice context that we could save if we only identified and front-end loaded our identification and our contact, our handoff to treatment earlier in the process. So when you speak of people who are suffering from mental disorder and you're looking at that continuum, we're seeing a lot of activity at 2 and 3. We really want to front end load it at the 0 intercept where we can have handoffs to professionals in health services as opposed to trying to deliver health services through a criminal justice system. So that's my contribution to the conversation. Thank you.
Thank you, Mr. Chair, Madam Vice Chair. Does that address your question at this time?
It does. Thank you. Thank you for taking the time to explain that, because, you know, there are, justice system is very complex and we don't, and so a simple diagram really makes it, simplifies it. But if you're not within that world, then, and you bring up these terms and these terminologies and these programs, you don't know where it belongs in that system. So thank you so much. Really appreciate it.
Erica, you can continue.
Absolutely. And thank you, Supervisor Fowler, for asking those questions. That's been the balance we're trying to reach of not inundating you with information because it is such a complex system. And for this sequential intercept model, this conceptual framework here, that's the standard model. And we actually have staff, Judge Steinlage has been working on actually mapping out all of the different touch points in the programs within Coconino County as well. But that, as you can imagine, is a much larger and more complex document, and it's still being developed and evolving. And so we wanted to start with this framework first and move through that.
Erica, if I could, Mr. Chairman, Supervisor Vasquez has his hand up.
Okay. And Geronimo, we got to scroll up and down. So we're not saying it, just give a shout out.
We'll keep an eye out for you, Mr. Chair.
Okay, that'd be good. Go ahead, Geronimo.
Thank you. I appreciate that. Thank you for the presentation and the explanation of the sequential intercept model. I'm a visual person and I didn't quite understand it until now, until seeing it on paper. And I appreciate the explanations by our county attorney and our judge of what this looks like in those realms. So thank you, because I understand it better. And the piece that I'm looking at is you know, we don't want to work in silos. And in this, that's what we're trying to change right now. We're dropping the plate, as Joe Gutierrez used to say, picking up the pieces and reconnecting it. And I just want to make sure that we're not duplicating any work that doesn't need to be duplicated in different departments, and that we're streamlining it and effective. And I really appreciate the front loading and intercept 0, intercept 1, and really trying to make that stop it there so it doesn't get further down the sequence. But I really appreciate understanding this intercept model now and how it's sequential, and how if we can get it up front, we can put it a trickle down at the end, which is ideally what we'd like. And so I just wanted to just say that I appreciate the work, and I think you guys are really, really close to getting what we need. You know, there might be a few little tweaks here and there, but I think it's really close to something that'll be very productive and instrumental for our county and mental health services moving forward. So thank you.
All right.
Can I follow up and ask again?
Go ahead, Lena.
The justice courts that are in our counties, the outlining area, they're within this diagram, right? This that is before us.
So if I could ask, let's see, may I ask to see Kim? Well, I saw Kim pop up, but I'm wondering.
And the juvenile justice as well.
Erica, can you provide a little background on the entry points here? And then I'm going to see if we can also get other folks to come in.
We could promote Casey Lightfoot, please.
Yeah, so Supervisor Fowler, they're not in that model, because that is the conceptual framework. They're not called out specifically, but yes, I believe the courts that you're referencing would fall under that intercept 3 with the specialty courts and the dispositional courts. And I see Kim and Casey are on here, so anyone feel free to jump in as well. But also the one thing I would reference too is that addendum document that we shared, the 2-page overview on the sequential intercept model, does have some more detailed examples of what the programs look like at each of those intercepts, intercept 0, 1, 2, all the way up through intercept 5. So, and that's again at that higher level, but I will turn it over to Casey, I believe, to answer about juvenile first.
Thank you, Erica. Yes, Judge Fanlagi did most of the work on the sequential intercept model, but juvenile absolutely can be applied to the same model. It's just different language that we would use. But in theory, all of those intercepts would also apply to juvenile. And then Ms. Shaw's work added what we would provide currently to our community in those categories right below the model.
And I would add here too, so once we move through this document, and then we'll talk more specifically about those ARPA proposals, what we did try to do is align the proposals that we're requesting ARPA funding for with the appropriate intercept. So you'll see the juvenile proposal and what intercept that does fall under.
Mr. Chair, I've asked Sharon Yates and Shelley Bacon to be promoted to respond to the Justice Court entry point here.
Okay.
And Shelley and Sharon, you will need to accept the request to be promoted to panelist. Okay, I see them on. Sharon or Shelley, are you on panelist yet? Sharon, are you on?
Hello, good afternoon, everyone. Sorry, it's a little dark in here.
Okay.
But yes, the justice courts would fall under the same area as the courts. So it's all inclusive, not just one specific court. So it includes Superior Court, the justice courts, but not only the justice courts, it would also include the city courts.
Okay. Thank you. Let's see, Madam Vice Chair, did that answer your question?
That was a yes from her mouth.
Okay, thank you.
It was on there. Yeah.
We're good.
But we read it.
Okay. Erica, you want to go back to your orientation?
Absolutely. So providing that framework, that was our intent. So that was an important discussion to have to try to understand effectively what this funnel of intercepts are and what the goal is to try to make sure that we're engaging folks with mental and behavioral health needs, whether it's a diagnosis or a substance use disorder, to connect them to the appropriate care and to understand where are those gaps. And so from that broader perspective, then we wanted to move into talking about the theory of change for all of these ARPA-funded mental and behavioral health interventions. And so I'm going to touch on this briefly, but the most important component is that we recognize the challenge and the need here as a collective, as that steering committee, as most of, we're sure the board members, you've seen this in a multitude of different ways throughout the community. But ultimately, the increasing number of individuals with mental and behavioral health challenges and substance use conditions engaging with the criminal justice system ultimately result in negative outcomes for individuals, for their families, for our community at large, increasing costs to the county that are not sustainable. And it's a mismatch. It's a fundamental mismatch between the needs for services that individuals have and the system that they're engaged with and how they're able to address those needs. What's the most appropriate response to this person? And so the need that we've identified through the development of these ARPA proposals is to increase the interventions, providing appropriate supports across this intercept model, recognizing that, as Supervisor Vasquez was saying, mental and behavioral health challenges do not discriminate. They impact domains across the county, across all of our different service modalities. And so this is our attempt to identify that need, to improve that access to appropriate care for individuals and improve outcomes for individuals, their family, community, and redirect our justice resources to support the justice system's ultimate goals. And so that is the ultimate need here. And these American Rescue Plan Act funds represent a once-in-a-lifetime opportunity to bolster and innovate and provide supports at these different gaps across these intercepts to really accomplish that ultimate goal and that ultimate impact of alleviating strain on the justice system so that it can function as it was intended to, and redirecting individuals to those appropriate culturally competent treatment resources and improving outcomes for folks and for our community. And so in that effectiveness section, you will see kind of the rationale behind the importance of prevention and early intervention across these different intercepts and across the different programs that we're proposing, with the understanding that these are best practices across every different department and discipline. We understand a lot more now about what are the things that work and why do they work. And so we're trying to outline our understanding as a steering committee of the need, the effectiveness of the programs we're proposing, and that these outputs, these proposals that we'll talk through on that next page, that they will get us to those outcomes of improving those individuals' lives, our community, redirecting resources appropriately, and hoping to prevent a lot of unnecessary harm, decompensation, and other issues that stem from these challenges that go unaddressed. And so that's the high-level overview of our theory of change. What we wanted to share that overview and to really lay the framework for how we got to this ultimate proposal that you've seen and that we've been discussing. And so the last section on this page that I'll touch on through the identification of the needs, through reflecting on the different intercepts, the programs that we have available here in the county, and the programs that we have just not had the capacity to implement. Part of that process involved taking a look at what are the existing programs to make sure that there isn't a duplication of services through these proposals, and then moving to what are the current gaps and how can we best meet those needs, both within the county system and then also looking at the broader community needs, because this is not just a Coconino County endeavor, but it really is a community-wide focus. And so the existing programs, I won't belabor those, but we've kind of broken those out in some of the departments that you are all pretty familiar with. This is a non-exhaustive list, as you well know, because we do provide many services, but these were some of the programs that most directly tie to a lot of these interventions. You'll see a long list from Health and Human Services, and a lot of these programs, part of the work of the steering committee is to maintain our awareness of that and to make sure that when we implement these new programs, the programs are talking. There are those referrals and linkages across the previously existing programs and the new programs, utilizing grants and funding available and new positions that may be available in these departments to help bolster the proposals that you'll see on the next page. So then I do want to take a moment to reflect on the current gaps that we've identified through this process using the sequential in-a-step model tool and the discussions with the steering committee. Ultimately, we understand that within the county, within Coconino County and our system, our broader system, deflection and diversion programming, and those are those early programs trying to implement prevention and to redirect folks to the appropriate resources. We simply do not have enough funding. We have not historically had that, and we recognize that that's a best practice to enhance those programs that are available to redirect folks. Rebuilding the low-risk mental health court and then also implementing a high-risk mental health court in the Flagstaff Justice Court and the Superior Court respectively are two priority areas. Also, focusing on criminal justice system navigators to support individuals who are navigating these complex systems. If we're taking this much time to try to outline what the system looks like across the board, the folks who are engaging with it could always use the support in navigating and having those improved outcomes. Looking at restoration of competency as a topic that we continue to focus on and address internally and with our external partners to ensure that the desired outcomes are being achieved, and to continually improve that process as a county. And then also looking at funding for expanded prevention programming outside of what we've mentioned. And so we understand those to be best practices and that those are areas that the county can grow. And those are current gaps that we hope to fill. Additionally, community needs. Clinical providers are continually a need in our region. Longer term substance use programs and supports for folks who are deemed seriously mentally ill, treatment both residential and outpatient, as well as mental and behavioral health providers as well. And again, prevention education, youth intervention and services, and mental and behavioral health education for adults who are supporting youth are just the topics that kind of rose to the top for the community needs that we've identified. So again, I want to pause to see if there are any other lingering questions around this, the why behind our ARPA proposals. And then we will move into the details around the how and the actual programs. All right, so then I will.
Mr. Chair, I don't see any hands raised yet, but I'm still looking for you.
Yes, starting to scroll. All right, not seeing it. Okay. Okay, go ahead.
All right, then I will move into what is ultimately our map. So this was an attempt, again, by staff to try to visualize and share with the board the ways that the programs and the proposals that we've brought before you connect, how they support one another, and how they kind of build out this system. One thing I want to call out, and I'll walk through the key with all of you to try to address what can be intimidating and a little bit overwhelming at the start, but this document really is that high-level overview, and so it's intended to provide that map across the different domains, and it is supported by the 14 or so pages of detailed program information that you also received. So we wanted to start here, and then we will move into those specific program questions. So for this document, I want to encourage you to try not to get lost in those details because we'll have time to talk a little bit more specifically around those. But that's the intent behind the document here. So to start out with, to kind of decode the document, any of the document titles that you see here that are bolded are the recommended programs that we're bringing before you with a request for that funding amount. If the title is not bolded, then it's not included in this total package of documents. As you'll see, we didn't include all of those other existing programs because this document would have gotten more complex. But if you have a question about that or any other programs and how they relate, we'll obviously answer those for you to the best of our ability. So then I want to look at the key here. So as I mentioned earlier, each of the programs and the proposals have been separated out by the department or the entity that's brought that proposal forward. And then they've been color-coded to link to that sequential intercept model that we just reviewed. So the primary color of each of these different programs correlates to that intercept, and they've been labeled at the bottom as well. If there's a second color border, so over here on the right-hand side of your screen, that outer border represents an additional intercept if that's applicable. And then there's also the dotted dashed outline here that represents an existing county program, but that's not ARPA funded. And then there's also the outline over here as well that represents a new program that is not ARPA funded. So I'll add those details as we move through it. But then you'll also see these directional arrows that are kind of linking all of these programs, and that represents the opportunities for collaboration, for referral, and for linkages across those different programs. I do want to call attention to, at the top of the document as well, our Mental and Behavioral Health Spectrum County Steering Committee. So that's that group that Steve mentioned, all of the different partners who have helped inform and piece together these different proposals and have these discussions about how does this work and improve this so that we can have the maximum impact in our community. So they represent kind of that steering committee and that group that will continue to meet beyond, even beyond the American Rescue Plan Act period. So to review the rest of the documents or the rest of the proposals, we'll start on the left with the superintendent of schools, and that's that $750,000 recommendation. That includes our Building Resilient Youth Communities and Educators proposal, and then also a learning loss coordinator. And so those proposals and those programs will be offered to schools countywide, so that will maximize the reach. Those are really training and support programs for those schools, and the staff there will help provide that mental and behavioral health and social emotional learning training to the schools, so they'll retain the capacity to better support their staff and their students. And those trainings, those staff that will be included in this proposal have the opportunity to refer young people and their families when they're engaging at their school community to our juvenile detention proposals, the ARPA proposal around that non-detention alternative, as well as our BBB parenting and transition school programs and the youth behavioral health pilot. And so those referral opportunities exist, and all of the staff and all of the individuals engaged in these programs will be made aware of those existing programs, will be informed and directed by that steering committee, and will ensure that we have that linkage between these programs. So we also have the juvenile justice program in the next pillar at Intercept Zero. That's the HALO non-detention alternative that provides sheltering for young people when they're referred to juvenile during often domestic violence situations. That includes safety planning. So again, that's a referral source from the schools. And also there's the capacity for referral from that juvenile program to the HHS program, which I'll talk about in a moment. And again, BBB parenting and the transition school program, both of those were included in the original request for expansion dollars for those existing programs, but they're not included in the recommendation. So those are existing county programs. They just won't be continued. They won't be funded through this ARPA recommendation. So in the middle, you have HHS and the behavioral health supports. We have called out HHS as a primary pillar with that blue background, just to identify the integral part that HHS and most of that health education and prevention and support provision that HHS engages with, building that out. As County Attorney Ring mentioned, this is a health issue. Mental health and behavioral health and substance use disorders are health issues, and so HHS will play a critical role in supporting that and addressing it. The current proposal includes the development of a recovery and resiliency division and a youth behavioral health pilot to provide integrated services to young people in the county. And so that is a hub for receiving referrals and providing services from the other programs that are proposed. There's also a deflection and diversion component that was included in the original proposal, but as it currently stands, The Sheriff's Office, in collaboration with Health and Human Services, are pursuing state funding for a diversion model, and the county attorney is also pursuing through legislative advocacy a deflection model there as well. So we hope to see those. They'll be a critical component of this spectrum as well. As we move further to the right here, we have the mental health court expansion and the development of an additional superior court division. That request will create a new division so that backlogged cases that resulted from the COVID-19 pandemic can be redirected appropriately and increase that capacity, and then will allow the court to begin the development of a mental health court so that they can process the cases that they're seeing appropriately. That also includes a mental health coordinator position, which is statutorily required. And so we have, again, the ability to refer individuals from that court to the appropriate support resources, be it at HHS through those, the recovery and resiliency component, and the potential deflection and diversion programs that we're trying to implement. And then on the far right, you'll see our criminal justice linkage and innovation proposal. And that's the $1 million recommendation that includes funding to enhance and to receive contracted restoration to competency services so that we can better meet the mental health needs of those individuals that have been determined to need restoration of competency. And then also 3 system navigators to support individuals in accessing that appropriate care, with a real focus on cultural competency and responsiveness and capacity for engaging with a multitude of individuals across the system, and those staff will be employees of adult probation. So I recognize there's a lot of information there. I will again pause that we can reflect and answer any questions. And again, this is kind of the cover sheet and the overview of how these are connected with that additional documentation of the program overviews that we tried to standardize so that you're receiving the same information across every single program so that we could answer those questions that we heard from you.
All right, turn into the board. Do we have questions or comments associated with it? Okay, I'm not seeing any at this point. And, you know, a piece I would suggest is as we go along, for the sake of the board, some of these are more detailed as noted when the initial model was set out there. There's a lot more behind the scenes where we have our practitioners here that really can answer questions more detailed, the implications, what they see within the system, and the cost associated with it. I have Supervisor Vasquez. Go ahead, Veronica.
Yes, thank you. So my question is, I really appreciate that next slide because, again, I'm a visual person. I like to see the connections and the colors. That works for me. The question that I had is, what pieces on that slide is the intention or the thought of partnering with communities, partners, and doing applying for mental health services through that funding source? Like, how many is that, or is that even not an option in there? What's that plan on that end?
Mr. Chair, if I can address that issue. You're speaking, Mr. Vasquez, to the nonprofit funding. Okay.
Yes.
And so,
so that's my question in essence is what's the connection to, because I know we're looking internal to make these shifts and some things are not going to be funded through this, and that's understood, and we'll find other fundings. What programs is the intention to then turn around and apply through community partnership funding for mental health services? What's that web look like?
well, that's to be determined. And so that's the presentation we're providing to you on Friday.
Sweet.
So
Okay, thank you.
There's a $5 million allocation that's been set aside for community partnerships, but that also includes, and this is going to be an important discussion with the board on Friday, is the capacity within that pool of funding for supports to businesses. And so getting to that broader discussion of the available revenue to address community partnerships, the intent today in basically providing this to you first is that if the board so chooses, and an important discussion on Friday is what are the categories within the community partnership pool do board members want to see listed as categories? And you know, what we provide today as a framework, I think provides some indication while we're looking at the proposals that are coming in. Is there a possibility we may be aligning what we're doing here with some of the partnerships that might be coming our way? There's also there's also an important discussion on Friday on what the county's role is or will be in that process. And we'll get to that on Friday. But again, I hope I answered part of your question at least.
It did. Thank you for the clarification, because see, my thought is we're gonna have to fund some of it outside of it, and that's kind of a given. And what that looks like is still up in the air. But just like I said earlier, I'm just looking to make sure we're trimming the fat and being as most effective and not overlapping on projects and releasing some of the pressure. So us as the county in doing this aren't taking too much on. And so there is that piece for the partners, and I recognize that. I just want to make sure that we're getting it streamlined and effective the best we can, because as you said, this is a once in a lifetime opportunity to do it. And so I'm really excited. I think it's a really awesome, and I'm looking forward to hearing that next piece of the presentation. So thank you.
Yeah, but yeah, Steve, but it should be noted that, you know, and correct me if I'm wrong, there is a suggested, we do have referrals here that would be outside agencies, but that amount is not in this pool, it's in that other pool and if they aren't funded, we need to understand the cause and effect associated with the systematic approach of what's occurring here.
Okay. Mr. Chair, County Attorney Ring has his hand up, but I see Supervisor and Vice Chair Fowler have come on screen too.
Thank you, Mr. Chair. Supervisor Vasquez, I was simply going to add to what Steve was addressing, particularly when we're talking about mental and behavioral health services. We all know that this community is extremely thin on those service providers. We may have one of every service provider, maybe there's gaps and we have none. When we design a program for behavioral health services, we will need to go out to the community with requests for proposals and requests for quotation, quote for services. We are going to need to design the programs that support the overall intercept model. So there's no surprise in that. Now, whether that's part of the next bucket that you'll discuss on Friday or not, the next bucket may support the design, but we're designing this in such a way that we're able to provide the services. So we are going to have to go to the community for these services, whether it's an ARPA bucket or some other bucket.
But there are implications, no matter what, there is a cost associated with services that would not be internal if we were putting them out to RFP. And so it's just, if those services aren't available, what is the option? What is the implication associated with the program?
Yeah.
So that's a piece that, keeps wandering into a couple of the questions that have bubbled up.
Yeah, and Mr. Chair, if I could just reply to that. We all know we're going to have to design something. And there's work to be performed after the board evaluates and decides on the proposals. We know there's work to be done. I don't believe that the presentation today provides you with solutions. What it does is it provides you with a roadmap. And we will, this is not the last day we're working on it. This is the first day. And so I want to encourage you to think, seriously about this particular presentation for ARPA for behavioral and mental health, knowing that you've got some of the best people in the county working, not in the county organization, but in Coconino County generally, working on solving this problem. And we've been working at it for a very long time. So you've got the right team members, and if we don't have the right team, we'll go get the right team. But I want to be positive with you about our opportunities here. Thank you.
All right. Thank you, Phil. All right. Other questions or comments from the board?
Comment.
Go ahead, Judy.
I want to thank the staff for presenting this scenario to us and the model framework that they put together. One of the things that I wanted to know is as we have all these collaborating partners within that we're looking at, NAU, CCCY, and NARBA, and Stronger as One, and Community Health, Human Health, all of these, and then county schools too. And I'm kind of wondering, since we're partnered, is there some information that you guys have on hand? Anybody have on hand that would kind of show us what kind of services they provide? I think we were just kind of looking, or the discussion at one of the meeting was that we didn't want to be duplicating services. And so I'm thinking that maybe that would be something that would be solicited for us as board members, just for our information. And what does those others do? And it's really one of the things that happened is that in our area, apparently there was programs that solicited dollars, and they got all these dollars straight from where they make money. and then on top of that, they were asking for more money on top of that. And so it's just like, and it was kind of like duplication of services. So we just want to make sure, that we're trying to attack this as a whole, not, missing parts to it. So I'm kind of thinking maybe that during Friday's meeting that we would have that information. It could just be a one pager of the services that they provide under this mental health and behavioral health services that they provide. So that's the only comment I would like to make. And then I think this is a job well done. And I thank all the committee members, for putting it together. And it's a start. And, we just need to look at other areas. Maybe other areas are doing something that we can help with too, or they can help us, so that we're making this whole model a whole. So that's what I'm looking at. Thank you very much.
And I see Steve nodding his head, right, Steve?
Yeah, Mr. Chair,
Yeah.
just to make sure. So what I put down is when we look at the model that Erica has gone over, in addition to what we see here as referrals, you would like to receive, what are other community resources and programs that are utilized by the various partners, not only within the justice system, but also with the superintendent of schools office, just to outline some of those services, so that what we see from that list does not duplicate what we're trying to create here as well.
And I think I also heard from Judy. So we have NARBA listed, but what programs, what type of programs will they be offered? So a little bit more, I guess, definition associated with who the agencies are and seeing their role related to that. Simpler on that, one to keep in mind, probably an American note is if we had an acronym list and started to develop a definition list associated with this, that would be helpful. Anybody else? Patrice, go ahead, Supervisor.
Well, if Erica, I'm not sure if you have more to present. I have some comments. I was kind of waiting until the whole thing was kind of rolled out. So I can make them now, or I'm not sure if you've got more information you'd like to provide.
So we're lined up for about 2.5 hours, 3 hours almost. And I believe we have more delivery, but go ahead, Erica or Steve on that.
Well, Mr. Chair, we can proceed with the balance of the presentation, but do you want us to respond to questions in addition to Supervisor Hoshman at this time?
So you still have more balance of the presentation to have. In the meantime, we are having these pauses now, but we're not there. It'll be a little bit of time before we get there, Patrice.
I just want to hear because I know we all have questions and have a feeling some of them are going to be answered as we move forward. So
Yeah.
rather than do that, I will reserve my comments until we're through with the presentation, but thank you.
And we'll continue the presentation.
Okay, there we go.
Right, so that really is the end of the new information and those new models to try to capture how these programs all are related. And so I wanted to give that high level overview of the program proposals that you've seen. And then the next step in the conversation was really to turn it back over to Deputy County Manager Sue Brown and to Steve to kind of facilitate that discussion around the program details and specifics that you received in those program overviews as part of your packet. And so just to reiterate kind of our intent behind those proposals was to standardize the information. So we know that we heard feedback from the board about the service delivery area, what staffing was included, the cost, all of those details. So trying to standardize that information to present it to you in a way that allowed for a comparison and discussion between those programs. So I will stop my section. I'll turn it back over to Sue.
Thank you, Erica. Could you put up the first program description for us? Thank you. Mr. Chairman, members of the board, what you see here is an expanded version of a program description than you've seen before. Based on your comments, we used as our template our budget program descriptions. And so we've added quite a bit of information. This particular description is for the superintendent of schools, and it includes the building resilient youth educators, school communities, and the literacy student achievement loss proposal that the superintendent had put forth. So we'll just go through the categories and you can take a look at them as we go through. Of course, the service name, the program cost, that's the modified cost from the initial ask. Then a program overview of the details of the particular program. Then the service delivery overview, what and where they're going to happen, but then a more specific category of geographic service location. In this case, the superintendent details that it's virtual, on-site, and hybrid services, that there are virtual capacities for particular parts of it, and then it will be in schools in Page, Fredonia, Tuba City, Flagstaff, Williams, Grand Canyon, and Parks as well. Then we move on to diversity, and it indicates how the proposal will reach all diverse populations and how it will support diversity across the county. And the superintendent of school has done an excellent job of really keying in on how these programs will do that kind of outreach. Then it talks about what the particular staffing is, and then what the metrics are, the data collection process and overview. What information are we going to pull out of these programs as they're going, and hopefully be able to detail those outcomes. Then what are the collaborating partners? Who's participating with this as well? And then referral programs and connections to their programs. So certainly those referral lines you saw on the intercept model, the county intercept model, you'll see some of those, but here you will see some of those other programs that you mentioned that you'd like an expanded list of, but you'll see on each one of these program descriptions who those other partners are out in the community. And in some cases, they may be other counties, et cetera, as we go throughout the county. And then opportunities for operational sustainability. This is a major question. What other funds are out there? What may seed a future for these programs so that we're not looking at them solely for the next 2 years? And then finally, the outcomes. What are we going to get at the end? And what we'd like to do, we'll go through each one of them, check and see if there are any remaining questions on each one of these program descriptions. And we do have our proposers in the audience and we can promote them should we need to. So Erica, can you go back to the top of the superintendent of schools and just check with the board, Mr. Chairman, if there are any questions on the superintendent of schools program description?
Okay, turn into the board. Do we have questions on this? Just kind of scrolling up and down. Not seeing any.
Thank you.
Okay, Vice Chair Fowler.
Lindsay, can we promote the superintendent of schools, Cheryl Mango Paget, please?
she's with us now. Okay, Sue, we're ready.
Thank you, Steve. Madam Vice Chair, Superintendent of Schools is here. What can we answer for you?
Okay, there are a number of things that I had a question about in this one. There are these proposals. I just want to make sure that the schools are ready to take on this project. They're going to be doing teacher training. Sounds like that's going to be part of it. And also, you know, the they're going superintendent of school, you're going to be you're targeting one of them is going to be in Tuba City, and it's on Navajo Nation, and yet your partners and your referral is not to Navajo Nation programs. Navajo Nation has its own mental health programs in the youth area, as well as adults. And I'm wondering where you are in partnering with the communities the community programs that are in place for these young people that you will be working with. Majority of the schools, Page School District, 89 to 90%, and sometimes it's 95%, are all Navajo students that are off Navajo. And I believe when you talk about, when you say, refer to the QTC, and you're looking at the educational disparities, behavioral health, and you're really looking at the tracking system, then when you look at Flagstaff, then you're really looking at the Navajo Nation portion. So now I'm wondering how you're partnering you're not partnering with the Navajo Nation system that is in place. So where does that come in? I also, so that is, and then data collection. I assume that we are not funding a research project. If we are, where's the IRB and what IRB are you working with? You have both qualitative and quantitative data. And if you're doing a research on Navajo Nation, you have to go to the Navajo Nation IRB, and that is not allowed. So, and then you have to go into the Tuba City or IHS IRB as well. And I don't want to I want to make sure we're not going there.
Mr. Chair, this is not a research project, and I understand IRB regulations. We take them very seriously, but this is in no way, shape, or form. This is no way, shape, or form a research project.
Okay, I assume that, but I just had to ask the question because this is a time for us to make sure that we're not going there.
Yeah, and I'm well versed in IRB regulations, and I appreciate the question because that's an important distinction. Because if we were, we would have a whole other governance structure related to IRB regulations, but with FERPA and everything else. So I can appreciate.
Yes, thank you. And we need to make sure that this is clear to the public as well as everybody else. So we want to make sure that we're not doing that. And that's, it just said that data and then the partnership and your referral system here. You don't have any programs that are on Navajo Nation that you're going to be partnering with. So I like to find out where that is. For now, I have those questions on this one. And I believe I have more, but let's start with those.
Okay, well, thank you, Supervisor Fowler. First of all, you talked about school readiness. And as far as this proposed program, I have over 17 letters of support from schools throughout the county, including Page Unified's interim superintendent, Dr. Anderson, a letter from Dr. Terry Maurer over at Tuba City. I was actually on the phone with him today talking about the mental behavioral health program. I have letters from our charter schools, Fredonia. I do not have one from Williams, but I have all the other unified school districts' letters of support of schools wanting to participate in this program if they are selected. So I think they're ready. And we will be doing different models depending on each school is not the same. And each school community is not the same. Does that answer your first question?
Yes, thank you.
Okay. And I can provide you with those letters of support. Yes, it is not a research project. I'm meeting with chapter officials for 2 other IRBs for some research projects we are doing. But this is not and so we're very aware of IRBs. And it is not a research project at all. It is just measurements for us to look at to see, is the program effective? Do we need to make changes? Do we need to pivot? And what conversations need to take place? As far as looking at our partnerships, if we are funded, we will be looking to expand that partnership list. Right now, those are the partners that we have secured. I do work with the Department of Diné Education. I do know there are several mental health service providers up in the Tuba City area. And if Tuba City chooses to participate, then we will look to expand the partners. But these are the ones that I had secured because first of all, Paige was missing a superintendent and they're reorganizing. And Dr. Maurer and I have been talking. And so he's going to be making introductions if this is funded.
Okay.
Did I answer your questions so far?
Yeah, I just want to make sure, yes, thank you, appreciate that. I just want to make sure that we're working with local agencies. Most of these agencies refer to students, as far as I read it right now, if they're all being referred outside of their community. So I think that we need to use local resources and want to make sure that we're aware of those resources. The other one that I noticed in your language here was migratory students, English language learners. And so I'm just wondering how you're using that word.
That's for students who they don't learn. Their first language is not English. And that is just a technical term that I pulled from, that I use from ADE.
Okay.
And,
right.
and we're not really referring anybody out through this program. These partners would be supporting us in delivering the program. And as I said before, is if Tuba City chooses to participate, if funded, then I will be working with Dr. Maurer on making some more connections.
So is any of this funding going to be contracting for services?
Has any of this funding been? No, the only program would be professional services. It would be possibly if a school wants a very specific training that we don't have the training to do, we're not certified, then yes, we would ask somebody else so that we could meet that school's needs.
Can I say something, please?
Yeah, I saw your hand out there. I just want to make sure you want to comment on one of these pieces that Lena has right now, Veronica?
Yes, it's actually to clarify about English language learners. So in my time at Killup, what we're talking about here is basically kids that were their first 5 years of life were around a different language than English. So for kids on the res, that would be being with grandma speaking Navajo. In Killup, When I started there, we still had kids showing up that were born in Mexico and arrived. They were now our Dreamers and our DACA kids. Now it's different. The ELL kids are more the children of those kids. And so they still grow up around Spanish, even though they speak English at school. Those are still ELL kids. And so services for those kids, that language for English wasn't their primary at home, even though they're still functional in our society. And so that's where getting that, where the culture and the language piece, this work is so crucial. And the social emotional piece to support it is not just for our students, it's for the staff that are serving our students and working with those families, because they're on the front lines and they're getting burned out and stressed, and this is extra support for it. So I just wanted to make that clarification, because when ELL came up, there was some concern. And so I want to make sure that people understand what that means in terms of supporting families, in terms of supporting people. Thank you.
All right. If I could add, I'm really happy that you're focusing on the third grade level reading, because that is something that the state legislators have implemented, and I believe the schools with that kind of support will be able to help our students be able to get advanced, especially when during the pandemic, when there was so much school time that didn't happen. And so our students are way behind with that, especially the younger ones.
Yeah, I just did a leadership survey, and I did a similar survey, and they expected a learning loss of 3 to 6 months. And I had one of the sliders, and I just got 17 school leaders in our county have responded so far, and it's all the way across to 12 plus months. And we have it divided also into students of high poverty, English language learners, as well as some other different types of vulnerable population descriptors.
All right.
Can I add something to that with COVID?
I'll get you Patrice in a second. Go ahead, Corrado. Yeah.
I'm sorry. It's because I don't want to lose what she's talking about, because when she moves, it's going to get lost in the shuffle. Okay, but that learning loss and the gap between the haves and the have-nots, COVID made worse. Like the work that we did at Killup, we lost a lot of years of preparation of our kids because of COVID. Our numbers, we were getting them down to where the third grade read when ready, our numbers were acceptable, and we lost that during that time, what that we've seen. And so I can only imagine what it looks like countywide, if it's even worse in some of these rural places where they don't have the supports that a school district like FUSD has to deal with that learning loss and that gap and that divide in services for these kids. So it's really crucial that this SEL components and this support is provided so that we can make sure that we address that learning loss, because otherwise it's just going to continue to slide down or downward. Thank you. Sorry.
All right. Key points. Go ahead, Supervisor.
Yeah, thank you. And I just because we've gone so far afield, I just want to make sure we're all talking about the same thing. ESL and ELL, in fact, are recognized terms. They're terms of art that have legal significance to them. And quite frankly, that significance is recognized both on the state level and the national level. And so I am assuming, Superintendent Padgett, that when you are referring to that, you are referring to the state and the national definitions for ESL and ELL. And I think that the reasons that Supervisor Vasquez was indicating, and because I think of some of the educational gaps that have occurred with ESL and ELL students, is one of the reasons that you're looking to do a building resilient youth and to provide a county-wide system to help our public school districts throughout the county. Isn't that what this is about?
That is correct, because especially our smaller schools and our schools that don't have a lot of service vendors in their general area do not have the capacity to do this alone.
And I'm also assuming that what you're trying to do then is you, the county school superintendent's office, is looking to partner with these public schools. And as a partner, then that public school will go into a school community partnership for the response, for the resilient youth, for the needs that are needed, correct?
That is correct.
And so does that mean that the school districts then would make a decision about who for that school is the best person or best agency to be able to provide the services for that school district?
They will definitely have that opportunity to input because stage one is building that foundation with the school district. And so that is, or school, individual school, it might be some individual schools. And so with that building foundation piece, that is doing needs assessments and then identifying the who, the what, the when, all that as to what services, because if we were to do something at Killip, some of the programming is going to look very different than what it might look like at Page Unified School District.
And so you're allowing those school districts who know their students best, who know their community best, and know who the providers are to be able to direct these services for their school. And you're there to help. Is that right?
We're there to help as well as also provide some of the services.
I just want, I mean, because you are not directing the individual schools on who they need to call, who they need or what to do, because they're all different. Like you said, what Killip needs is different than Page, it's different than Lou. So I just want to make sure that, I'm not losing track here on what you're trying to do. And I think it's a wonderful opportunity that you and the superintendent, as a county superintendent of schools, that you can provide these types of services to our public schools in the county. Hasn't been provided ever. So that you're able to do this and that we have the ARPA funds that we can support you in providing these services to our youths countywide. I'm very excited about that. And I'm sure you are too, Superintendent Mango Paget. It's quite a unique opportunity. Thank you.
Thank you. Are there any other questions?
Well, and it ties back into a mental health component. So services, but playing into it, and just as noted, services that have been needed. I'm not seeing additional questions at this point. Supervisor Begay, you just popped up. Did you have a question?
I have a question for Cheryl. We have two schools in Tuba City. Out of curiosity, I was thinking about the grant school there in Tuba City. And I know that you're probably just focusing on the public schools, and in your document it just says schools, so I'm just kind of wondering about that. I assume that like Gray Hills Academy High School is a high school, would go through different avenues, or they're not part of this whole plan, right?
I have not heard, they have not provided a letter of support, but they are eligible to participate.
Has anybody reached out to them?
Yes, we have reached out to them. I'd have to look to see how many emails, and I know it's been 2 phone calls because I made the phone calls, but we just have not had direct communication with them at this point in time.
Okay, thank you. It's good to know that.
All right. So, and a lot of this we're working through. That's the first item. We do want to get into time management associated with this, but it's good to set a foundation, start to get a familiarity of what's going on. Go ahead, Steve.
I'll turn it back to Sue. We'll proceed with the next item. Thanks.
Thank you, Mr. Chairman. Erica, can we pull up the next one? I believe is juvenile.
I'd like to ask another question. I want to go back before we move on.
To the
on your
superintendent's
chart, yes, please, if I may. On your chart here, the referral system, it says that you can make a referral to the non-detention alternative housing, and I think it can also refer to you. I'm just wondering, how does that work, and how many students have you referred to this housing program before?
Madam Vice Chair, are you referring to the county intercept model? Yep, we'll get that up there. This one, is that correct?
Yes. Uh-huh.
So you're referring to the Building Resilient Youth Communities and Educators, referring to the Halo non-detention alternative and to the PPP parenting?
Mainly the one that to the housing. So
Okay.
how many have you referred the students there before?
I personally have not referred any students. We have done some of that through the accommodation. I think this was just a model to show how it could be connected.
And Madam Vice Chair, if I might, I believe that Casey Lightfoot with Juvenile can explain how they accept referrals to the Halo model. Would that be appropriate to your question?
Well, when we get to it, I'm just asking this superintendent because she's in this model that is working towards directing people into the court system. I know it's not directing them. They're trying
No,
to
it's basically what this model is trying to show. Do you have the theory of change, Erica? Because by doing the building resilient schools, we're hoping to avoid and have less of those referrals because we will have stronger, mentally healthy students.
I understand that.
Yeah, I personally
That's
refer no one to those programs. Our accommodation district may refer people to those programs. And the model was just trying to say that, if we do these things up front, we're hoping, because we do have referrals that come from the schools as a whole to those programs. I think I got that out right.
Thank you.
Madam Vice Chair, do you have a follow-up?
No, that's good. I just want to refer back to their chart here about the court system.
Appreciate that.
Okay. And we finish this superintendent in schools. We do need to do time management, but we also need to realize we got a lot of people sitting here that have been sitting for a while. We need to take a 5-minute bio break here. And we can come back, and the next item we're going to come back to, Steve.
It'll be the next item will be juvenile justice, education, and diversion. Is the next topic, Larry.
Excellent. Thank you. Let's take 5 and then come back. Do 55.
Hi, hold on.
as we come back. Can you come up on screen just so I can see that we're getting the board back together here? All right, there's Casey. Good deal. Geronimo, Sue Brown, Patrice. Kind of neat. It is like a Brady Bunch type of thing.
Mr.
Yeah.
Chairman, is there a prize for the first one to get to see a snowflake?
I saw one earlier, so you be careful about that one if you think you just saw one there.
Okay, I'm keeping watch, Mr. Chairman.
Yeah, I saw a snowflake when I was out at lunch. All right, and Judy was there, and Geronimo walked in. So let me see, Vice Chair, are you there, Lena? And there's the ring. All right. And Steve. Definitely need Steve in here.
Mr. Chairman, Steve's on his way. He'll be right there.
Okay, and so you got this one, right? Yeah.
He's out looking for snowflakes, Chair Ryan.
Yeah, I know. And Sue brought it up, and then I could see Steve, kind of like, yeah, our puppy's out there, right?
I'm not. I was actually getting a cookie out of the kitchen. Sorry.
Oh, I'm jealous. I have salad. Would you like some?
It is cold in the home.
Yes, it is getting chillier. Okay. Looks like we have most of who we need. Lena will pop on. We can get rolling with this. Steve, just checking in. Our pace, we're a little bit slow, but it's good to work through it.
This is important, so we're good.
Okay. So back to you, Sue, and then we have Casey popping up here. All right. Good.
Thank you, Mr. Chairman. I just wanted to add, just for context, we will bring the intercept model back up anytime anybody would like to look at those connections. And also just a reminder that many of these programs are proposed for this ARPA funding. They don't currently exist. And the referral lines that you see are referential. They are ideal referral pathways between programs and the ideal for how these programs will work together. So with that, we'll look at the juvenile proposal.
And that starts on page 7, I believe. Right?
Thank you. Erica, is it page 7?
Yes, page 7.
Great. And Casey, please, will you, let's ask, are there any questions about this program? It has the same required sections as the others.
So let me pause with the board here real quick. We can pause and see if we have questions, or do you want a quick summary on this? Just nod your head. I see just about every board member. You want a quick summary on this, or are we okay?
I'd like to hear a summary of this.
Okay.
And then questions after.
Casey?
Sure, thank you. So Juvenile Court is requesting a specific bed at Northland Family Help Center under their youth program. And this respite bed would serve youth that have not been adjudicated and are not in the formal juvenile justice system as of yet. Its primary purpose would be a detention alternative to kids coming in across our county on non-tribal referrals by different sources, from Grand Canyon Rangers to Page PD and everywhere in between. And so our purpose with that is, with COVID, we've seen an increase. I've discussed the pressure cooker in the past with domestic violence, and often youth are who get arrested. It's the easiest, especially if there's other kids in the home, to arrest a youth and bring them into custody. We also see a disproportionate minority contact that gets worse throughout our system's point of entry. And you see that in our detention center. So having this request through ARPA, our goal would be to have a safe alternative for kids to go and spend a night or two, and then exit with 2 hours of counseling through Northland Family Help Center, and hopefully also have a safety plan in place. And so they go back home with the emotions, having had an opportunity to kind of have a timeout, they reintegrate back home, less opportunity for recidivism. The other way that we anticipate using this is if it's not being used currently, because we're only asking for 1 bed, as a detention alternative is through our deflection process, which serves all families. So any parent with children in Coconino County, our deflection process through our Hope Center, but we have services through Williams and up in Page as well. We can offer this bed as a respite for those families as long as it's not being used currently as a detention alternative. And in anticipation for potential questions, Northland Family Help Center is the only agency, nonprofit, that we're aware of in our county that offers a respite bed. It is in Flagstaff, but it does serve youth and families throughout our entire county.
Mr. Chairman, questions?
Turn back to questions of the board. And then scrolling. That's right, it's easier over here. I'm not seeing anybody popping up with questions. And explained well. Thank you, Casey.
Thank you for your time.
So I'm trying to see.
Okay, Supervisor Fowler has a question.
Yes, I do. And so this is these dollars are actually going to the North Family Health Center. That is you're contracting this all of this money out.
Correct. That is correct.
This is an outside agency.
Used to help us deflect from kids further penetrating our system. But yes, we are giving this as a bed to Northland Family Help Center in a contract. We have 3 state, or actually 2 beds that the state provides for us for kids that are already in the system. State funds prohibit being used for any respite for kind of a prevention model. So county funds and ARPA funds are the only way that we can pay for this bed.
Okay, that answer your questions?
And how long do they stay in these facilities?
That would really be up to the parents, guardians, because at that point, they're not under our jurisdiction. So it's us offering a safe alternative. The family would have to be on board with this. It would have to be in conjunction with the family. And we've learned long ago that anything that is beneficial for that child, you have to have family engagement. So they have a large voice in just how long this would be needed in their particular situation.
So there is, and you mentioned that this is off tribal lands.
So for those youth that are referred to our detention center, the only law enforcement entities that refer to us are off of tribal land. That's jurisdictionally just how we work. However, if the bed is not being used as a detention alternative, any family that has youth in our county, so tribal lands included, that would like to benefit from any of our deflection services, which are entirely voluntary, they absolutely are welcome to meet with our staff and develop plans. And we do a 30-day follow-up with them outside of ARPA, outside of this particular request. But that's how this request could benefit any member of our county that has children.
Okay.
All right, that answers your question. Any other questions of board members now that we've heard a little bit more on this? I'm not seeing any. All right, let's go back to Sue.
Thank you, Mr. Chairman. Erica, our next one is the Health and Human Services. For the Behavioral Health Pilot Program, our Director of HHS, Kim Musselman, is here. Are there any questions on this program and proposal description?
I would suggest again just a little summary overview, if you could,
Sure.
Kim.
You can do that. Kim?
Sure. Thank you, Chair Ryan. This is the behavioral health, basically it's a pilot program with the associated program cost of at the $2 million mark. This includes a couple of things. First and foremost, it includes the development of a youth service pilot program that we intend to deliver integrated youth prevention services that will include mental health, behavioral health, peer support, family support. And what we are proposing is actually starting this in a small community. We have identified Page as the location where we would like to pilot this initially. I want to be clear that this is a program that we do not have developed yet, that we will be working with the community of Page initially in terms of getting information about what it is and how we can best serve the community in particular. We don't want to come in with a cookie cutter solution from another community to try to meet the needs of an existing community. We will be working initially with all of the existing Page resources as we go in and start getting information and gathering what we need to identify what kind of a program we will be starting. And that will then also include working with those surrounding chapter houses, are the many numerous programs across the Navajo Nation in particular that we already currently work with. We have our Page Health and Human Services office. We work very closely with the Navajo Nation in particular in numerous different programs in health and human services and in addressing social determinants of health. So that is the crux of what the pilot program is. This will be overseen by, and some of this funding as well, is to fund the what we're calling our recovery and resiliency pillar division in health and human services. This youth services is one component of that. In addition, as I believe all of you are aware, in our community health assessment, our community has identified, and when I say our community, I mean our county has identified, 3 primary needs areas. And the number 2 area is mental health. So we recognize that. I know many people have said lots of things about mental health and behavioral health and recovery and substance use being being health issues. I couldn't agree more. I also want to just point out that is why we have excitedly put together the idea to have this recovery and resiliency division that will include not only launching this, but also then overseeing other programs that were mentioned earlier under our health and human services pillar that are not part of the ARPA request, but that are in conjunction with the Sheriff's Department and the Pathways program, as well as with County Attorney Ring, and looking at additional funding and potential expansion of some diversion, and particularly deflection from the criminal justice system, and overall helping our community and our communities, and starting that at that very early stage of youth and families. So with that, this program, again, we're going to develop it, quite frankly, but we're going to be doing that in conjunction. We'll be looking to the board members to identify and make sure that we have encompassed and included those other programs across, obviously throughout Page, but also the Navajo Nation in particular. So hopefully that gives a brief enough overview. I'm happy to entertain any other questions, or if we need to delve into any of the other components more explicitly. Thank you.
Mr. Chair.
Trying to get off mute there. All right. And who asked that question?
I think we're at the overview point, so we can open it up to questions.
Oh, that was you, Sue. I noticed a little crackle in your voice, so I didn't recognize you. Sorry.
I'm nervous, Mr. Chair.
No, you're doing fine. And so I saw Supervisor Horstman. Patrice.
Yeah, thank you. And thanks for the overview, Kim. And I have to tell you that out of, I think all 3 are addressing a need that has been long recognized and not had the funding to be able to address. But I got to say, this is the most exciting to me. The behavioral health division of I guess you're calling it Recovery and Resiliency Division in HHS, I think is going to be, a wonderful tool to tie much of the mental and behavioral health programs, not together as much as at least in collaboration and in communication. And so I'm really excited about that. And I know that we aren't really sure, we know the needs are there. We aren't probably sure at this time what's possible until you get yourself going forward. As our county attorney recognized here in the northern part of Arizona, sometimes we're short on providers. And quite frankly, this is going to probably be a learning experience, but having a division within HHS to kind of act as the conduit, the coordinator, is, I think, the most exciting part of this whole program. So I know, and I'm hoping that as we move forward with these programs, that there will be periodic reports back to the board, and also discussions and hopefully good news about being able to partner with other funding sources and other agencies to be able to provide these services to our community through the whole county. So I'm excited about having this division of youth, should be the Division of Recovery and Resiliency Division within HHS. So thanks. That's my comment, Chair.
Thank you. We're excited too.
It is exciting. Let's see, other supervisors. Looks like Supervisor Begay. Go ahead, Judy.
Yeah. Thank you, Kim, for this presentation, and also Sue. I'm glad the way the model, the way you put this whole thing together is really nice. I like the flow in it as we read it and stuff like that. The only thing that I wanted to bring up is we've always talked about cultural and traditional possible ceremonies or intervention or prevention or things like that. Is there anything that's in this model that would take care of that? Because Page has a high population in Native Americans, and so the Western and the traditional side of it, I think, is something that I'm not sure that's doable. So that's the only thing that I was looking for in this whole thing here.
Yes, thank you, Supervisor Begay, Chair Ryan, and supervisors. Absolutely, that is going to be key in terms of our process as we go through this. We want to be absolutely attentive to making sure that this addresses and is the cultural needs and values of the community that we intend to start this program in. And so that will be utmost and firstmost in the things that we are doing as we're meeting with the communities, talking to the providers, talking to the schools, talking to the families, and all of those throughout the northern region as we put this together. So absolutely is of utmost priority in putting anything together in that area. And quite frankly, to then be able to replicate across the county, regardless of what that our communities are reflecting. We want to be mindful of that in all of our various communities.
I have one more additional comment. And I know that like sweat lodges will really work, for our kids out in the communities, and then also possibly traditional prayers that kind of refocuses them in life. So that's something that I was kind of looking at too. Thank you.
Yeah, thank you. Absolutely. All of that is important to bring what are truly the lived experiences of the community that we're trying to serve. And we intend to be very attentive to that. So thank you.
Okay, it looks like Supervisor Vasquez. Go ahead, Geronimo.
Yeah, I want to thank Kim for the acknowledging the culture, and thank Supervisor Begay for that piece of it, because I think that's really going to be important. a lot of these cases and folks that are lost and end up in criminal behavior, it's because they have a disconnection from their roots, and they're kind of lost and just kind of floating. And so if we can provide services in a culturally competent model, I think we're going to be doing our county a great service. And so I just want to reiterate that about how important including culture and cultural programs for the different communities are important when providing these mental health services. So thank you.
Thank you.
All right. Supervisor Fowler, Lena, Vice Chair. You're muted.
Okay, there we go. Thank you. And once again, you know, we talk about your qualified census tracts. The 54, 50, and 51 are within the Tuba City area, and you are in your partnership. I noticed you don't have Navajo Nation. You know, when we talk about Navajo Nation, it has a whole department that is mental health. And then we also have a Department of Behavioral Health, where a lot of this traditional method is housed, and it's in the communities. It's in Kaibato. It's in these that tract that you have just identified there. And I think we need to, when I notice all of your references, you know, when you talk about, and here we are making a decision based on what you're submitting to us. And once again, traditional method is not there. Once again, you know, tribal communities are not identified in there. And all of the services are within Flagstaff. So, and yet they're saying that your targeted place of location of service that this is going to be piloted is in Page, within the city of Page. And so I'm just, you know, wondering how yes, granted, this is a pilot program, but from the get-go, if you're going to be working with Navajo communities, I would think that you would say that you'd be working with Navajo community projects or existing programs that are already there. There is a system that is in place within the court system of Navajo Nation as well. And I'm just wondering how you're going to be tapping into them, and I want to make sure that you are going to do that. You know, yes, I think that behavioral health is a big issue right now with this pandemic. Well, at the same time though, you know, getting people jobs that will sustain people. You know, that because people don't have jobs, they're afraid to leave their children at home as a mother, and they don't want to go back to work because they don't know where they're going to put their children. You know, that is right there is very stressful. And so how are we, you know, when you think about mental health, it's a bigger issue. You know, where's the economy side of all of these proposals that are coming through? We're only looking at the courts, trying to prevent people going into the courts. And I realize this is just a dot within a bigger issue that is here. But this is a one-time funding that we're going to be providing out, and it's going to go into the community. $2 million as a pilot program that is targeted at Navajo Nation communities. And yet nowhere in the proposal is there mention of Navajo Nation. I don't understand that.
Mr. Chair, if I can respond.
Please.
Thank you for your comments, Vice Chair Fowler. We certainly would ask your guidance and your connection to those resources of those individuals. You know, that's what we would like to do. You've pointed out what is apparent weakness in our proposal, and I would like to ask you and Supervisor Begay to help connect us to those individuals that are key individuals within the Navajo Nation government that can help us connect our resources and make sure that we're doing the work in concert with each other.
You know, I really appreciate this proposal, but earlier we talked about duplication of services. What is Navajo Nation doing? You know, are they, you know, I used to work for Head Start at one time. And I worked with Head Start, and I went to people's homes, and they would say, oh, okay, you know, we just had a visitor from that department just came yesterday, so-and-so came, you know, and then the family started wondering, what is wrong with us? Why is everybody coming to see us? You know, that's where case management team came in. And I think that we need to, as much as we want to, you know, spend this dollars on the people that are of, use your terminologies here, marginalized, social vulnerability, your, you know, these are, and then there's I looked up also the medical and the mental health shortages. There's a whole study that was done by Indian Health Service within Indian country. Are we aware of that? I think that what we're doing is great, but we got to really hold hands with the people that we are proposing to implement something on. I just can't understand how even the public schools, those are the targeted students, and yet no mention of those local regional programs that are in place, and how are we going to partner with them? All the partners are all in Flagstaff. Are any of this dollars, $2 million, is that going to be funding that is contract out? How much of it is it going to be contract out? And who is it being contract to?
So, you know, just grabbing this for a minute, Lena, I got an echo. Anyway, so, you know, the key piece is they're making the proposal. Your point is engagement with Navajo Nation up to the point that we can with Navajo Nation and making sure we're coordinating. And Kim, in terms you're saying you're starting a pilot, you know, and you had mentioned during your description earlier that you have had interaction with the Navajo Nation. Now, you didn't put it in your proposal itself, but could you explain that just a little bit? Yeah.
Yep. Thank you, Chair Ryan and Vice Chair Fowler, for the questions. And I apologize if I was not clear in what I'm stating, and certainly will, with respect to the written document of the proposal, I think the point that I was trying to make in summary as I started this afternoon was that we need to go to the community, to your point, Vice Chair Fowler, and we're going to be gathering that information and asking those questions. And you are 100% on target when we talk about what the needs of the community are. Back to your example about childcare. I'll be real honest with you. One of the things that we're looking at is specifically related around how do we look at addressing some of the issues where people don't feel they have a safe place to take children so that they can return to work. We've had lots of conversations, you and I, and you've had with our Vice Chair, with our department, and we couldn't agree more with some of those concerns. So what isn't in that proposal in writing with respect to the partners, and I want to articulate that right now, is that we absolutely, when you talk about who the funding is going to go to, those kinds of things, we don't have that identified yet, because we need to see what those services are so that we make sure we're not duplicating them, that we are bringing them to the table. And that includes not only the chapter houses, that includes Navajo Nation First Things First. It includes Navajo Nation DES. You know, we have people in our page office who participate and at HHS with the Dene College for Maternal Health on the task force. We sit on the Kaibito Community Health Improvement Plan. Right now, we're sitting on that as they're putting theirs together. We have members of the tribal nation sitting on ours as we're getting ready to put ours together. So I absolutely echo what Steve said to all of you, and certainly to Vice Chair Fowler and to Supervisor Begay. We're going to look to you to make, as we say, here's some of the people we've got at the table. Who are we missing? So that we can get the information and collect that in a way to put together something thoughtful that's really going to meet the needs. The goal here is not to take something that is already, you know, a shelf model of something and go plant it somewhere. That is not at all the intent. And so I apologize that those partnerships are not mentioned in this proposal. This was a framework that was intended to be put together to give structure. And we don't have all those partners listed out on that. But, you know, I assure you that we're going to be reaching out to all of those entities to make sure that we're getting that information, that we're working together, and that we're not imposing something that is not the right fit for the community and for the culture.
Oh, you know, I appreciate that. And, you know, in a way I understand it, but, you know, you took the time to make sure you put guidance center. You took the time to list all of the Flagstaff services. And yet they don't provide service out there. Or if they do, how, you know, because, you know, the other reason why I'm asking this is outside agencies are going to be coming through. These are departments. If they're already going to be contracting with these outside agencies, are they going to be proposing the same proposals, or is that a different one? And every one of these requests, every single one of them has a guidance center. It also has the, you know, if you just go through, it's the same programs that are listed in each one of them. Does partnership mean that you're going to be contracting with them? Or does a partnership mean that they are readily available to help out without having to ask for funding from this dollars that is coming through? You know, there's partnership, you know, and there are also programs that are readily available at the local level. Are those are not listed. So that's the reason why I'm asking. This is the time for us to ask, but you're asking us to make a decision based on what you just presented to us. And that's the reason why I'm asking these questions. The traditional method of counseling, ways of doing things is not in here. And yes, we're willing to help. I'm always willing to help.
So, yeah. Okay. So, you know, there are a couple pieces going on here. Lena, you have questions. They're fair questions. You're also kind of grilling our staff at this point on it because they are tough decisions that we do have to make associated with it. You know, for the sake of our staff and where our jurisdictional boundaries are and where we need to operate, they are trying to extend it, but they have not put that in their report. So it's a piece, as we noted, it's an opportunity for a pilot program. So do we have this opportunity, and do we want to use that pilot program up there? In the meantime, those that do provide the service that are listed are usually our contract agents, but I'll turn to Kim on that. That is how they got listed. Is that correct or no?
Yeah, and I apologize because I guess I'm not clear where you're looking at on the proposal in terms of the guidance and the other partners that are in Page. You're absolutely correct. The Guidance Center isn't in Page. This proposal is not only about the pilot program in Page. This encompasses the Recovery and Resiliency Program division over the entire Health and Human Services division. So and I apologize, I'm remiss if we did not list everything. In fact, quite frankly, if I listed every partner agency that we work with, I would need 2 full pages just to list the people that we partner with. This was we got instructions to keep it to 2 pages to do that. So I apologize about that. The Guidance Center is not in Page, we have no intention of having them be in Page. We'll be working with the service providers up there, depending on what kind of program we do. I know Catholic Charities is listed there. Catholic Charities does have a program in Page. They've been up there for a little while. And so we will be looking at the existing programs and providers. And like I said, not only in Page, but across the nation, and having those conversations. I'm also looking forward to see what the Navajo Nation intends to put their ARPA dollars towards, and how we can leverage each other's resources to provide the best services across our communities. So I think there's a lot to be learned yet. I don't have all the answers yet. That was not the intent of putting forth this proposal. It was about addressing some concerns under what we're seeing in particular with youth and young children, and noting both from our conversations internally with the county about where we're seeing kids, and I think this goes to Supervisor Vasquez's point as well, where we're seeing kids coming into the criminal justice system, and how are we, like, not just the criminal justice system, into the behavioral health system, into the medical system, into all of our systems, and how do we intervene differently and more appropriately and in a culturally competent manner. And, I'll just say that, this is the board's decision to do what you're going to do. And, you have my commitment and the commitment of our department that, we care deeply about all of Coconino County and providing those services and making a difference in health disparities across all of Coconino County. So thank you.
I have no question about your commitment and your desire to provide the best service ever. I'm questioning what is before us. That's it. So thank you.
Thank you.
You're muted, Mr. Chair.
I know, I owe about $1 today. Supervisor Horstman.
Well, I think some of that, just Kim has kind of explained, as I understand, this is going to be a twofold. One, and probably the biggest funding source is going to be for the new HHS division. And then as part of that, there will be a pilot program that you're starting in Page. And I'm assuming that you will be using HHS and Page as kind of your landing facility, if you will, to start this pilot program. Is that right, Kim?
Yes, in terms of, to some extent, yes, depending on what type of program it is. We're hoping that there's other locations, especially if we're looking at youth programs and things where we can use other facilities up there that are most appropriate. We're going to need to look at that and where do we help make those services, where do we make those services available that make the most sense?
Right. And, and I know one of the things that has been hard for the board, for the whole board, quite frankly, is that this is a big undertaking that the county is doing for the first time, if you will. And I think we all understand what the intent is to provide mental and behavioral health, and especially for youth services countywide. I don't think anybody here in any way, shape, or form questions the need. And we've certainly seen that, especially after COVID. And we've seen how it's affected some of the most vulnerable populations here in Coconino County. We understand that, and the board certainly understands that. The other is, I think all of us here recognize the professionalism and the knowledge and the skill that we are so lucky to have here in Coconino County. Many of them are on right now on this board meeting. And quite frankly, you're the experts. You are the ones that are knowledgeable and have the background and experience and the skill. And to a certain degree, we as the Board of Supervisors, who have our own different knowledge, expertise, background, and skills, are going to need to rely on our experts to be able to do what you're telling us you're going to do. And I think sometimes it's hard because we don't have the particulars. And I know that we don't have the particulars because you don't have the particulars. You quite frankly need to find out what is needed in a particular community or in a different community or a particular area. and what is available in that particular community or area. And so you haven't developed the intricacies, if you will, of the programs. We're seeing that when we talk about the county school superintendent's program. We're seeing that when we talk about the HHS new division and your pilot program. The only one that's concrete is when we have a diversion bed, and that's concrete. But the others are the services that we definitely need to start providing in our community. And so for myself, you know, it is a bit of a leap of faith, if you will, but I also believe that we do have the knowledge and professionalism within the county. I think that we have, you know, from the county attorney's office to the court system to the county school superintendents to HHS and the folks within HHS. I think we have the expertise necessary to really create this program that has been long overdue here in our county. And I think it's important. And what I like about that HHS division is we don't want overlap. We want the best bang for our buck, right? We want to help the most people with the limited resources we have. We want a holistic system. We want some coordination and collaboration amongst each other for what we are trying to put together here. And I look forward to getting regular updates on how we're going forward. And my guess is there's going to be some tweaks as we move forward. That's what I'm going to expect. And I'm going to expect we're honest about those. We're honest about where we've been successful, and quite frankly, honest about some of the failures that we've made. And I'm going to be looking to you, Kim, and I'm going to be looking to County School Superintendent Mango Paget, and I'm going to be looking to Judge Slayton and the county attorney to be honest about how we are succeeding or not succeeding as we move forward. So we may not have all the answers. I don't expect that you're going to have all the partners in place. There are so many different elements that we have here in Coconino County because we are also dealing with a sovereignty within our county. And that sovereignty has its own rules, its own laws, and its own court system, and its own way of doing business. We have to develop coordinations, communications, collaboration, MOUs. You know, we have to get all of those in place. And I don't expect that you're going to have all those in place right now. But I have faith and confidence when you're telling me this is our plan, here's who we're going to get in place to do it, that you're going to be able to move this. We need to move forward with behavioral health and mental health in Coconino County. And I think this is a good approach to do it. So thanks.
Thank you.
All right. Supervisor Vasquez, Geronimo.
Ditto. I agree with everything that Supervisor Horstman said, and I really feel like we're really close to a finished product. We're so close, you know, there's light at the end of the tunnel. It's just those last minute edits for the final draft. So I'm excited. I feel a lot more comfortable with a lot of these projects coming in after these presentations today. And I truly feel like we're close to that finished product. So keep plugging. We're almost there. There's light at the end of the tunnel. And we're going to do this, and appreciate all of your leadership, everybody that's been involved in this. It hasn't been easy. It's never been done before. The county doesn't have a mental health department for a reason, right? We've never been to there yet, but we're here now. And so now we're going to do it and create something like that. And so I just appreciate all the work that's gone into, and thank you for all your efforts. And we're going to continue, and we're going to create this great department for our county, for our citizens. So thank you.
Looks like Supervisor Begat.
Yeah, I have a recommendation. I'm just sitting here thinking maybe we should not identify places, but just say Coconino County. And then Matt will say, what part of the county? But anyway, I'm really content with a lot of information that was shared with us. And I trust that Kim and others are working on this whole packet too. That, you know, whatever you're hearing is something to be considered, you know, for us as far as, you know, finalizing, and it's going to be tweaked here and there, you know, but, you know, it's for the better. And we do have our constituents are out there, looking for help. And then, staff, we have qualified staff here. And so I think, all in all, everything is going to work out really nice. And I'm so happy, that we're doing this. And I think this this whole proposal stuff, it really is something that, I think is going to really, really help our communities out there. So I just want to say thank you. Thank you for your everyone's comments and all the staff that have diligently worked in this process. And then also Mr. Peru, almost said Dr. Peru, Mr. Peru. I just want to thank you for your leadership. Thank you very much.
On a key piece of this, should we move forward, if we decide to move forward, is associated with the, as noted, I think Bill brought it up, Bill Ring, in terms of if this is day one and we move forward with it, there are bits and pieces. We're going to have regular reports associated with what's going on, how it proceeds. And it is, Lena, your grilling of the staff, that's how I phrased it, is appropriate in terms of we have a very tough decision here on it, and I understand from that perspective, and yet it's not all refined at this point. So yeah, there are key pieces that we're going to have to see that honesty that was mentioned by you, Patrice. What is working, what's not working? How do we proceed with it? And then. Even with that, it's a pretty big investment, and there's so many parts that we have moving associated with this. So yeah, a lot. It's hard for all of us as we're trying to work through this one.
Well, Mr.
Liz,
Chair.
Yeah, go ahead, Lena.
Yeah, I don't feel like I'm drilling the staff. I apologize if it comes out that way, but we have a proposal that is before us. Maybe we just need to think it through. I have full confidence in our staff, and I know that we have the most professional. I know where they're working, just based on having worked with them for so long. But it is our responsibility as a board to question, to understand where these fundings are going, and that it will be the most impactful program that we have rolled out, and be able to be sustainable, actually change people's lives. And, and that is what we're looking at. What is going to sustain and actually be better the lives of communities. I think the very basic, we're proposing a program on Navajo Nation. The very basic is to mention Navajo Nation anywhere one time. That's the reason why I'm bringing these things up. So I'm not opposed to it. I have already had many meetings, but the end result with these short 2-page proposal mention everybody else except the people that you're going to be working with. That's all.
Mr. Chair, as I mentioned before, we will be working with Vice Chair and Supervisor Begay to identify those specific individuals to reach out to and engage in the conversation.
And we have, additional staff as well that have interacted. Okay, so anything else on HHS at this point? Nope. Okay, so we're going to swing back to Sue. I believe courts are up next, sir?
They are, Mr. Chairman. And we have split the court's proposal into two. So part 1 and part 2. The first portion, I believe, Erica, is the new division of the new Superior Court Division. I believe we have Judge Slayton, Judge Steinlage, Sharon Yates, already our panelists. Mr. Chairman, do you want a short description again, or would you just like to entertain questions?
Okay, did again. So that's $2, huh? So short description is really helpful, I think. So if you could, please.
We can do that. Sharon, do you want to take that, or Judge Slayton, do you want to take that?
I'll go ahead and take it. So thank you so much again for all the hard work that you've been doing. These are some really, really serious questions that you're being asked to answer, decisions that you're being asked to make. I pretty much gone over the previously, and I don't want to bore you again with the reason for the new division, except to just simply reiterate, we are unprecedented times with our caseload and the backlog that we have. The pressure is getting very difficult, and it's getting difficult on the judges tremendously. I've had conversations with a couple of them, and it's getting to the point where they're considering whether or not how long they're going to continue on. So it's getting difficult, and so one of the things that we are attempting to do is to address the backlog, be able to reduce the pressure on the trial court judges, the four of us that are doing trials, and so that's really that's the bottom line on it. We need to get these trials done. We are under. I will tell you. I just feel certain the Chief Justice will in fact rescind the suspension of Rule 8 time. That is the constitutional right to a speedy trial that is codified in our rules of criminal procedure, telling us when we have to get a defendant to trial, and that's going to go away. And we're going to have to be able to manage that trial calendar. The second thing, and then I'll turn it over to Judge Steinlage. The second aspect about this is kind of switching back to the involvement of our mentally ill in our judicial system. The whole purpose of this is, if getting the new division, it will then allow Judge Steinlage, who is our resident and statewide expert on dealing with the mentally ill in our criminal justice system, to begin to branch out and move out to establish programs such as a Superior Court mental health court, and also our RTC program. So Judge Steinlage, let me just throw that back over to you.
Thank you, Judge Slayton. Thank you to the board and Chairperson Ryan and Vice Chairperson Fowler. So right now I'm serving in Division 6 of the Coconino County Superior Court. And I'll just give you a little sense of what's happening in Division 6 as one example. So pre-pandemic, I was a family court judge and a probate judge. And then with the backlog of criminal felony trials waiting to be presented to juries, that has to do with the pandemic, the suspension of the speedy trial right, as well as the fact that we just, for purposes of public health, just could not bring in the quantities of jurors and seat jurors that we need to. We've had to go to a model of all hands on deck for anybody with a background in criminal law, which definitely includes me. And so I am now still have some family court cases. I now am doing the civil commitment, the Title 36 cases. And we've formed a consolidated competency and restoration court. And then we have huge numbers of felony jury trials. We're scheduling felony jury trials. We're about to be scheduling. Some divisions are already scheduling into 2023. We're about to start scheduling in 2023. And we have months on our calendar for 2022 where we're in trial 3 to sometimes all 4 weeks of a month, most often 3 weeks of every month. And what we have happening in the Superior Court at this point is not sustainable. The caseloads are not sustainable. There's weeks where I work 100 hours a week. There are nights that I sleep at the courthouse, and I will tell you all that I am perpetually behind. despite the work that I'm putting in. And I'm just one judge. If we had all the other judges here, they'd be telling you about what their caseloads and work has looked like during the pandemic. We are desperate for the additional division. What Judge Slayton is envisioning is that the additional division will be able to be a criminal court division, which will be assigned some portion of these pending felony jury trials. And then how this ties into this behavioral health request that we're making is that the Superior Court thinks that we are well aware of the financial strain of restoration of competency and what it's putting on the county. We're well aware of the fact that mentally ill, particularly seriously mentally ill defendants, end up serving longer pre-sentence incarceration periods. We're well aware that seriously mentally ill defendants end up at higher percentages in revocation court. We're also well aware, very well aware, of the challenges of matching seriously mentally ill defendants with appropriate services, those being sober living services, even outpatient substance abuse services, inpatient substance use services. And so these are things that we eat, sleep, and drink here, and challenge us on a daily basis. What we're hoping to accomplish, in addition to alleviating the backload of felony jury trials through the creation of the new division, is we're hoping to establish a mental health division that would include Title 36 or civil commitments, that would include, I think, the guardianships, at the very least, the mental health guardianships from probate court. It would include the consolidated competency and restoration court. And it would include a felony, high risk, high needs, actual mental health court. And so that's what we are envisioning and hoping for. The idea is to have one judge overseeing and knowing about how these different individuals are coming into our system. In other words, is somebody that needs restoration of competency, is that person also under court-ordered treatment? Is somebody who needs restoration of competency also, or could they use a mental health authority guardianship? To streamline these things as much as legally possible, and also see what are the trends that we're seeing. Where are the gaps in services? Who's ending up in the Arizona State Hospital Restoration of Competency Program versus the Yavapai County Restoration of Competency Program? These are important things to know. These are expensive things for our county, and that's what we're hoping to achieve. So that's kind of what I wanted to say about the new division, and how it relates to our request for support in terms of seriously mentally ill criminal defendants, folks that are court-ordered in the civil court to treatment, and folks that are in need of guardianships or have guardianships, in particular with a mental health authority. So if anybody has any questions on this, I'm super happy to entertain them. And then what I thought I would do after that was go into this position we're seeking funding for of a mental health coordinator, the clinical liaison, and the mental health coordinator.
All right, pausing for questions at this point. Okay, Supervisor Vasquez, then Horstman, then Fowler. Go ahead, Geronimo.
Thank you. First off, I just want to say thank you for all those hours in trying to pick up on the backlog. I know it's been a strain for everybody, so we're supportive of those efforts to make your life easier so that we can be more effective and not be burning out our staff and everybody that's dealing with these issues. My one question is, with the backlog, we are looking at this funding to help make this dynamic shift, this paradigm shift that we're talking about. And it's a lot of money. And so that's why we're really like, we got to make the right choice. What's the plan afterwards? How does this get sustained? Because we don't want to have to cut jobs once this realignment happens, we don't want to have to take jobs away in 3-4 years. So what's the plan?
Supervisor Vasquez, again, one of the things that I have pledged is that we will, in 2 years, I know and I understand the pressure and I understand the commitment. We will make this a self-sustaining division by the savings that we anticipate by reducing the expenses for court reporters, utilizing more technology, one of the things that we have learned about during the pandemic, and then also reducing costs of restoration to competency proceedings with an in-county outpatient RTC program. So I think in terms of the savings to the county, in terms of personnel costs for court reporters, as well as cost savings from the outpatient in-county RTC program, we'll be able to justify continuation of that division and the jobs that go along with it.
Thank you for that clarification. I really appreciate it, Judge. And I really think that, again, like with all the others, we're super close. So, we're almost there. Good job. Thank you.
Sure.
Okay, Supervisor Horstman, and then I have Vice Chair Fowler after.
Yes, thanks. And I appreciate the judges presenting on this, and this is one of those things that the state has basically put as a mandate to the counties and has not provided the necessary funding to really do what is required for our citizens, for our residents, to meet our constitutional requirements. But there's still our constitutional requirements. So we can complain all we want about the lack of support from the state should be funding this, and they should, by the way. But the truth of the matter is, this is really the absolute centerpiece of fundamental justice for the residents here in Coconino County. And, I am concerned about the sustainability. So Supervisor Vasquez beat me to the punch. So good job, Supervisor Vasquez. And I am hoping that with a more centralized, with more of a centralized felony division that can also basically consolidate some of the mental health, Title 36, guardianships, et cetera, that there will be some cost savings there. But the bottom line is we need to do this. The Constitution of the United States requires that we do this. And, we probably are still going to have to do what we can to get the state to do their part. But we can't have a situation when we have judges sleeping in the courthouse because they are so backlogged. At some point, the judges cannot, and I know you're really good, but there's no way that the judges are going to be able to keep it together, keep the facts together, keep the evidence together, and to do justice and make a decision that we expect is going to be made from an impartial judge. So, I know this is a huge bite to take, to basically bite off the apple, but I really feel that this is absolutely a constitutional requirement, and it's the basis of what our citizens and what our residents expect here of our judicial system. So I'm in favor of moving forward on this. I wish it wasn't such a large sum, and I am hopeful that in fact we will have the cost savings that Judge Slayton is predicting. So thanks.
All right. Vice Chair Fowler, Lena.
Well, thank you. And, it was our county that made sure we lobbied out there to make sure that the ARPA funds were, that the courts were included, just because of what you were providing us the information. With that said, the states also receive federal fundings, and I can't understand why that they are not, why the funding is not coming down to the county courts. And so now we have all this backlog, and what my question was, and I guess, what came back was it's kind of impossible to put together is how much is it per case that we are having to spend? I think it was a little over 1,000 cases, and now we're pumping millions into creating a new division. And did I understand you correctly, Judge, that this new division is going to become the mental health division? Is that what the end goal is? Is that where we're headed? That's the first time I heard of this. The new division was just going to be a division, and now it's becoming a specialty division that we are now creating. And yeah, I absolutely, I think that we want to relieve the stress in the system, but to the end, when the dollars have gone, then what? Can you do it with 1 million instead of $1 million and 184,000?
Vice Chair Fowler, let me make sure I'm clear, and I apologize for any confusion I may have created. The new division will not be a mental health court division. The new division will be a trial court division, just like my division, just like Judge Reed's, Judge Nichols, Judge Krieger. It will be a trial court division. What I am anticipating is that with the ability to transfer a fair amount of Judge Steinlage's caseload onto the trial court, I will be doing a whole bunch of caseload management and transfer of cases. But taking from Judge Steinlage those number of criminal cases, as well as her addressing the family cases that she still has, will still keep her as a trial court judge. She will still be doing criminal trials. She'll still be doing civil trials. But she will have time to be able to develop and act as a mental health court judge, in addition to her trial court duties. So just as Judge Nichols is the Veterans Court judge, just as Judge Reed is the Recovery Court judge, Judge Steinlage, as part of her responsibilities as a trial court judge, will be the mental health court judge. So I hope that clarifies it a little bit better for you.
Okay, yes, thank you. I guess I misunderstood. I wrote down mental health court division. So, and then in your proposal, the end result, and you mentioned it earlier, is the competency. There is going to be a program in Coconino County. Who is going to develop that program?
Well, that program is already in kind of the pre-development stage with Judge Steinlage, Sharon Yates, Kim Musselman. So we're in the pre-development stage of that right now. And I could turn that over to Judge Steinlage to give you some better information on that, but that's where we are.
Okay. Thank you, Judge Layton. So the restoration of competency is a huge topic, and it's an area that is increasingly expensive for the county. The expense for it has ballooned due to the pandemic circumstances. Prior to the pandemic, there was essentially a default that if a defendant in the Superior Court was not competent, but restorable to competency, that defendant would go to the Yavapai County Jail's Restoration of Competency program. And just so you know, the cost of that, based on a 31-day month, is $8,500 a month. A lot, admittedly. The other option that was utilized in unique circumstances was the restoration of competency program at the Arizona State Hospital. That, based on a 31-day month, is approximately $25,000 a month. What happened during the pandemic is Yavapai County Restoration of Competency said we are not taking defendants from outside of Yavapai County. In other words, we are not taking defendants from the Coconino County Superior Court and other courts too. So the only option for the judges was to send defendants for restoration programming to the Arizona State Hospital. Huge increase in the expense. Now Yavapai County Restoration of Competency is open to out of jurisdiction defendants, but there is a significant waiting list. That waiting list is approximately 4 months. So we're talking about a period of 4 months where a mentally ill defendant awaiting trial, everybody, this is all pre-trial. There's, well, I guess there's a couple people in revocation court, but the majority is pre-trial, are waiting to go down to participate in the restoration of competency programming. So we were, not me, but Miss Yates and folks from the county attorney's office, and I think the county manager's office, have been working to try to have a new contract with Pima County's restoration of competency program. And they've been working on the intergovernmental agreement and a contract. But Miss Yates learned, I think last night, that Pima County also has a substantial waiting list for defendants to come down and participate in their restoration of competency program. So just kind of want to give you this background. And as the judge that's been working in the consolidated competency and restoration court, it's extremely stressful to try to figure out what defendants psychiatrically and in terms of safety issues can wait 4 months to go down to Yavapai County, and what defendants really need to go to the Arizona State Hospital, so we're not creating, I think in some circumstances, based upon what I've heard psychiatrists testify in Title 36 court, long-term psychiatric damage. And this is the situation in restoration of competency. So what we're hoping to develop isn't, first of all, I think the easiest step is an out of custody restoration of competency program for defendants that can safely remain in the community and work with providers out of jail in our various communities in Coconino County to go through restoration treatment here in the community. Not only will it be cheaper, but it's also supposed to be the first step of analysis under Rule 11 of the Arizona Rules of Criminal Procedure and the statute that Rule 11 implements. Long-term, however, one thing that's become clear from the pandemic is the fact that the county is not self-sufficient for in-custody restoration of competency means that we are at the mercy of these other county programs from other counties to avoid the use of the Arizona State Hospital. I'm not against the Arizona State Hospital. They do great restoration work down there, but the expense is quite frankly mind-blowing. And so I think when we talk about what's going to be happening and what are different judges and health and human services folks and county manager folks are focusing on is, I think long-term, I think we really need to give some serious thought about becoming more self-sufficient in the area of in-custody restoration of competency. But we would, and we think we can, get off the ground in a relatively short period of time, an option for select defendants that can safely do so, participate in the out of custody restoration of competency. Sharon, did you want to weigh in on this?
Thank you, Judge. I think you covered it. We do have a draft request for proposal that was put together. Thank you, Kim Musselman and your staff and your team. She also reviewed it and provided feedback to me yesterday with regards to that, and I will review it with Judge Steinlage and Judge Slayton, and then hopefully we'll get it out on the street to see if there's any interest with our local providers.
Mr.
Let
Chairman.
me just, let me also just kind of follow up on one of the things that I want to indicate. The total funding on this, and Vice Chair Fowler referred to that, the extra $134,000 is because for years, we have not been in compliance with the statute. And we, in essence, have been in violation of the statute because we have not had a mental health coordinator on these rural 11s or restoration to competency programs. So the $134,000 is to bring us into compliance with the statute and to fund the mental health coordinator to be able to make sure that we are in compliance with the statute and with the rules of criminal procedure.
Mr. Chairman,
Yeah, go ahead, Sue.
just a point of order. We've also moved sort of into the last proposal in our explanations about the RTC, out of custody RTC, and the RFQ. So I just wanted to make that point, is that we've sort of gotten into that last program description as well. And if you'd like, before we entertain questions, we can finish off that explanation, which includes the navigators, the CJ navigators, which I think is the last piece that we have to talk about. And then we can sort of bring all the questions about RTC and those CJ navigators back to the board if you wish, or we can stop there and entertain questions. And Steve?
Yeah, I have one more question.
Just, yeah, hang on a second. Yeah, go ahead, Lena. Lena had the floor though, and Lena, are you okay with that, or were you saying you have one more question?
I do have follow-up question, but if I think we're going to be moving on. I think our county attorney and judge wants to add to the conversation.
Okay. Let me turn to, let's see, I have the hand up on Bill. Sorry about the hands up. I see you're out there. I'm trying to manage everybody here. So we'll turn to our county attorney. Bill, go ahead.
And Mr. Chair, thank you. Excuse me, I'll be brief. Judge Steinlage did a fantastic job of explaining to you the relevance of this particular column of funding for the Superior Court. We're supportive of that. But when you think about cost savings, you have to consider the other columns as well. If these columns work in conjunction with each other and we get early deflection of people that we identify as seriously mentally ill or in need of compensation, they are going to go to Health and Human Services, not through the criminal justice system, so that we're not churning criminal justice dollars trying to get a treatment at Intercept 3, when we can start planning for Intercept 0 and build programming around that, where the other columns that you see in this great plan come together and start working together. So they're not silos. This is a system. And if there were one of these columns that really stands out, it's the Health and Human Services column. So when you go looking at cost systems across all these columns, the more we front end load those kinds of interventions for the health insecurities that people suffer, the more we save in the criminal justice system by not even seeing these people in the criminal justice system. And they're getting their treatment early in the process. They're not recidivating. They're not taking up probation time or court time or the time of a public defender or a county attorney. So the savings to this column 4 are really substantial if all these columns work together and we front end load the interventions at Intercept 0 and Intercept 1. So thank you.
I'm looking for my stand-up ovation for what Mr. Ring just said.
That's right. And then we have well, actually, it is bringing in, I visited with Lena yesterday. You warned me you would be asking all these questions, Lena. But the other piece of it was let's listen to the practitioners so that we start to see what the bigger picture is and the implications, but it's tying it all together. Judge Steinlage.
Yeah, I concur with everything that Mr. Ring just said. That's the whole point of the sequential intercept model map. And that is to front load it. It's most cost effective. It's most humane. It's putting people with significant behavioral health issues where they should be, which is with appropriate treatment providers instead of before a judge. I concur wholeheartedly. And if we could shut down the Consolidated Competency and Restoration Court, that would be essentially the happiest day of my life. So I'm with Mr. Ring 100% and support him in all of his endeavors, and hope that he continues to let me know how I can continue to support him. I just wanted to go to our middle presentation from the court, and that is the mental health coordinator, the clinical liaison, and the mental health coordinator. So I just want to make sure you guys know, so every time in the Consolidated Competency Restoration Court, every time I order somebody to go to restoration of competency because they're not competent, but they've been found to be restorable, I have to make a record that I'm in violation of the law because I cannot comply with ARS 134513. And that is the requirement that the court shall, every time it orders restoration of competency treatment, appoint a clinical liaison. And here in the county, we just don't have anyone to serve in that capacity, whether by contract or county employee or court employee or wherever that would be. So we're desperate to be in compliance with the contract. Fiscally speaking, I want to let you know that well, first of all, the idea of that is that person is the coordinator of the continuity of care. So if someone's been at ASH or the Yavapai County Restoration Program and they're on medications, that person meets with, they know what those medications are, they're in communication with the jail, if the person's going to come back to jail, or if the person's going to come back to our community, they're in communication with whatever health home they'll be utilizing to make sure that person can remain on their medications. Also to set this person up with out of custody post-restoration treatment so we don't lose all of our positive progress that the county has paid huge amounts of money to have the person achieve. I want to let you know that there is someone right now, unfortunately, that went to the Arizona State Hospital, came back, decompensated in the jail, and we've had to have that person sent back to the Arizona State Hospital. So when I tell you that it's about $25,000 a month, I think not only is this statutorily required, but it's absolutely fiscally sound. Because anytime someone's decompensating, the law says that they have to go back through Rule 11 or competency evaluation. And if they're now incompetent but restorable, then they have to go back to restoration programming. The other thing is, I just want to make sure you guys know right now, we do not have a high risk, high needs mental health court in Coconino County. We previously had one. Judge Broadman hosted it in the Flagstaff Justice Court. But because we know that we need for that population an actual coordinator, like they have for recovery court, the program is essentially stopped. We're hoping to restart that to have it in the Superior Court. And this is the exact population that we're hoping to reach is people with significant psychiatric issues and then something else that makes them high risk, high needs. Usually that comes, unfortunately, in the form of a substance use issue. So that's what the $166,000 for 2 years, $83,000 annually would do. In addition, it would give us someone here connected to the court system that's an actual behavioral health professional. Because keep in mind, none of us are behavioral health professionals, yet we're trying to do complicated work sometimes with our community's most significantly mentally ill individuals. And this person's going to be able to be an advocate for the relationships and a liaison for the relationships between the court system and the various behavioral health agencies across Coconino County. And I would include everyone there, including the very important partners that Vice Chair Fowler has mentioned during previous parts of the participation today. Thank you so much.
There we go. All right. Thank you, Judge. It paints a picture well. Yeah, and I just played out your while you were giving those figures. Say we had 15 people that were going to ASH, to the state hospital. for 12 months, just theoretically, that would be $4.5 million. And using the Yavapai model will be I can't read my writing, about 1.3, 1.8, somewhere in that range, if I could read my numbers.
Mr. Chairman, in FY21, we spent 1.975 for RTC.
Mm-hmm. And it keeps going up, the rate of which, but it's just bringing to reality what is the cost associated with it. And we're only dealing with a small population as far as individuals are concerned, but they're, complicated cases that you have associated with that. And then the other piece of it is when we take a look at it, nearly half our budget is spent in law enforcement and in judicial services, which is it's quite a bit of money that we have there. Even more importantly, as we take a look at what we're trying to do, it could be quite progressive that we're intervening in lives in a way that's very effective, which is good. So, Sue, where are we? We got, did we finish one or two more pieces here, right?
Mr. Chair,
Mr. Chair.
Vice Chair wanted to make the comment.
Oh, I'm sorry. Okay. And I also see Judge Slayton up there too. Go ahead, Lena.
Okay, so I want to just go back to the new division. This is a new division. And the partners, I'm sure you all have figured this out, but I just have to ask, because this is a systemic organization that we are now organizing. We just went through our budget process, and there were requests for staff members from county attorney, public defenders, legal defenders, our clerk's office, and just the various departments that make up a division that help within that division. And I'm just wondering if they're capable of being able to staff and be able to commit and their staff and take on more work with this new division. I'm sure you all work together really well, but I just have to ask. And I'm thinking that we really did not fund them for this new division. So does some of this dollars that is being requested, is that some of those dollars going to be diverted into those departments that are going to be part of this new division?
Mr. Chair, if I could.
Fowler, I'm sorry, Vice Chair Fowler, thank you. That's a great question. And one of the things about that is that we did figure in the staff cost for the new division. So it does include a judicial assistant, it does include a new bailiff, it does include a court reporter, which that cost will be able to come out because then that'll be part of our savings. But we have included the cost of personnel, another clerk from Ms. Wyant's department. So we have figured in that cost.
I see those staff here, but you don't have public defenders, or, you're part of the system is the public defender and the legal defender. And they are constantly hiring outside attorneys to be able to handle the load that's being put upon them. So I'm just wondering, how are they ready to take this on? Because I don't believe that we approve all of the staff that they had requested for. And how is that going to be handled? And also the county attorney's office. So this is, and I don't know what other departments there are that actually get involved in this way. I mean, I just have to appreciate your work, just the complexity, the emotions that come with it. I know I couldn't be able to handle people's lives that way. And that's what you're doing. You're trying to save them from themselves in a way. And how do you do that? And you're limited in what you're doing. It's just really just amazing what you all do. But at the same time, from the Board of Supervisors position from here. And same goes for health department and every department, but from our position, we have to make sure, is there like funding that is needed in other areas to actually make this happen? And I hope, and I really hope that this new program that we're talking about, competency restoration, that it is started here in our county. However, I wonder if we have the resources to be able to pull that off, you know, because I was reading the state law on what I printed it out, and then the U.S. Supreme Court, the 2 court cases that established that, and then there's another case, and I'm thinking, man, that's a lot of requirement for that one program. There's a lot of specialty. Are we able to pull that off? I sure hope we are. I hope we do pull that off. But that putting that program together is not part of the request. It is only a new division, Superior Court, and then the IT, mental health coordinator. This new program that we're all saying is costing a lot. We are not putting any dollars into helping our judge put that together and our staff put that together. You would think that is the most expensive part of all of this. You would think you would put some money and actually help our staff to put that program together, because that's our saving grace, it sounds like. But it's not in our proposals. And I don't see it here on this chart here either. And yet that is the central point, sounds like. And so that's where I wonder if there's a way to move some of this dollars around to put aside some dollars to actually create that, help our staff, because I'm sure our judge is sleeping in her building because after her regular work, she's got to figure out how to put this program together. So I'm just wondering, with what we have that is before us, would it be possible? And is that to put some dollars aside from the request that has come in? And is that really needed? I'm just thinking here. I'm listening to what you're saying and trying to see what is really needed. So thank you. And I'm worried, and I'm wondering about the other departments too with this new division. Thank you.
Yeah, Vice Chair Fowler, your points are deeply felt and they are spot on. I won't begin to answer for County Attorney Ring or Ms. Arlington or Ms. Deal for what they're going to do. They're separate divisions, separate areas of our government, if you will. And I trust their judgment as to how they are going to work with the new division. I will tell you that we thought about the RTC program as possibly an item here, but we just didn't have the exact figures. We didn't have the ability to specifically and conclusively be able to answer all of your questions that I know you would have about starting that kind of program. So rather than try and say, oh, give us X amount of dollars and we think this will work for us, we specifically just decided, no, we're not going to do this. We'll take what we need as a triage, the new division for our caseload, for our backlog, a mental health court to be able to triage who we have in our system, and then be able to, as with Judge Steinlage, with Sharon and Kim and Michelle Axland and Sue Brown, just amazing people who've been helping us on this issue, be able to come up with a proposal that would be more effective and more directed towards answering your questions. I think Judge Steinlage also had something that she was going to weigh in on that as well, but that's why we did not put it in.
Quite frankly, Judge, the ability, and sorry, Mr. Ring, I know you put your hand up, the ability to come up with the proposal for something as huge as an actual in custody restoration, given what we've got going on in the court system right now, there's just no time left in the day to create that proposal. But we also want to be really clear that the expense has, and you're going to see it's ballooned during the pandemic. We realize the importance of self-sufficiency in a way that we've never realized before because of these extreme pandemic circumstances. And then the cost of not being self-sufficient. But I do think the inclusion of the mental health coordinator for the court overall, that would be wearing that hat as well as clinical liaison hat and mental health court coordinator, having that behavioral health professional in the system will assist us in trying to move forward with that ultimate proposal. But I do think that we can get off the ground with what we've proposed, and Sharon, please correct me if I'm wrong, with out of custody restoration, because the savings there. So if somebody's an out of custody restoration, that means we're not paying that same cost for Ashe or Yavapai County. We're paying less, like an hourly rate, to someone who'd be working with someone in the community, as opposed to that whole day rate that the counties charge because somebody's actually living in their facility, either Yavapai or Ashe.
All right. Lena, I already have Bill Ring, the county attorney, up. Are you done with that?
I'm not quite done, but I want to hear from the county attorney.
Okay. Bill, we got you up there.
And Judge, thank you, Mr. Chair, and thank you, Supervisor Fowler. This is the court's presentation, and I don't mean to misdirect it. I want to support it. To answer the question, we've identified 3 FTEs in our office that we require in an effort to support the creation of the Division 7. And we would divide our workforce between the acceleration of criminal cases. As the judge pointed out, Rule 8, the suspension of time, is about to expire. I mean, the game is going to begin again. And we're going to be running it, as best we can. We've identified 3 positions. Our challenge as an organization, and by the way, we're talking to each other. Judge Slayton had caught me on the street and he said, "How are you going to do this?" And so we were coordinating our efforts to try to be successful. I mean, we don't want to fail at this, but we'll make mistakes, but the intention is not to fail. Our challenge as an organization, Coconino County, is going to be recruitment and retention of our workforce. If we're fully employed, we can do what we're proposing, what the courts are proposing to do. Our challenge is to be fully employed. We're having difficulties recruiting, and we're having difficulties keeping the people that we recruit. I looked at our office staffing. We hired 14 people between 2019 and 2021. We hired 14 and we lost 7. I mean, that's, we're down in this game. Our challenge is going to be that employer of first choice when we present ourselves to our community. So, but that all is not a reason not to do this, right? It just is the challenge that we need in our organizational structure, that everyone supports the effort to do this. So don't take the challenge as dissuasion. We're not dissuading, we're encouraging, but we've got challenges as an organization, and it's a systemic challenge. But that's not a reason not to do it. So thank you for the opportunity to comment.
All right. And then Steve.
And Mr. Chair, members of the board, and to Vice Chair's observation, it's well taken. in the original packages that we brought to the board for decisions, we had and we provided to you all as part of that discussion the package on criminal justice that in addition to the new division, it included also investments in flag justice court, public defender, county attorney, as County Attorney Ring indicated, adult probation, and then under juvenile court, we just discussed one of them. And so the point is well taken, is that whenever we're making any kind of adjustments to any kind of a system, you have to also make adjustments to all of the other parts of the system. And so to Vice Chair's mindful comments, we have done that, and that was how we proposed this to the board. And the discussion, of course, right now has been focused on the new division, but again, we have investments with regard to FTEs as well as technology in the other court, the other justice program stakeholders as well. So we are looking at this within the entire system. Thanks.
So, and going, I'll go to you to finish up a little bit on your questions, Lena, but I need to pause for a minute just for the sake of the board. So, this, we knew it would be complicated, and it is taking time. It's really important that we have these conversations. Steve and I have been texting back and forth, just checking the time, what can we accomplish? Suggestion we have is that we'll finish up ARPA, and we are meeting again, I believe that it's Friday, and we have the opportunity to do redistricting after this to finish out the day, bring back the legislative and the roundtable pieces on Friday. But I need to check in with the board. Are you guys okay with this suggestion? I'm looking at you, see if you nod your heads there.
Yes.
Patrice, thumbs up. Lena, yes. Judy's nodding her head. And Geronimo is he's hidden behind the scene there. He'll pop up in a second. But okay, so we'll go ahead and continue to proceed. This way we can manage the clock in what we're doing, but manage our business appropriately as well. So swing back to you, Lena. You had a couple more questions.
Okay. Yes, and I'm going to go back to the new program that was mentioned that is costing us a lot of money, the competency restoration program. I'm gonna direct question to our county attorney and to our Judge Slayton. How do we start that? Right now, it sounds like it's staff that is doing this on the side. How do we focus on that to make sure that that is actually set in place so that we are not having to refer to outside agencies?
You're talking about how would we establish the RTC program?
Yes.
I'll turn that over to Judge Steinlage.
Yeah, okay.
So let me just say, I say that is somewhat really self-effacing because Judge Steinlage really is a statewide respected expert on the mentally ill in our criminal justice system. But that is really what, my function as a presiding judge. When I don't know it, I delegate it. and so I have great folks on there with Judge Steinlage and Kim Musselman and other folks that they've been talking to and able to work together. So I'm going to put that over to Judge Steinlage to ask how that program could come into play or come into being.
Thank you, Vice Chair Fowler. Thank you, Judge Slayton. So if you're talking about actually doing an in-custody restoration of competency, getting that off the ground, that is obviously a much more elaborate and involved and expensive task than the out of custody. So what we do know is we know how Yavapai County operates their in-custody restoration of competency program. We mainly know about it because they have sometimes presented at statewide conferences that the Arizona Supreme Court puts on. And so just yesterday, I met with Corey Ringenberg from the county manager's office, and he's apparently working on a special project, a variety of special projects. But what I did is I shared with him the most recent presentation from the Yavapai County's team that they have put in place for restoration of competency in one of their jails, just to look at. So they employ 2 social workers, a psychologist, an RN, and then they contract with a psychiatrist. So we know that. Now, we don't know that. Keep in mind, they've been doing restoration of competency for their own county, as well as our county, Navajo County, and some other rural counties. They've been kind of a hub of rural counties coming together. We don't know yet what size staff that might look like. We know that there's going to be a medication component, because our experience tells us that most often there's a link between proper, most commonly antipsychotic medication and effective restoration treatment. But there's also social workers that go over with the defendants what happens in the court. How do you work with your attorney? What are your possible defenses? What are your charges? And so we're just getting that off the ground, Supervisor Fowler, of beginning to look at that. I have for the last several years, every time the Arizona Supreme Court Office of Courts has a restoration and competency conference, I do go to that. I do my best to network, and I do have some contacts in the community in Pima County, Maricopa County, Pinal County, and Yavapai County that I'm hoping that we can utilize to figure out how to best do this specifically for our jurisdiction. It will involve a very crucial partnership with the Coconino County Detention Center, because we're talking about doing something in the Sheriff's Detention Center, and that is the Sheriff's Detention Center. That is not the court's detention center. And so those discussions need to happen. It's just when we know who we're having to send to Ash and who we're having to send to Yavapai, the court's well aware of that now. And so in our mind, this is becoming increasingly urgent, if you will. And I'm really, really pleased that I was able to, and it was because he reached out, meet with Corey Ringenberg from the county manager's office yesterday. And I'm hoping to also meet with Miss Musselman, and Sharon will obviously be involved, but it is definitely going to be a process. But what we do have going for us is that these programs are up and going in a larger scale across Arizona, Pima County, Maricopa County, Yavapai County. So we know it can be done. We just need to do it in a way that is cost effective with the resources we have here. Now, I'm the first to admit that Flagstaff and Coconino County in general, although I can't speak to the Navajo Nation, they may be doing better than the rest of us, have had a huge, difficult time recruiting psychiatrists. Many of you may know that for years, literally years, the Flagstaff Medical Center has not been able to recruit the number of psychiatrists that they need in their hospital. So that's setting aside crime and poverty. That's just at our local hospital. So there's going to be some tricky elements of this. But when we think about the cost, we think it makes sense, absolutely fiscally in particular, which we lose sleep over as well, although it might not feel like it, to try to see it through and at least attempt to get it off the ground. But it is going to be a huge undertaking. And you're correct, Ms. Fowler, like right now, we go to court all day and then we start what's called, I call it the second shift, where we start looking at all of these things and trying to figure out how to get these things off the ground. And we, the staff's going to be crucial, but I think having a behavioral health person embedded in the court system will be a first and very important step. Thank you.
Thank you. And the reason I asked that, Mr. Chair, is I'm just wondering if maybe we can do a study to help, the best route to take. I'm just wondering if that, like a comprehensive plan to help our staff to see what, like the bigger picture, put a a plan together, and that will at least help them to guide that and take some of these dollars and just put it into a plan, a study that might help them to put this together so they're not constantly just trying to figure out what to do next.
Yeah, and
Thank you, Mr. Chair.
yeah, and a follow up to that, and Steve can speak to it as others that are on the panel here, is that as the judge was just noting, they are exploring other best practices and opportunities. It is a question that I was, going to pose. While we have intent to establish some level of restoration to competency, we don't have all the expertise within our area, and so it does beg for some level of hybridization of the program. But Steve's had his hand up. I suspect you want to comment on what you've been doing with Corey or other pieces. Go ahead, Steve.
Wait. So very quickly, so Judge Steinlage raised a very important point, and so looking at an in custody is been described as is very complex. Also, it's a major investment financially, and that's why not having the sheriff with us today, I'm feeling a little like we're advancing a discussion that really needs to begin like 3 steps back and include the sheriff. And so, the point with Vice Chair to do a study, that is certainly of looking at our steering committee. And this is the reason we created the steering committee, and the sheriff's part of it. Looking at this cross-organizationally and having some pretty healthy debates about what is the best tack to take. In terms of out of custody, yes, there's certainly some efficiencies, but looking at an in-custody program, we're talking about major investments that would include the jail district, as well as how that's factored in. And I don't want to speak for the sheriff. He is the head of the detention here. And I guess I would like to say that to let's have that discussion with him present, as we should be doing at this point in time. But taking into account, we need a plan on how to approach RTC that's going to serve our purpose within the next year, but within the next 10 for the next 10 years as well. Thank you.
Make a comment.
Trying to get off my mute. There we go. Go ahead, Judy. I'm sorry.
I guess all in this whole thing, one of the big issues that we are having, as far as how we're going to sustain the programs, I think one of the things that what we really looked into is possibly, I'm thinking that there was probably a grant writer solely for certain things. I think we really need to start approaching that so that, when even something that would come down the pipeline for some services, I think we really need to start looking at this, because this is just like a 2 or 3 year, and we need, and then beyond that, we need to start preparing for that so that we're not waiting until the last minute, to try and find some funds to supplement the initiative that we're going through with. And the other thing is that the U.S. Constitution is having the state mandate these services, and yet, there's no dollars coming. And I think we really kind of need to look into that to see what can be done or how we can approach them, or, because it's really putting us in a corner, and we're trying to find out ways to sustain these programs and trying to start it off right now with the ARPA funds that we're getting. So those are the 2 comments I wanted to make, and I agree with a lot of information or things that were shared by my colleagues, throughout this whole process. And I'm not going to reiterate them, or else we'll be sitting here for another 30 minutes. But anyway, I just want to say thank you again for everyone and all your presentations that were done, and staff and people that are still here with us. So I think those are 2 biggies that we could look into. Possibly get a grant writer for maybe under Steve's shop, and then also looking at funds from the state. They should be able to give us something if there's a state mandate, where we need to do that. So I just want to say that for on these topics that we're discussing.
All right. Thank you, Judy. And yeah, that's a piece that, Steve has been handling with putting the team together and taking a look at the grant components in terms of the legislative. I tried to talk the legislators into these unfunded mandates. They just don't listen to me all the time here. But we'll continue to work on that. Let's see. We want to, Lena, are you finished your questions? We do need to move on with the presentation here too.
Yes, it looks like the judge has a comment.
Oh, okay. Which judge am I looking at? Oh, Judge Slayton. Okay. Go
Yeah,
ahead.
just picking up real quickly on Vice Chair Fowler's point. What I would propose is that the committee that has been looking at this, we put a 90-day plan, a 90-day time limit to try and to get something, and then bring it back as a work session item to be able to discuss what we found, what we're learning, be able to begin to put some format, some form to the idea, and that we put it under a 90-day time frame, just to be able to give maybe the skeleton or bring the skeleton back to the board at a work session where we'd be able to present that. I think that's a great point, Vice Chair Fowler. We need to start doing something, and we need to be able to bring something to the board. So I'm proposing kind of a skeleton format, maybe even put a little bones on it or a little meat on it in about 90 days and bring it to a work session.
Thank you, Judge.
And Judge, you're speaking about the RTC concept. Yeah, because we need to move on some of the ARPA pieces. So, all right.
So, Mr. Chair, I'm back to the RTC. Is there some ARPA dollars that are needed for a study or to launch this or something? Because this is the time we're making that decision right now. We're in that position right now. So that's why I'm asking these questions, because that sounds like that is what's draining our budget. So is there an opportunity to do something right now?
So just a quick response to that, and Steve has one too, is, a lot of this recommendation is associated with the RTC directly and indirectly, and what we've had laid out. So the steering committee, using our practitioners, our experts, that's a big piece of what this recommendation is. It's not all of it, but it is a big element of it. The suggestion that you had and that the judge brought up could be a nice follow-up of how they're putting together recommendation associated with the out service for the RTC, that Steve, you were nodding your head on that, but yeah, that could be worked out. So with that, they can come back with a recommendation, the amount that you would need associated with this study. Lena, I think they can encapsulate one way or another on it. So, and that's where you were going, Steve. Go ahead, Steve.
No, just to Vice Chair's comments. Yes, we do have certainly the topic, the parameters of the topic, some options, and we'll huddle as a group, as a subcommittee or committee to identify all of the pieces to it, and then come back to the board to identify if there are resources that we need. We may not need any. I think we have a lot of expertise and professional connections, but sometimes we don't know what we don't know. So with that regard, we can come back and if there's some study resources needed, research resources needed, we'll come back to the board with a proposal on that.
Okay, I have Judge Dunleavy. Go ahead, Judge.
Sorry, I just have one thing. I promise I'll be quick. So I'm not trying to put the cart before the horse on the in custody RTC or step on the sheriff's toes. I love the sheriff, had a working relationship with them for 17 years. I would be uncomfortable ethically and as a human being communicating with you guys about what the court's needs are, knowing that we have this ballooning expense of in custody RTC. And that I think down the line, we need to try to figure out what's best for our community. And so I'm not trying to step on anybody's toes. It's this like 9 million pound elephant in the room for me. And I just want to make sure I'm super upfront with you guys that it is ballooning, unfortunately. And it's a result of the pandemic. We never had a 4-month waiting list for Yavapai County before, or had to try to form a relationship with Pima County. It's a consequence, as you guys have been dealing with in all these different capacities as the Board of Supervisors during this difficult, unprecedented time. So thank you so much.
All right. Okay, and we need to move this along on what we have going. I do want to just one more piece on the additional court judge. We had a conversation. A piece of it is that's if we can achieve the savings, no matter what the board. If we come back in 2 years, there is a backlog that we have, and it's so important. The judge is going to act sooner or later for the speedy trial, assuring that that can occur, and that's going to open up the floodgates on it. Really important that we have it now. If we come back in 2 years, we also have to look at sustainability, but we have the opportunity with using this court to see the effects of it. And so it does circulate back to, we need to get reports on a regular basis, keep track of what's going on, so that we know we have a budget that we can obtain and maintain what we're trying to do with it. Push comes to shove, though, we might have to make hard decisions in 2 years if we don't have the capacity as well. So I'll go to Supervisor Horstman.
Yeah, just real quick, because I know we do need to move on, but obviously this is going to be an ongoing problem. It's not going to end here today. It's not going to end here next year or the next year or the next year. And obviously, I think we need to look at other possible ways. Yavapai County, for example, has really been very innovative in their approach, and I think it's great to continue to look at that. But for now, let's take one bite at the apple at one time. We need to deal with the ARPA funds. We have a proposal that's been submitted by the courts before us today. And I know we need to take a look at that, analyze it, make sure that this is the best use of ARPA funds for our county. But this is the recommendation that's come from the courts. So I don't want their recommendation moving forward to kind of get lost, because there's bigger need, there's bigger fish to fry, there's bigger concerns that we will need to address as we go forward. So thanks.
All right. And then turn to Sue.
Thank you, Mr. Chairman. With your permission, we'll move forward to the last of the proposals. Please. That's actually the $1 million proposal for the CJ system. And it includes 2 parts. It includes CJ system navigators, and it includes, and this is good news after this conversation, approximately $300,000 for a study for RTC. So in anticipation of that, and through our conversations with the steering committee, we had placed that in the larger CJ group. And if, with your permission, Erica, could you put up that final program description? I know she's working on it, Mr. Chairman. Got it, Erica? There we go. Thank you. And this was developed and actually given greater detail by a group from across the steering committee, including HHS. Judge Steinlage was a part of it as well, Sharon Yates. This is a $1 million request, and as I said, it has 2 components. The first is CJ system navigators, 3 FTE positions, and the second part is contracted services for local restoration to competencies. So it's basically a pilot program idea, and which could include, of course, consultants or a study to accomplish that. We can add detail to that as we move forward. I'll turn it over to Erica, if you don't mind, to sort of go through the details of this piece of the proposal.
Thanks, Sue. So to talk about the program overview, this really was in response to the needs across. We've talked a lot about silos and connecting between the different programs and departments in the different courts and recognizing the complexity of that system. And so recognizing that need led to the proposal of these 3 positions that adult probation has offered to house and supervise those positions, in large part, to their commitment to this entire process and their willingness to be a part of the solution, and also because they have so much of the organizational and institutional knowledge around navigating how to get someone into treatment and knowing which courts to go to and all of those different details that folks who are engaging with the system really could use that support in order to improve their outcomes and to make sure they're able to successfully complete what's ordered of them and to engage with those resources that we're trying to build up in the county. And so that's the overview of those 3 positions. There will be an emphasis on, we've talked a lot about culturally competent and responsive treatment and support, and recognizing who the populations are that we are serving most often. And so focusing on ensuring these individuals that we hire and when we write those job descriptions and develop these positions, that they have the capacity to navigate and connect with the TRIBA, with our IHS partners, and to really address a lot of the barriers that folks experience. So we've included in this proposal flex funds that are kind of the catch-all for supporting treatment, transportation, family reunification, et cetera, for those staff members to be able to navigate the systems and respond to the needs of the folks that they're serving. And that component of the proposal is about $660,000 of this overall 1 million. And then that remaining $330,000 is for those contracted services to local restoration of competency. So that is for supporting the courts and supporting our call for providers in the local communities in Coconino County, not for the individuals who are able to remain in community, but then receive those services. So that, as we've been discussing, is something that will continue to evolve as we evaluate that and evaluate the needs. But that portion of the funding is dedicated to ensuring we can successfully contract for those local restoration and competency services. So with that, I will stop there. I'm sure there are questions, but that's the little bit more detail in that program overview.
Actually, those pieces look pretty exciting. Let's see, turn to the board here. Any questions?
Can I just say something? I would just like to say thank you for this time, because I know we've kind of dragged through these questions and we've really hit it, but like for me personally, this is what I needed to understand this process better. It's filled in the gaps for me and I have a better understanding of what the vision is. So even though we're behind, and I apologize to those folks whose time who are waiting to present and maybe are going to have to reschedule because of these conversations, I really feel like that these conversations today were crucial for a better understanding to approve this, because I was feeling rushed. I was feeling the last 2 times we've had these conversations, we were given the materials late and we were asked to make decisions quick. And so this felt like today, this is what we needed, was to go through this. So I just want to appreciate and thank everybody, Erica and everybody on the team that's come to support this piece. This is crucial. Like, we got to get this right and we want to do it right, but we got to have those conversations. And there've been a couple times over the last couple months when these topics have come up, that they've been pushed to the side or pushed to the back burner or rushed. And so I really appreciated today being able to go through and get the comprehensive understanding of what this is and how it links between each other and what it's going to look like. So good job. Thank you. And like I keep saying, I think we're so close, just those final touches for that final draft of what it'll look like. So keep working hard. Thank you.
Vice Chair, Lena.
Thank you, Mr. Chair, and thank you, Erica, for covering this because I did not read it the way that you just described it. What I see on paper and what you just told us to me, is different. Maybe I was reading it in Navajo. I'll have to go back and read it in English. But, it's just like Supervisor just said, it is very helpful to go through these processes to have this explanation, not just for ourselves, but also for the community to understand what the great challenges are before our judicial system, before our communities, our youth, how do we work with our partnership? And we just went through a really important exercise. So I just want to thank all of you, our county manager, thank you, Erica, our deputy managers, and our judges. They're here with us, and it just really shows the teamwork that is being has come together, the teamwork throughout the county system, and that's what's needed, and it's what we need in our community. I don't know. I'm gonna go back and I have to reread this because what you just said, this is gonna accomplish. I wouldn't have asked all those questions if I had read it the way you just said it. Thank you.
Look, I had to cross 3 screens to get my mouse over there to get off mute. See, Lena, I said, listen to the practitioners here. Remember I was saying that yesterday.
I know.
All right. Let's roll through the rest of the board. Looks like Supervisor Horstman, have you next?
Yes, thank you. And obviously, the once in a lifetime opportunity of ARPA funding was a tremendous opportunity for us as a county, but it did not negate our responsibility on behalf of our county to make sure that money is well spent. So we certainly appreciate and thanks to all that have been part of this meeting. It has been a time-consuming process and one that the board has not taken lightly, nor has the staff, and we so appreciate all of you working together for best interests here in our community. And I think the proposals are looking very good. I really appreciate the additional explanation and basically fleshing some of that out. I think that is very helpful as we move forward. And I look forward to finally making a decision on this and moving forward with these wonderful programs and the wonderful opportunities for our community. Thanks.
And then Supervisor Begay, Judy.
Yeah, same thing. I just want to thank everyone for their presentations today. And like I said earlier, we're just going to have to tweak it here and there, and then work with others, to ensure that, we're spending the dollars the right way and making sure that, our services are out there for the communities we serve within overall Coconino County. So again, Steve, with your direction, just your staff, you've heard the board, and from there, it's all in your ball court. So, and you have a good team, a winning team. And so I just want to leave it at that. Thank you.
All right. And then go back to Sue and Steve, this wrap up associated with this. Actually, well, I guess I should probably comment too. My gosh, we've been talking about mental health in so many ways for so many years in our challenges. Here's a great opportunity. Bill, I like how you coined it. Consider it our first day of this discussion, and continued coming back and seeing what we need to do with this. So I appreciate all the work that everybody's put in. It's very complicated. It is important for the board to hear it from those that are, actually on the front line, and what you're doing and what you're confronted with, so that we understand how these pieces fit together. So really appreciate it, the presentations and everybody giving this extra time as well. Go back to Stephen. So,
Mr. Chair, Sue, did you have anything else to add?
No, I did not. Thank you, Steve.
So, thank Mr. Chair. So next week, we want to come back on the 14th and wrap it up. So on the 10th, on Friday, we'll be having a discussion on the outside funding, also on the business supports. And then what we've scheduled is time on Tuesday, the 14th, to wrap it up and to possibly make some decisions at the board level, so we can proceed on the next path, or the next step on the path going here. But I just want to check in with that in terms of how much time I want to just get a sense of the board, a couple hours at least, because we want to reserve time on the calendar on the agenda for next week. So I just want to get from you all, how much time do you think we will need, or is I'm just trying to get this right.
Can I?
Please go ahead.
So, we talked about mental health. We really just like tunnel vision mental health, but we have a greater need of economic jobs, and that was not addressed. And this is just the overall what leads into the courts. How do we relieve the courts? But there are greater issues that I think our departments are working on, and I'm just wondering why that was not included in here. Is there a possibility now we're throwing that all over, the rest of it over to the outside agencies, and I'm just thinking that there's an opportunity to address it internally as well. So you might, if you could just look at that, I think that would be helpful. And I brought it up before, and I just want to bring that up again. Yes, mental health is a huge issue, but we need to, I think, take a broader look as well to helping families to help themselves. And I think that's our role, is helping families help themselves, individuals help themselves. That's basically what we had our discussion on. And also just when you think about the economic mobility, how do we address that, and where is that in our plan? This is the one-time funding. How can we launch that, and how do we help people to be able to accomplish that?
So, Mr. Chair, Vice Chair, to make sure I want to make sure I'm accurate, or I'm proceeding correctly. So you would like to have an issue area discussion on economic resiliency, recovery, the employment, the workforce area, in addition to, I'm hearing separate from, the discussion on outside partnership funding.
Well, I'm just wondering if that is what we need to do, because we really focus, the school is focusing on youth. The $2 million is focusing on youth. And then it goes into the court system the housing for youth. That's another one that's for youth. But when it comes to women issue, which is the center of a family, that did not come through. And so where is the prevention side? These are what we're talking about, are people that are already in a situation. Now, where is the prevention side? Where do we strengthen, how do we strengthen a family so they don't fall into the program that we just had a discussion about. So I think it's, I'm bringing it up. So when you all have your own meeting, maybe you all need to just have that side of the conversation.
Okay, and that's one, for the team that's assembled for this component. The piece associated with the broader community would, as I understand, I haven't looked at your agenda for Friday, but you have that built into that discussion. Is that correct, Steve?
Yes, but I don't think we're tracking where Vice Chair is at. We had it as part of the outside agency, and what I'm hearing is that, and I'm not certainly making any other suggestions, is that I want to make sure we frame this correctly and accurately to satisfy the board's request. And so to create a block of time that focuses in on what we just spoke about is an important piece, obviously. And then also is another important piece is the community grant program. And not to dilute either one of them by combining them into one item, I guess is the intent of what we want to make sure we do correctly.
Supervisor Horstman, go ahead, Patrice.
I do, as I have indicated, and obviously, if the majority of the board feels that needs to be done before ARPA funding, then that really should be a discussion with the majority of the board. I think it is important to have these discussions as we move forward, as suggested by Vice Chair Fowler. On the other hand, I'm also cognizant of the time, et cetera, we have spent on the ARPA funding. I feel that the staff, everybody on this call, as well as the staff and county manager and deputy county managers have done a good job of presenting this and their recommendation. That is not going to be the end. It's probably the beginning of the discussion as we move forward. But I really would like to see us move forward and make some decisions on the ARPA funding.
And I guess, and I'm trying to navigate the discussion here, but thoughts are, okay, we're lined up for ARPA on Friday for the outside agency, but for economic development, or outside agency, other part of mental health. And then you're bringing the ARPA back for decisions, and you're asking for additional time associated with it. How much do we need? I saw Geronimo nodding his head. Some of these points, or go to the point that Patrice just made, but your question on women and where they fit into it. I think we have an opportunity, that you can emphasize those points, Lena. By the same token, as we saw with the design of what they're putting together, and it's not everything. I know the services go beyond that, so it begs the outside agency discussion as well on that. That's the Friday piece. We can vet those discussions, see where we are, what pieces we need to follow up on or not, and then on the mental health component that we just had, if that's a component of that. You have a chance to bring it up, before we have the decisions. But we also have the larger group here that has heard you bring up that point, and they have an opportunity to explore it. Goes back to it's the beginning of the process as well on that. So, my suggestion is we're running late. We have another redistricting piece that we need to finish up business up on. Let's proceed as we have scheduled and go with the suggestion you had, Steve, of a little extra time on that decision. Yeah, when we have the Tuesday piece
on the
on
14th.
it. Yeah.
Okay, so we'll put in a block. We'll program a block of time into that day and focus on the economic resiliency, economic development, economic recovery.
No, I think we need to go through the outside agency piece to have that discussion. and then see where it goes from that, if that's added to that day.
Oh, on
But
Friday.
yeah,
Okay. Because on Friday, we're coming together in the afternoon to in one of the topics, and it does not need to be the only topic, is the outside agency community partnership funding. So it's a topic.
Right.
We can add time to that to cover some of the other areas that's been mentioned.
right.
Okay. And
I still think internally, as you all are meeting, at least you can talk about that, have that discussion internally.
Right.
Okay.
And we
All
can
right.
definitely, because we've
you.
received examples of programs that would fit within that. And I think I'm inaccurately describing it as business supports, where it really is more of that, as Vice Chair described it. It's that menu of services or programs or resources that really provide assistance to families and individuals to remain independent, which would include workforce training, which would include programs that are being suggested to us from other organizations as well. So I hear what you're saying, and I want to frame some talking points, or I want to frame it in such a way that we're accurate in how we're rolling this out on Friday, so that we're not that I'm not creating a misstep in expectations from board members.
So, Steve, I would suggest we have between now and Friday to, just do additional follow-up on that. You already have an agenda laid out with that. If we have extra pieces that you can massage a little bit, you can work it out between now and Friday.
We'll clear my calendar to make this happen by Friday.
All right. We've been going for 2 hours. We need a break, and then we have redistricting to come back to. So why don't we take 5, and then we'll come back to, and redistricting is item number 23 on the agenda that we'll come back to.
Okay.
And it is, I have no idea.
21.
Okay. So let's try and get back about 5:25 here.
I have a question. Is that an executive session or is that an open public meeting?
Madam Chair, Supervisor Horstman, staff is going to be suggesting that the board retire into exec session. The clerk of the board has just sent out a link to you for the exec session portion.
Then, Chair, if you'd like, so we don't have to come back and then go out and then come back. If you want to go ahead and entertain a motion to go into executive session for the redistricting, when we get back from our 5-minute break, I'd be happy to make that motion, and then we can just go back into the Teams link.
Okay. Why don't we do that? All right. Actually, let's double check though. We were not planning on coming back out of the executive session, or were we planning on coming back? No, we were not. Okay, great recommendation on that. Go ahead, Supervisor Bush.
Then at this point, I would move that per the advice of legal counsel, that we move into executive session once we get back from our break.
Okay, I have a motion. I'll take the second. We'll turn to legal counsel on that. I need a second.
The motion.
I have a second by Vice Chair, and then turn to counsel. Is it advice of our counsel to go into executive session on this?
Yes, Chair Ryan, that is my advice.
Okay. All right. With that, I'll call for the vote. And all in favor of the motion, vote aye.
Aye.
All right. So for the board and those that are need to be in the executive session, we're going to a separate link. This will be the conclusion of the public section of this meeting. So we will not come back into a public session. We'll adjourn as we adjourn our executive session. And make sure for those of you that are on this particular one that you close out if you're going into executive session.
And just want to again thank everybody from the county who have spent their afternoon, actually all afternoon with us. We really appreciate your input your thoughtfulness, your concern, and your recommendations to us. Thank you very much.
Very much so, yes. Good waves from everybody out there.
Thank you all.